Hello, everyone, and good morning, good afternoon. We're about to get started here on our joint Interholgo and FSC International session, the side event at the COP26 UN Health Pavilion. It's my pleasure to welcome you all. My name is Asger Olesen. I'm also from FSC, and I'll be your moderator today. We have a panel here for a panel discussion and a good number of you following online as well. We will start out just shortly with a welcome by the FSC International General Director, Kim Carstensen, and then I'll come back to you on the game plan for the next hour session. So, let's move on to the welcome. Over to you, Kim.
Thank you, Asger, and thank you all who have joined this event, which is about healthy forests, healthy communities for a healthy world. It feels very befitting to have such an event in the World Health Organization Pavilion at COP26. It also feels very befitting to have it in the middle of a global pandemic, which we see and feel every day when we get tested, when we walk around with our mouths covered, etc., etc. These pandemics, like this one, are likely to come in the future unless we find a way to be able to actually protect our the world's forests and manage them sustainably. This is what we're going to talk about today, because we're going to talk about some of the most important forests in the world, the Congo Basin. We're here organizing this together with Interholco, who manage a big forest concession in the north of the Republic of Congo. Very beautiful area, I've seen it. Great for social issues, great for environmental issues, with a lot of potential as a model for the future. And we, as FSC, are trying to set the standards for the Congo Basin and other forests in the world that will be able to actually make sure that we can document that these forests are indeed responsibly managed. I'm looking forward to this event to hear much more from people who know the detail, who know Africa, who know forest management in Africa, and I hope that we will all be much wiser about these topics when we end here. Thank you very much.
Thank you, Kim, for that very good introduction and for really setting the scene. Now, today we have a panel of distinguished experts, as Kim just introduced, which all have experience and insights that would justify a side event just for them. But that's not the case today. We've gathered all of you here for a panel discussion. So, as you will see from the agenda shown on the screen right now, we have a session that is focused on 3 questions and answer sessions with prepared questions from our side. So each panelist will be speaking to a specific question and explaining their view and their observations, and also on opportunities for how to move forward in this topic space in the Congo Basin. Now, the game plan for today is to follow through these 3 sessions of questions and answers. But before that, we will also have a short scene setter by FSC International's African Regional Director, Mr. Harrison Ocheng, who is joining us online. I will hand over to Harrison just shortly to set the scene. And when we come back, we'll start with the first session of questions. I should say, as a last thing, that the panelists will briefly introduce themselves at the time of their first question. So, Harrison, you may also just briefly introduce yourself now for the scene setter. And then a last note would be that Mr. Lee White, who's here on the list, was unfortunately not able to join us today. So we will have the rest of the very good panel with us. Thank you, and over to you, Harrison.
Thank you very much indeed, Asger, and thank you, Kim, for the opening remarks. My name is Harrison Kojuang. I'm the Regional Director for FSC Africa Program. I'm based in Nairobi, and I'm actually talking from my desk in Nairobi this afternoon. Basically, first of all, it's a privilege to have a panel where we talk about, the Congo Basin forests, during a global forum like the COP. Having said that, I think it doesn't need any overemphasis that the Congo Basin forest, being the second largest formation of this nature globally, is critical not only for socioeconomic development in the Congo Basin itself, but in Africa in general, and also a major global player in the sense that the forests have impacts, both local and global. And if I start by saying that, well, I'm a forester by training, and over the last 20 years, I've worked in various aspects on forestry, from teaching to being in a public service, and now working with the FSC. I've been intrigued by the way forests have been perceived over the years. When I was in high school, or rather as an undergraduate, we talked about production forests. There's very little about environmental values of forests. What we now consider environmental forests were called forest influences. And it was a very minor part of our curriculum. As I started practice, the climate change debate had really heated up, to the extent that now production forest was being basically reduced, and we now elevated discourse on climate change and carbon and biodiversity and so on and so forth. To the extent that right now, forests are known more for mitigation and ecological services than they were known 40 years ago when I went to school. So it's an amazing evolution of perceptions and demands on the forest sector. But it's also exciting because forests has always been in the center of economic development in much of Africa. And the overdependence on fuel, on biomass fuel and so on, the overdependence on local trees and shrubs for shelter and all that has been central to the economic development in Africa, before you even go to the commercial interests of timber exploitation at an industrial level. So that is the breadth of the forest. Now, coming to the Congo Basin, I would like to say that the topic of discussion today revolves around me setting a conceptual framework for climate change solutions from the forest sector. And I would like to say four things. When you look at forests for economic development, and we look at industrial exploitation, one of the biggest challenges we have today is convincing the world that what we are doing in the tropical forests is actually economically feasible and also environmentally compliant. Now, that's a big challenge because we always used forests. So for us, using forests is very natural. But then we have to convince a whole world about that what we are doing is correct. So for forests for economic development, it requires sustainability criteria associated with them. Now, when you look at forests from socioeconomic development for local people in Africa who use forests as safety nets, where they get their medicines, their water, their bushmeat, whatever it is, you still come to the conclusion that regardless of the local demands on the forest resource, we still need sustainability in the forest sector if forests have to continue to play their role as social safety nets for the locals in Africa. Now, right now we've got the emphasis on forests in a climate change context. And to that extent, we have looked at the forests of the Congo, and right now we are talking about 100 and over 200 million hectares of tropical rainforests in the Congo Basin. More than 200 million, I will not dwell so much on the exact figure, but when you look at that, we're talking about ecosystem services, and forests are a big part in mitigation of climate change. So what it means is that we need to maintain as much forest cover as we can. And the ecosystem services that are generated are based on the existence of the natural structure of the forest, both vertically and also spatially, the distribution of the ground, and also not disturbing the vertical structure of the natural forest that we have. And this again also requires that the forests are managed sustainably, whether we want water, carbon, and biodiversity services. Now, as we go into climate change, the effects of it are often most serious on the poor people who live within or around forests. And you see that to that extent, we move from the discourse on mitigation to adaptation. So the forests already provide mitigation from a carbon perspective, but now adaptation, not just for humans, but for all manner of life. So you look at forests within a landscape, like let's say any country, Gabon, Republic of Congo, or even the DRC. Forests then survive in a mosaic of land uses, often competing with the production of timber and non-timber forest products. So we still need forests for adaptation in a landscape context to provide escape corridors for animals in distress because of encroachment in agriculture or encroachment of settlements. And so we need forests in that mosaic of landscapes, and to provide ecological connectivity in a rapidly degrading forest landscape. So when you look at all these things about economic development, forests as a social safety net, the ecosystem services that emanate from these forests, and the adaptation needs in climate change, we realize that forests, particularly the ones in the Congo Basin, play a central role. And that means that we have to do what it takes to maintain that forest cover, enhance its value, and manage it as long as forests remain as forests, and areas which can grow forests, which were there historically, can still regrow and restore. So whatever we do, I realize that sustainability is at the center of any discourse about climate change. And we therefore need to find ways and means and incentives to maintain forest cover in the Congo Basin as we use it for economic purposes, social services, and of course the ecosystem services, and then adaptation. That's what I wanted to share with the panel this afternoon in Nairobi and this morning, I believe, in Glasgow. Thank you.
Thank you, Harrison. Thank you very much. And indeed, we can only agree here at the COP that forests are more and more center stage. I think compared to COPs 10 years ago, there is not a pavilion, there is not a session here that does not have some element of forest to it. So forests are basically all over. Now, with that scene setter, I'd like to pass on to the panel and give the first of those prepared questions, this time for Mr. Markus Vankush from Precious Woods, whom we have online as well. So, Markus, the question for you is, what is the role of the forest sector, the forestry sector, in delivering climate-related solutions in the Congo Basin? It's a very open question, and I'm very interested to hear your reflections on that. Over to you, Markus.
Yes, thank you very much, Asger. Thank you, Kim. Thank you, Harrison. Hello to everybody. A brief introduction. Precious Woods is managing 1.1 million hectares of tropical forest in Gabon and in the Brazilian Amazon under FSC and PFC certification. We also run 4 sawmills, 1 veneer plant and 1 cogeneration plant, and then we also trade the products that we produce worldwide. I'm the Chief Sustainability Officer of Precious Woods, and I'm mainly responsible for forest operations, certification, and also ecosystem services. And I'm talking to you today from our operations in Gabon. So to your question, Asger, what do I believe what the contribution of the forest sector can be? So I see 3 main points. The first, of course, is to protect the forest area, to maintain the forest area, to avoid also in this protected or maintained forest area any forest degradation. So for me, that's the main point, the main impact of the forest industry, to really maintain the forest in its today's state, in its today's shape. And for that, we must strive away from this very actual discussion of legal forest management, really to sustainable forest management, because legal does not necessarily mean legal. So we also all have to strive also when we look at current regulations in some areas, for example, in the EU, we have to strive away from legal to sustainable forest management. And we all have to become ecosystem service managers. We have to strive away from being only forest managers to become ecosystem service managers. The second point for me, which is very important, is to provide a very clear chain of custody. Because we all know that today one of the main issues is that the customer often imports deforestation and CO2 emissions with the product without even knowing it, because he cannot overlook the whole value chain, the whole chain of custody. And here, especially certified companies as Precious Woods or the Interholco, they have the advantage that they can provide to the customer a clear picture of the chain of custody. They can really guarantee that there has no deforestation or emission involved in this product. So that's the second very important contribution that the forest sector can have to have a positive impact on this topic. And the third point, which is also heavily discussed at COP26, I guess, is reforestation, where we have a knowledge, because we all are working on research project when it comes to reforestation, to trees nursing and stuff like that. But I must be honest with you, I would rather focus on protecting and maintaining the forest instead of reforestating, because if you have to reforestate, you miss this part of maintaining the forest cover. So of course, the forest industry can give a hand for areas that have already been deforested before to reforestate them. But we should mainly focus on those first 2 points to protect and maintain the forest area and to really provide a clear picture of the whole value chain. So this is my question to this answer to this question, and back to you, Oscar. Thank you.
Thank you, Markus, and thank you so much also for sharing this observation that I think we also heard from Harrison, that we have to move from, let's say, managing forests to managing ecosystems. Now, in this first session of questions, we might focus on the state of play and observations from your respective situations and companies and organizations. Now we move on to one of our distinguished panelists here in the room, in the pavilion with us. I'll hand over to Charles Karangwa of IUCN. And for you, we've prepared a fairly open question as well, is how can IUCN help support mainstream the concept of forest-based solutions and co-create tools to verify and monitor those? So that's a pretty big question. Over to you, Charles.
Thank you, and good morning, good afternoon, everyone who is following us, and thanks a lot for having me for this panel, and great discussion indeed. For introduction, my name is Charles. As you rightly mentioned, I work for IUCN. I'm the head of land systems in Africa, and land systems covers forest, agriculture, drylands, but also other climate-related concepts, as you call them, nature-based solutions and other things. And I'm very happy because when you ask me that question, it's actually really something on my heart. I spoke with Forbes recently. They asked me, what gives you courage to do what you do? I gave a personal story and allow me to do that before I go to your question. When I had 7 years old, my parents and I, we were living in upstream of the catchment in a very rural area, and I was born actually. Our house were at the edge of the forest, and we used to fetch water just very close to the household, a very clean water, extremely clean. I don't remember actually a clean water as what I used to see in that area. After 5 years, when I was 12, unfortunately, that entire forest was cut. And the first thing I remember when I was going to primary school, I was in primary 6, I was beaten by a wild dog because actually the habitat was completely destroyed. There was nothing. And then the animals wildlife started coming out of the forest and running in the neighborhood, eating little kids and hurting them, and including myself. So I spent about 6 months suffering of that serious wound from the wild dog. And good enough, my parents had done a good job of me getting vaccination. So, but that kept me growing in my interest in nature and forest. And one thing that I remember, which is very scaring, is when the small river where we used to fetch water, the source, completely changed the color after that. And we started seeing the water, instead of being clean, it was full of mud and soil and clay. And of course, I couldn't relate with deforestation upstream. I couldn't link those things. I was so naive. I was in primary. I went to secondary. My background, I'm a development economist who ended up going into environmental policy mostly because I wanted to challenge how things are done in my time. So back to your question, and again, speaking to what I'm doing, my role is really to drive the IUCN work on forest, mostly trying to stop degradation, but also restore what has been degraded. We cannot ignore that, and I will come back to how we link these concepts. And speaking to the Congo Basin in particular, which is a very critical ecosystems in Africa, but also globally, I think it's very important to consider what do you want to see in the future, in the next 30 years, when most of us here, our little kids now, will be the one leading our countries and making decisions. So I imagine a scenario where if the same trend of deforestation in the Congo Basin continues at the path it is today, though it is the least degraded anyway, I don't think in 30 years from now we would have the same ecosystem. Definitely it will change. And how do we reverse that? So one of the opportunity we have in that area is what Marcus said. He wouldn't see it as important, afforestation and restoration. But actually, until we have enough of alternative forest products outside the critical intact ecosystem, forests will continue to be degraded because communities need to use forest products. They need forest for cooking. They need forest for food. They need forest for construction. So we need to grow forest outside these intact ecosystems for community use. So restoration of degraded area is very, very important. And that's one of the opportunities, and IUCN is pushing for that through the Africa 100 initiative. And I'm happy that actually countries in the Central Africa region committed already 37 million from Chad to DRC to Congo to Central Africa. They all made these ambitious commitments. Why do they care if they see that Congo Basin forest is enough? It's not enough because the demand of forest products is that big, and we need to continue investing in sustainable management, promoting smallholder forest, and actually it's another opportunity where I think we need to put a lot of efforts. If we want to really sustain this intact ecosystem, we need to engage smallholder forestry systems under development as part of the solutions. The second, I think, is of course restoring agricultural lands, because this is we keep saying that agriculture is a big driver of deforestation, but yeah, we need to invest in a sustainable management of farmlands for soil health, but also for other wood and timber forest products, because agroforestry can provide alternative to what we go to look for into intact forest. I just want to quote a couple of numbers here as I speak, which is quite interesting. We just did a study recently by Vivid Economics looking at the opportunity for regenerative agriculture. And surprisingly, investing in regenerative agriculture can actually increase livelihoods up to 300%. This is just growing trees on farm, which provides alternative to timber products. Finally, there's a number of other concepts IUCN is providing, putting on the table. Nature-based solutions is one of them, which again provides quite a great opportunity for growing a solution that could protect our forest. And you're asking me a question just to close on how do we monitor that? And I think the science and technology is on our table at the moment. We can no longer failed to monitor the changes in land use and land cover, because the science is there, technology is there. We have all the high-level imagery that are available that could help us. And one of the tools we just put out recently is what we call restoration barometer, which help actually countries to monitor how much they are investing in restoration, how much they are recovering their degraded areas, but also how much jobs are being created from that. So I think there's quite a number of opportunities in the Central Africa region, in the Congo Basin region, and should we decide to invest in protecting the Congo Basin, we need to invest equally in restoring degraded ecosystems for people and nature. Thank you.
Thank you, Charles. Thank you very much. I'm very grateful for also the personal story that you shared there. I think that shows very much at local level or micro level what it is we would be facing at global level with the deterioration of ecosystems and loss of forests. Now, there are many interesting things there. I'm in fact quite sure that we could be doing a side event just on some of your perspectives, but that will have to be next COP. Now we'll take a different perspective. We'll switch a bit more to the market perspective. And we have Mireia Vilaplana from South Pole with us. And Mireia, introduce yourself and then reflect with us on what are the challenges for impact investment in ecosystem services solutions for climate change in the Congo Basin. Over to you.
Thank you, Oscar, and hello everyone. Good morning. My name is Mireia. I work for South Pole. If you don't know South Pole is a project developer. We develop and finance carbon emission reduction projects worldwide in Asia, Latin America, and Africa. As well, we have developed more than 700 projects so far, and we started back in 2006. My background is on environmental science. I'm Spanish but based in London, and I'm the director of the Climate Policy and Carbon Markets unit at South Pole. I'm representing the teams at South Pole that work very closely with forestry projects worldwide and source this type of projects as well. So I'm hoping that I'm doing a great job here on pulling some numbers as well, as Charles mentioned too. Going back to the question that you mentioned, challenges, I think that before even just touching on challenges, we would really like to highlight the opportunities that nature-based solutions projects bring into the market as well. Considering the existential crisis that we are in, the existential environmental crisis that we are living with accelerating destruction of nature and also climate change, we believe that nature-based solutions are the most prominent solution that you can have to create impact on carbon market investors. Why we say that? Developing nature-based solution projects has the power to create environmental, social, and economical impact at the same time. So these type of projects can be, for example, REDD+ projects that avoid deforestation, lower emission reduction, enhances biodiversity, works with local communities and their livelihoods. They do sustainable forest management as well, which allows local timber production and conserves the forest. At the same time, we do have blue carbon projects as well that bring that double benefits for climate mitigation and adaptation at the same time. We have agroforestry projects as well that deliver and enhances biodiversity. So there's quite a lot of solutions that are being put there for the market just to explore those opportunities. Now, going back to the challenges of all those projects, what we encounter is that there are many parties involved in nature-based solution projects: the local government, local communities, project developers that like us, standards. So the project structure of this type of solutions and projects, it's quite complex, and it requires a clear set of benefit mechanisms that can be put in place in order just to navigate this constellation, and also setting local tenure protection as well in most of the cases. For reforestation projects, for instance, just to give you an example as well, they need investment at the beginning. They don't have a good return in the first years, but later on they are successful as well. So that's another issue that, or a challenge that this type of projects has. Most of those projects have high transaction costs, so they need or they require this type of like a cost just to provide the due diligence that it's needed in these projects to meet both financial and also biodiversity criteria to develop and register these type of projects. So in a nutshell, nature-based solutions require long-term commitments from at least a project developer perspective, funding and proactive also project management. And we believe that it's fundamental to have implementation partners on the ground that can actually support the development of those projects. Without them, I don't think that you will really have like a nature-based solution project being so successful. And maybe later on I can discuss a bit further on projects that South Pole is doing, not in Congo per se, but in other countries. Thank you.
Thank you, Mireia. And very good to get this broader perspective of the opportunities out there and see at project level. Now we've had observations also very much at the policy level, at the restoration and so on and so forth, but also now at project level. Now, this concludes the first round of questions and answers. And the first round was very much, let's say, open play. You all had an opportunity based on a fixed question to reflect and come up with your observations in this space. Now we move into the second round. The second round is a bit more on what we have learned and where the opportunities are. And here I'll be a bit more strict with you on time so that we can follow the agenda and have time for reflections in the end. So now we'll go through with another set of questions, 3 minutes for each speaker. I'll keep track of that. And an important part here, is just an encouragement from my side, is that if there is anything that some of the other speakers mentioned that in your reflection is relevant, please do pull that in to your reflection so we start connecting the dots. That is indeed the purpose of this second session. So we start out with my good colleague in Nairobi, Harrison. There's a long question for you, Harrison, and still only 3 minutes. It's what are the opportunities to accelerate the delivery of positive impacts on ecosystem services, including carbon and biodiversity at landscape level in the Congo Basin? So now here we're introducing the landscape level thinking, which I'd like to be, it'd be good if that could be mentioned throughout. Reflections on how can we do this at landscape level. Over to you, Harrison.
Can you kindly repeat the question?
Yes, it is. What are the opportunities to accelerate the delivery of positive impacts on ecosystem services, including carbon and biodiversity, at landscape levels in the Congo Basin?
No, thank you very much indeed. First of all, I must say that we have recognized the concept of ecosystem services in the Congo Basin. And just yesterday, we got approval from the PPCF grant to pilot the application of ecosystem services with 3 certificate holders. I think Interholco is one of them. So we are going to have this as a learning experience. What are the opportunities? I think the fact that we have huge high rainfall, should I say rainforests in itself, is a very good opportunity for biodiversity. It's a very good opportunity for carbon. It's a very good opportunity for water and so on. What I see is that it also gives an opportunity for certificate holders to get a little more benefit from selling ecosystem service claims which are verified, and also local communities who are stewards of forests can also do the same. So the opportunities are there, but what I think we need to do at the moment is to develop more CSR markets for these service claims. Should I say verified ecosystem service claims. There's a lot of interest in the Congo Basin, and I believe we should be riding on this interest as an opportunity to actually say, to save the Congo Basin forests, we have to work with the existing certificate holders, prospective certificate holders, and local communities whose stewardship can then be marketed for the benefit of all the parties managing forests in the Congo Basin. That's what I would like to say. And because ecosystem services claims are based upon sustainably managed forests, meaning certified forests, I think it does add a layer of positive complexity to certification. It adds benefits of certification to the entire Congo Basin as they manage the forest for themselves and also for global benefits. That's what I would like to say at the moment.
Thank you, Harrison. And I believe what you refer to here as ecosystem service claims, that's what the outcome of the ecosystem service procedure, which is an offer FSC has, which you can add on top of an FM certification as it is right now, and that would generate these claims. I very much took notice of your use of the quote, positive complexity. I think that is certainly something we do need to appreciate to address many of these issues. It is not simple. Thank you, Harrison, also for the brief nature and precise nature of your intervention. I'd like to move on to Mr. Markus Vankush from Precious Woods. And your question is somewhat shorter here. It will come on the screen as well. What would be the long-term vision for sustainable timber supply chains in the Congo Basin? And I might add here, to drive sustainability at landscape levels. Where do you see that sector moving?
Yes, thank you, Espen. I might answer this question very specifically also for my company. So what our vision is in this context. So one of the main, or the primary vision and the primary objective we have, and I guess all other certified companies too, is to increase the certified area. So we must add certified and sustainably managed forest area in the Congo Basin and in the other tropical forest areas. And we must increase local added value. So basically provide more quality employment in remote areas, because I'm very much in line with what Charles said, that the local population will always and must use the forest for other products than timber, but by providing more employment and local added value, we can take some pressure away from the forest. So the first point, that was the second point, and for the third point, which is very important, is the use of new technologies to increase yields, to increase production depth, and also efficiency. This can be in the forest, for example, through the satellite-based solution for forest inventories to have a better overview of your resources, or to improve the techniques in your sawmills. I see that under the keyword of sustainable intensification. So basically, we must intensify the use of the timber without necessarily increasing harvesting volumes. So better using what we are harvesting today. And the fourth point is that we have to continue our way from being a forest or a timber provider to becoming an ecosystem service manager and a provider of nature-based solutions. And I guess that the certified companies, including Precious Woods and my colleagues from the other companies, we are already quite far, but the industry still has to go a long way to come away from this idea of only being a timber producer. And I guess I'm here also in line with Charles and Maria, that we have really to focus on to become ecosystem service managers, which then also implies the wider landscape, and not only to provide timbers on a nature-based products as a whole. Thank you very much.
Thank you, Marcus, and thank you for again bringing up and underpinning this important point of moving from timber provision to ecosystem service managers. I suppose that goes for just about any landscape manager at any level, that we need to move from producing commodities into managing landscapes and internalizing all of the benefits. That was very clear and brief as well. Thank you for that. Now I'd like to turn back to market perspective and over to Mireia. Now we've heard, Mireia, a bit on both this very local level. We've heard about landscape level. We've heard of the role of the forest sector and supply chains, and the increasing role of shifting towards ecosystem service management. I might here quote Harrison again and say, this is a lot of positive complexity. Mm-hmm. How to get that into quite clear project ideas and project setups that can serve ecosystem service markets. So from a market point of view, what are the opportunities linked to that? Would be my question. Over to you.
Okay, thank you. What I didn't say in my previous intervention was one of the flagship projects that South Pole has. It's in Zimbabwe. It's a forest protection project, the Kariba project it's called. This project was launched back in 2011, and the project has been preventing more than 3.5 million tons of CO2 per year since it started, preventing deforestation and land degradation in Zimbabwe of nearly 785,000 hectares of forest. I think that was achieved through promoting regional sustainable development and the independence and well-being of the local communities that really took over on the management. So that would be one key point just to take into consideration. What we see here as well from the market perspective is that there's much more interest on biodiversity projects. They are strategic for the communities that they live in those territories, and at the same time, a lot of companies are planning just to invest on this type of project. So I think that from that perspective, we have the momentum created. We just need to take it to the next level somehow. How can we do that from the carbon market perspective? So the biodiversity credits work the same way that the carbon credits. They have two different markets, voluntary and compliant as well. For voluntary, it goes into the same steps that carbon. In the case of the compliance, it's much more interesting because there are regulations in place that are forcing certain companies that are destructing certain ecosystems in place in order just to protect them. That net gain that you achieve with that protection is what can be then sold through a financial mechanism that it's the biodiversity credit. We're exploring quite a few projects on that front because we feel that that's what the market is somehow demanding at the moment, and always just thinking on the local communities that live in those territories that can really become those environmental system managers as Marcos was mentioning.
Thank you, Mireia. Really enchanted by this idea of how to get all that complexity into just one unit. That must be incredibly difficult at project level. And that's another topic that might deserve its own side event. Let's note that one as well. Now, the last speaker for the second round would be you, Charles. And mostly because of the background that you have and also the story you told before, I'd like you to reflect on very much this landscape level of what we're talking about today. So maybe you could put a few words to what are the opportunities to accelerate payment for ecosystem services in its widest sense at landscape levels in the Congo Basin.
Yeah, great question. And it speaks again to what other previous speakers said. I think we are seeing a couple of words here: communities, landscapes, ecosystem services. And we also have to recognize that the market of ecosystem services has actually underestimated the value of ecosystem services provided by forest, etc. And this is the core challenge. Even the communities themselves, though they are beneficiaries, they still need to be educated about the same. And the challenge around this topic is really around the functionality of the real payment for ecosystem services. We make it overly complicated, and it's not. It's not complicated. I have a couple of projects at landscape level where we are working with 700,000 households in Rwanda to restore a catchment which is hugely degraded, working with a private company doing hydro, others doing producing beer, Heineken, and we have another project in Uganda. So there's a whole demand and supply aspect. And if we could look at the landscape in that, who needs what and who provides what, it makes the science more easy for everyone to understand. It makes the market easy to negotiate for farmers. And in this particular project, when I remember when I started talking about this, again, the issue of siltation downstream was extremely huge. This small hydropower plant had closed for nearly 5 years because siltation and stones in water disturbed the entire system, and for 8 years it didn't work. Now, until we had to sit together and say, where's the problem? How do we start? So we started doing little assessments with the communities, and the communities took a lead in restoring and stopping the all agricultural work around the river alongside almost the 700 kilometer both sides to protect that river. And the company decided to invest them. And I personally had done a study, an economic analysis of that. They had actually, just to maintain that system, the cost had increased in nearly 7,000% of what they used to do before the forest was destroyed. So that's the economics. There's a cost of degradation, and there's a cost of restoration, but actually it's better and much more sustainable to pay for these services to communities than just waiting until we pay the cost of damage. That's one. And the second, I think, is I think stakeholder engagement in the landscape is very key, and recognizing as players in that landscape. One of the other interesting projects we are developing in Uganda is with Coca-Cola, which has a huge plant downstream, and they came to us and the government of Uganda saying, what do we do with this catchment? There was a huge, again, water problem, water crisis, until communities decided we won't do anything until we get incentives of what is happening. So the first seed capital was $500,000, which helped actually that whole micro catchment to be totally changed. I personally witnessed that, and I'm really happy that these things work. They are not just, things of bra we talk about here. They are things that work. So making the concept not very complicated, engaging stakeholders in the landscapes, and giving value to these services can help us actually use subsidies and investments and grants in a right way, but also in a sustainable manner.
Thank you. Thank you so much, Charles, for that. And again, I hear a positive complexity in the background and how we can should not overcomplicate again when we then do the actual payments. I'm very much with you on that one. Now that concluded the second round, which was more on the reflections on the opportunities. Now we go for the third round. And I must apologize for a treacherous double I in the slide up here that found its way in. But nonetheless, this will be, let's say, the concluding round, where I'd like to give you, in view of time, 1 minute each to just briefly reflect on how can we all work together across markets, across landowner levels, across research organizations, certification bodies, forest sector actors, financial institutions, and so on and so forth, to realize these positive impact on ecosystem services and associated payments in the coming years. After that, short round, and I'll be a bit strict on the time. I'll do a short recap and then hand over to Kim for closing remarks. So this is the same question to everyone, and maybe this time start with ladies first. So Maria would kick us off here.
Yes, my pleasure. Thanks so much. So as I mentioned, and Charles was now just saying, is like partnerships, I think, that are very important. We conveyed that message in the past to questions that we made. So South Pole has been always very close to finding good implementing partners on the ground that can really just take over on the management of the project. So I think that for us that's key for the success of the project, as I explained on the Kariba project. And it shows that a lot of like co-benefits for the locals, and the success is there when you do that. So we're really exploring a lot of like partnerships at the moment in DRC to develop REDD+ projects, I would say. Yeah.
Thank you, Maria. Very good. We'll recap after the full round. I'll hand over to Charles to take the next one.
Thank you. 1 minute, just very briefly. One thing I like about my job is that I used to be the head of forest only, and then yeah, after several discussions, we created a new unit called land systems. I like it because I look at a landscape. I don't look at segments of this forest, and then this is a park, and then this is agriculture, and it gives me a multi-stakeholder picture of who is doing what, and how do we actually work together to deliver a nature positive return as a landscape for community, for biodiversity, for climate change we are talking about. So my really key takeaway even from this discussion as I talk about the Congo Basin is let's not look at Congo Basin forest in isolation. Let's look at Congo Basin forest in a mosaic landscapes, in a landscape where people and population is going to increase. There, the demand is going to continue to be high. And with doing that, we can actually solve the puzzle by not forgetting the role of sustainable agriculture, sustainable investments, but also the core livelihoods of people who depends on these ecosystems.
Fantastic framing. Thank you there, Charles. And I think that was also a brilliant bridge over to Marcus.
Yes, thank you. And I will again just add on what Mireia and Charles just said. Uh, for me, the most important point would be real public-private partnerships. So really the government and private industry working together. But as was mentioned by Charles and Mireia, it's just too complicated today. Public-private partnerships are mostly too complicated. We have our daily business and we don't have the resources to invest that much time in those complicated constructs. And we need to make it easier to have such partnerships, and we need coordination. Thank you.
Thank you. Can only agree to that as well. So all actors working together, which was kind of also the type of questions I would be looking for here in this round. Now, Harrison, you will be able to close us off here. And I do know from past that with your 40 years of experience here, you would be able to give us a complete regional and scientific roundup. But I would ask you to keep it to 1 minute here and try to close this debate before we hand over to Kim for the closing remarks. Over to you, Harrison.
Thank you, and I will not say very much other than to support what has been said. But I think from a policy perspective, I would like to see a lot more emphasis on forests and natural vegetation as natural capital that should be put to good use and conserved and enhanced. And so if there's a policy viewpoint from the national level, then it's easier to communicate and talk about partnerships. And again, what was said before, we should recognize the cost of degradation is often quite high. So if we can be emphasizing to policymakers that forests and natural vegetation are natural capital, and the costs of degradation is quite high, then we can then have a rallying call around what we need to do to employ the natural capital for biodiversity conservation, climate change mitigation, adaptation, and so on. That's all I think I can say at the moment. And of course, a certification process like the one FSC drives is a very good way of indicating that we are doing the right thing. Thank you.
Thank you, Harrison. Oh, very well done. Before we hand over to Kim for the closing remarks, I'd just like to extend my thanks to colleagues Pina and Amy and Rosie for ideating, getting the idea for this event, pulling together all partners and panelists, and for the planning of the organization of the whole event. Thank you so much for that. Now we'll leave it to Kim to try to change the positive complexity and congest it into a few closing remarks. I suppose that's what we have Director Generals for. Over to you, Kim.
Well, thank you for that challenge. I found this event truly fascinating, starting from Harrison's story about how the understanding of forests has completely shifted from when he was a kid in school 40 years ago and up till now, when moving from every focus on production, every focus on development to a focus on, well, still development, still production, but of something different. It's now production of climate benefits, it's production of biodiversity benefits, etc. I found also fascinating the point that Marcus made about, well, it's all about what do we want from the forest. And that whole paradigm discussion that we're having at the moment, the paradigm shift that we're seeing, what does that then mean for what we want to see the Congo Basin as a series of landscape or as a mosaic of landscape actually contribute? And it's not just about one thing. It's not just about biodiversity. It is about biodiversity. It's not just about climate change and carbon. It's also about that. But it's also about the local communities and the people there and the rural poverty, but probably also about the urban poverty. Because, I mean, the future poor in Africa are going to be urban dwellers. And how are we going to use the forest or make the forest actually contribute to their lives in terms of construction, in terms of other products that they will need to come from the forest? And those challenges I find truly, truly interesting. Of course, as Mireille said, there's no way that this can be done without looking at partnerships, because we need to work in partnerships, and there's not one perspective, there's not one organization, there's not one type of working that will solve it all. We need to come together, we need to listen to each other. Also, as Charles reflected from his own childhood, I love that story, and how something that you have nothing to do with, you don't understand, actually changes your life. And that understanding, I think, is crucially important. I think this is so much about the understanding of the value of forests, understanding these different dimensions of the value and how they contribute to our lives and to the health of the planet. And all of that, I think, is crucially important. And I believe we are getting wiser and we are getting to a better understanding of how that value actually is and how we can make sure that the value is actually rewarded. So it's not just about selling timber, it's not just about producing timber, it's also about that, but it's also about actually recognizing and making sure that the other values are respected and treated in a way so that they will also be there for the future. Maintaining forests, as Marcus said, is one dimension of it. Protecting some, using some, intensifying the use of other parts of the landscape, all that needs to be part of the equation. So thanks a million to the panelists. Thank you for those who were listening to this event. I'm wiser now than I was an hour ago, and I hope that is true for all of us. Thank you so much.
Thank you, and with that we conclude in time. Have a great day.
Hello, everyone, and welcome to our session here today. We're very excited to be having this webinar event, Nursing Leadership at the Intersection of Climate Change and Health, Influencing Policy and Systems Change. This event is co-hosted by the International Council of Nurses and the Alliance of Nurses for Healthy Environments as part of the health program of the UN Climate Change Conference, or COP26. My name is Kara Cook. I'm the Director of Programs with the Alliance of Nurses for Healthy Environments. And as you are seeing in the room as well as online, we have some folks virtually attending this webinar as well as in person. So it's very excited to have everyone here and to have such engagement from the room. The theme that has been echoed throughout this COP is that the time for action is now. And nurses, who make up the majority of the health workforce, are well poised and can make a powerful contribution to both mitigate climate change and to support people and communities around the world to adapt to its impacts. I'm thrilled to be joined by representatives from both the Alliance of Nurses for Healthy Environments and the International Council of Nurses, as well as 3 phenomenal nurses who are exemplifying nursing leadership on climate action, influencing and advocating for change at institutional, systems, and policy levels. And to share opening remarks, I'd like to turn it over to Howard Caton, who is the Chief Executive Officer of the International Council of Nurses. Over to you, Howard.
Kara, thank you so much for helping to put this session together. I'm very conscious you're going to hear from some fabulous nurses during the next hour, and I don't want to stand in the way of that. But I do want to say that I'm delighted how we as ICN have been able to come together with other nursing groups, with other healthcare professionals, and to ensure that the healthcare professional voice has been louder, I think, than it's ever been before in relation to climate change. We are in absolutely no doubt that human health and planetary health are intimately intertwined and interconnected. And as you will hear, it is because nurses see in their daily practice the impact of climate change on individuals, their communities, and health in both a physical, a mental, a psychological sense, that we have a very legitimate and authoritative voice, I believe, in relation to climate change. And of course, you know, with just hours to go, and whether a deal is in sight and whether we're going to hit 1.5 or not, we are some of the key people who are going to have to deal with the consequences, with the fallout, with the outcome of whatever the result of these negotiations are. I did want to say that you're going to be hearing from my colleague Erica shortly, who'll tell you much more about the detailed work that ICN has been doing. Climate change has been a strategic priority for our board. We recently supported the WHO launch of their report and the healthcare professional letter, and I noticed that we were starting to get some pushback on social media for intervening, for nurses and health professionals intervening. People who were criticizing health professionals for, they're trying to reframe climate change as a health crisis, suggesting that in some way it was it was a trick or it was non-legitimate. And in response to that, it's just made us more determined to call out the fact that climate change always has been a health issue. When people have gotten sick as the planet has warmed, and it is nurses and healthcare professionals who've had to care for those people, but who haven't just treated the symptoms, have looked to the cause, and the cause is climate change. So those people who perhaps think that we're reframing in some way perhaps need to look a little bit more closely at the original picture. I suspect that some are also a little nervous about the authority of the voice that we bring. Nurses, doctors, many of the healthcare professionals consistently come out as the most trusted of all healthcare professionals. There are lots of reasons for that, but I just wanted to also highlight that one of the key reasons, I believe, is that nurses around the world work to a code of ethics. ICN has just recently revised our code of ethics, which is used by many nurses around the world. And that speaks to the principles of nursing practice, of respect, of non-discrimination, of the upholding of rights, but it also includes a section on global health and the importance of sustaining and protecting the natural environment because of its relationship to health as well. So it's not just an issue of nurses seeing the impact of climate change in practice. The voice that we're exercising in relation to climate change also comes from a place which is about the ethical foundations on which nursing practice is founded. Enough from me, and I, like you, really looking forward to hearing the voices from some of the nurses on this call who will tell you in much more detail about the relationship between nursing and planetary health, and delighted to be able to support this along with our colleagues from the Alliance for Nurses for Healthy Environments. Thanks, Cara. Back to you.
Thank you so much, Howard. And then I'd like to turn it over to Katie Huffling, who is the Executive Director of the Alliance of Nurses for Healthy Environments.
Thank you, Cara. And I want to say thank you to ICN for your wonderful partnership in bringing this event together, and to the WHO for your work elevating climate change as a critical health issue. Also, thank you to everyone joining us here today and online, and to our wonderful group of nurse experts. Your leadership on climate change and sustainability is truly inspiring. For those who don't know our organization, the Alliance of Nurses for Healthy Environments, we're based in the US, and we work with nurses and nursing organizations around the globe at the intersection of health and the environment. Being at COP26 for the past week and a half has really highlighted for me how important nurse leadership is now and will be over the next few years as we try to prevent the global temperature from increasing more than 1.5 degrees Celsius. As the largest portion of the healthcare workforce and as one of the most trusted professions, we have a moral duty to work together and with our health colleagues to transform the health system into one that is regenerative instead of extractive. We have the skills and training to eloquently provide the compelling stories, along with the science that can help inspire our patients, communities, workplaces, and policymakers to take strong climate action. And we have such an amazing opportunity to improve health and prevent disease when we address climate change. Also, with our vital role in combating the pandemic, we are in the public eye as never before. We can harness this increased visibility to show the public and policymakers how nurses are working to address climate change and urge them to join us in addressing this urgent public health emergency. This past June, Patricia Butterfield, Jean Leffers, and Maribel Diaz-Vazquez published the paper Nursing's Pivotal Role in Global Climate Action in the British Medical Journal. They provide a framework for how nurses can expand their role in addressing climate change, and the examples of nurse leadership our panelists will be describing here today provide real-world examples of how nurses are already filling these roles. This framework consists of 5 recommendations. First, accelerate change by leapfrogging nurses into leadership roles, which includes elevating nurses into executive leadership roles, building partnerships globally amongst nursing organizations, and paying nurses for their climate change work, which I think is very important. Second is give nurses and nursing students the skills they need to create the future. This includes mandating climate change in nursing education curriculum, integrating sustainability and climate change into professional education, and educating individuals, families, communities to deal with mitigation, adaptation, and resilience strategies. Third is rekindle activism, advocacy, and relentless truth-telling. By amplifying the voices of nurses and advocating for policies that promote planetary health, increase biodiversity, and decrease air and water pollution linked to climate change. The fourth is ensure a global lens by extinguishing Western-based biases in climate action agenda of nursing. We do this by promoting the voices of nurses of low and middle income countries within the climate change arena and adopt successful climate change strategies developed in low and middle income countries as models for countries around the globe. And the fifth is put equity, justice, and morality front and center by including health equity in all climate action agendas. Endorse an intercultural approach in indigenous areas to guarantee the right to health and a healthy environment. Holding corporations and governments accountable for their role in this climate emergency, and advocate for healthy communities for all. Again, thank you to our panelists here today, and I look forward to hearing about your roles in nurse climate leadership.
Thank you so much, Katie, for providing those powerful comments to get us started on this webinar. I'd like to now turn it over to our colleague at ICN, Erica Burton, who's going to share global perspectives on nurses, climate change, and health. And just to introduce her, Erica is a registered nurse, certified global nurse consultant, and senior policy advisor on the nursing and health policy team at ICN since 2015, and is leading the climate change and health work at ICN. Over to you, Erica.
Thanks so much, Kara. Hello, everyone in Glasgow and online. Thanks for joining us today. For those of you who don't know, ICN is the global voice of nurses, and we're a federation of over 130 national nursing associations around the globe. So with 27 million of us, it's clear that we have a very loud and very important voice. So for the next few minutes, I just wanted to cover from a global perspective and from the perspective of ICN what this role in climate action looks like and some of the work that ICN has been doing in this area. We've seen that nurses are and can be leaders in the climate space to create not only climate resilient health systems, but also things like raising awareness within the nursing profession, within the health profession, and in our patients and communities, mitigating climate change and supporting people and communities to adapt to its impacts as well. And we're very strong advocates. I think this is because, as Howard said, we're already witnessing and responding to the effects of climate change on the health and well-being of people. And so we're already leading in this area. We're seeing people who, have bronchitis, have worsening asthma from air pollution, from the wildfires that we've seen across the world in the last few years. Nurses who are working with children in rural areas are seeing, really high death rates in children under 5 from diarrheal diseases because they don't have access to safe water sources. So I would say that we are already leading and we're already pretty strong in this area. But there's certainly more space and more that needs to be done. So what needs to be done? First of all, we're very strong patient and community advocates. And so we can be the voice for climate vulnerable populations. Of course, we know that climate change is hitting those who contribute the least to it and who are the most vulnerable. So, for example, when nurses are in the community caring for older people or for people experiencing homelessness who have heat exhaustion and heat stroke, we've seen this year these intense heat waves that are happening, not only in Australia, but all the way around the world in the north in Canada. And so just, looking out and standing up for these vulnerable groups is one of the, strongest areas that nurses can be in. I think that this topic is somewhat new for nurses, and we have to be a little bit honest about that. And we know that in some countries, we see nurses engaged in climate change, but in other countries, less so. So just raising awareness of the health implications of climate change, how to assess them and how to address them, I think is really important for those of us who are already engaged in this work. And this can be done at many levels. For example, ICN encourages our NNA members to develop policy documents on the subject to get members and their members engaged and informed in the topic. As well as at the education level, nursing educators are working and will need to continue to work to to embed the concept of both sustainability in healthcare, but also climate change related knowledge into nursing curricula. This also goes for post-registration and continuing education as well. We also know that our chief nursing officers at the country level have a really important role, and their role in developing national action plans around this for policies for mitigation, for adaptation, for resilience strategies, I think is really important, and then including in environmental health and justice policy making as well, and not only just in the health sector, but in other areas. Within health systems, nurses can lead and support the development of models of care that reduce, for example, unnecessary travel, which we've seen a lot during the COVID-19 pandemic, and the impact that has, or the positive impact that has on our environment, or climate-informed health programs for emerging infectious and communicable diseases is also another example. And then as well at, nurses on the ground level, we encourage nurses to get involved in environmental health committees in their places of work, and policy development that looks at, the safety and protection of health workers, but also the management and the regulation of the healthcare environment. And then within that, we can also advocate for policies that reduce healthcare waste and support correct waste management. And then there's also the important piece of having nurses engaging in health and climate research. And I know that Katie mentioned the article in the BMJ, so that's a fantastic example of how we're getting into research and publications. So ICN has been working, as Howard mentioned, over the past few years with our members, our NNA members and nurses around the world to help the nursing community engage with this issue. In 2018, we released our position statement, which you can find on our website. And also, we sit on the WHO Civil Society Working Group to advance action on climate and health. And this was a group that was formed in 2017 that brings together the WHO and representatives of leading NGOs around the world to tackle climate change. And it looks at healthcare system reform, research, peer education, advocacy, emergency response, and policy development. And so members work not only within their own agendas, but also collaboratively to try to increase this engagement of the health sector in climate change. We are also proud signatories of the Healthy Climate Prescription Letter, which I know was released this week. And I hope that you were able to sign that, or you're able to attend the launch of that. And that was to 197 of the government leaders at COP. With over 300 organizations. It was an extremely powerful letter. And this is, examples like this are very powerful examples of how we can use our collective position, including, as Howard mentioned, as the most trusted healthcare provider, but really as a health team and a health community to advocate for policy change. The last thing I'll mention as well is that there is also a need to build capacity within the health workforce and within nursing to react as well to disasters. And so we've seen this very clearly during the pandemic. But last year, ICN released the new disaster competencies. And these are used by national nursing associations, nursing education programs, organizations participating in disaster. And so I encourage you to go look at those and to use those as well in the work that you do. So with COP having this health focus for the first time, I have no doubt that these activities around this area will only increase, and we're really excited about that. So thanks so much, Kara, and I will turn the floor back to you.
Thank you so much, Erica, for providing that framework for how nurses can be working at the intersection of climate and health. And being here on the ground, I want to echo Erica's comments about how health really has a big presence here at this COP, and that is very exciting, and that's the first time that has happened. And I just want to, before turning it over to our panelists, I just want to briefly mention an initiative that Annie has been working on, as well as in collaboration with a number of our partner organizations around the world. We have been working over the past 6 months on a climate justice agenda for nursing, which we will be officially launching tomorrow. And as nurses, we know and witness how climate-related impacts are unjustly burdening people in frontline and frontline communities. And so what this agenda for nursing does is it seeks to identify a path forward for nursing that centers the worldviews and knowledge of those who have been historically marginalized, and to act as a starting point in developing and advocating for effective long-term solutions to bolster human adaptation and health, as well as safeguarding ecosystems for community survival. And through this work, we aim to stimulate a global dialogue for nurses and to collaborate through research, education, and practice to advance climate justice action. And we know this agenda is just a starting point, and we are welcoming nurses around the world to provide feedback and comments as we collectively work towards solutions to address the climate crisis. And so I'm thrilled to be here with 3 amazing nurse speakers on our panel who are going to provide some of those concrete examples of how nurses are working at this intersection of climate and health. And so our first panelist will be Dr. Patricia Schwertel, who is an emergency nurse with 15 years of experience working in a range of healthcare settings in Australia, Europe, the Pacific, and Africa. She is now a researcher specializing in climate change and health, working toward her PhD on climate-related migration and health. Tricia has worked with Doctors Without Borders since 2007 and is involved in humanitarian governance. The floor is yours.
Thank you. Yeah, just to clarify, I'm not a doctor yet. When I have my PhD, I'll always be an RN. So just to clarify, but thank you very much. Thanks for this opportunity to speak about nursing leadership for climate action. I think something that is really resonating with me at COP this week is the scale and the nature of the change that's required to stay under 1.5, and that's quite shocking. And that shock can kind of lead to 2 reactions. One is like it's really empowering and motivating, and the other is that it's quite disempowering and it's quite easy to despair about that. But as nurses and midwives, as my colleagues have said, the largest group of health professionals also representing a very large component of the vote. We have a very critical role to play in this transition. And there's 2 things that we need to do to mobilise, I think. One is to empower ourselves and not wait for anyone else to empower us. And also to better understand how change happens. So we talk a lot about the what of change, but we don't talk much about the how of change. So when we train health professionals, there's 3 ways, or there's 3 steps. The first step is teaching knowledge and skills in order to build experts. The second step is about teaching values to build professionals. And the third step is teaching advocacy to create change agents. And we're not very good at all at that third step. As nurses and midwives, we're used to advocating for individual patients, but less so communities, and even less so the planet. So we're very new to that. And it's also in terms of thinking more about the how of change rather than the what. I think we have to recognise as well that the nature of change is changing. Like it used to be very much about the organogram and about, governance, top-down change. But now it's much more decentralised, and it's about your ability to influence through a network. So when I teach leadership to nurses and midwives, I talk about leadership in terms of a trait and a quality, and it's not a job title. And that really simply put, leadership is about seeing a problem or an opportunity and doing something about it, and not waiting for someone to tell you how, and not waiting for somebody to give you permission to do so. So if we're going to accelerate change, we're going to have to do that and empower ourselves to do that. So I'm just going to briefly explain 3 stories of change that I led that could be replicated. So we talk a lot about scaling up change. Here's 3 examples that any nurse anywhere in the world can kind of take something away from, at least. The first one's about education, the second one's about governance, and the third is about research. So I work as a lecturer at Monash University in the School of Nursing and Midwifery, and we were able to integrate climate change and health and environmental sustainability into the undergraduate curriculum. We did that as a learning objective, which means it needs to be assessed. And it means that when I go, somebody else has to do it after me. So that's an important element of change too. It shouldn't really rely on you. So I suppose I think of this example as change as windows and doors. The window part is that you get pockets of opportunity for change that you need to recognise. Sometimes they're less easy to recognise, and sometimes they pass without you having that opportunity. But this example was a curriculum review. So every 5 to 7 years, health professional curricula get reviewed. So if you're the right person at the right time, you can build a strong case to integrate climate change and health into the curriculum. And the other part is about doors, really. So it's about pushing on doors. Sometimes they don't budge. Sometimes they open a little bit and you can get your foot in, and sometimes they slam in your face. The point is that you have to keep on trying to push on those doors. So a couple of other ways that you could integrate climate is when your professional body is reviewing their code of ethics, why not try to get environmental sustainability? I mean, the evidence is there to make a very compelling argument. If your professional body is reviewing the professional standards or your accreditation standards, climate, environmental sustainability really, really needs to be there. And the other one is like just opportunistically, often hospitals and healthcare organisations do consultations to update their vision statements, and that's an opportunity to get environment and climate in there as well. The second example is from Médecins Sans Frontières, Doctors Without Borders. The world's well-known and probably the biggest emergency medical humanitarian organisation. So this is a story of effective advocacy. Although they're called Doctors Without Borders, more than half of the MSF workforce are nurses and midwives, and the vast majority are locally hired staff. So this is also a story about citizenship rather than customership, which is, I think, the way that we need to think about ourselves. The MSF movement is an association-driven movement. The model of governance is bottom-up. So once you've done a project with MSF, you join the association and you have the opportunity to shape and guide the direction of the movement. So this story is also about existing and new change levers. So there's lots of existing change levers that if you recognise them, you can pull on them for effective advocacy. And this one is the opportunity of writing a motion. So the association can actually write a motion, and if it's successful and gets enough international support, it can rise to the highest level of international governance, which is the International General Assembly. And that's what we did. So we really wanted MSF to invest more in nursing and midwifery. We wanted them to acknowledge nurse and midwifery research in their operational research strategies, to develop professional development and professional and promotion frameworks for nurses and midwives, and also to ensure that nurses are working at their full scope of practice. Because when nurses work at their full scope of practice, not only do people have better access to healthcare, but that healthcare is also safer and it's a higher quality. So although this example isn't really about climate change, it is, once you empower nurses, the philosophy of nursing is quite different to medicine in 3 ways. One way is that it's more about the socio-environmental model of health that integrates the environment, and also it's very much orientated toward prevention. And we know the lowest emissions from any healthcare intervention are the ones that are avoided. And thirdly, it's very much embedded in communities. So by empowering that philosophy of nursing within the MSF movement, we're heading in the right direction. The third example is research. So I became a researcher now because I think research has the enormous power to change. And nothing is really more infectious than an idea. When you have the evidence, because we're so evidence-based, evidence-obsessed, you can really find ways to create change that kind of sets off cascades of change. But I think we also have to think more strategically about research questions. It's not just about the gaps in the research that we can fill and get a paper published about, but it's about the kinds of research questions that will set off these cascades of change. And there's a couple of good examples of that. I think the health co-benefits of mitigation body of research is very powerful, because not only does it show, it's a very compelling argument for decision makers, because it shows that not by mitigation we can reduce emissions, but we can also have health co-benefits and social co-benefits and financial co-benefits. The other research that I really like to do is synthesis research. At AR1 in 1991, we had 2,000 articles to synthesize for the AR1. And in 2021, for the AR6, we have 350,000 articles to synthesize. So it's a huge task that can't really be done without machine learning. But it's a good question to ask, do I really need to do another primary research project? Or is it better to synthesize the last 10 years of research on this topic to create a higher level of evidence, which is much more likely to influence policy? So just to summarise, the scale of change is really overwhelming, and I think we all have a role to play. A good way to talk about, I think we need to talk more about the how of change rather than the what, and 4 ways to think about that is windows and doors, and existing change levers, and also creating new change levers. So the 3 examples that I gave were about education, governance and research that can be replicated in other settings, and I'm happy to speak to any nurses that want to talk about doing that. At COP26, we've really been talking about putting health at the centre of climate policy, and as the largest group of health professionals, there should really be a nurse at every decision-making table regarding health and climate action. Thanks a lot.
Thank you so much, Trish. I love that. Nurses at every decision-making table. It's so important. So we're going to turn it over to our folks virtually. I'm going to introduce our second panelist, who is Dr. Erlindo Palaganas, and she is a full professor and scientist of the University of Philippines, a tireless and staunch advocate for nurses and people's welfare, as well as various issues on social determinants of health. She is largely known among the Philippines community health nursing pundit as the leading expert in qualitative research and in her contributions and unwavering efforts to achieve equitable access to healthcare for Filipinos. I'll turn it over to you, Dr. Palagas.
Hello, good evening, everyone. I apologize that I couldn't put on my video. It's just that my internet, my connection is quite weak, and opening it will further aggravate the situation. But nevertheless, I'm here to share whatever concrete experiences we do about climate change. So I am representing a chapter of the Philippine Nurses Association, and this is the Baguio City chapter, and of course, in the region, being the governor of the Philippine Nurses Association Cordillera Administrative Region. So, by the way, the PNA Baguio City chapter is the most outstanding chapter of the Philippine Nurses Association for this year and for the year 2018 and 2019. And I would like to say that this is one of the things that we do. One of the good things that we do. Jennifer mentioned earlier that advocacy is a difficult thing to teach, but one of the good things that the PNA Baguio City chapter does is advocacy, and one of which is the story that I shall be mentioning. Next slide, please. So in terms of declaration, the declaration of conflict of interest, I think I don't have anything to declare, and whatever slides I have here are from my own, from the people's organization that I work with, from the Philippine Nurses Association Baguio City chapter, from a good friend, a community health nurse, Jewel Salvador, and also one slide from Google. Okay, so I would like to say that we at the Philippine Nurses Association in the Cordillera Administrative Region assert the people's right to health, and this is basically enforcing the intersection of health and climate change. And if you will see in this picture, climate change definitely can affect health by the difficulty. I mean, the Cordillera Administrative Region is one area where it is difficult to reach. And climate change has also further aggravated the situation through various landslides, road cuts, raging waters when the rain falls. And so it further aggravates inaccessibility to health. Next slide, please. And these are some of the geographical areas that I go to. I am a public health nurse, and I do research intensively in the communities here in the northern part of the Philippines. So I say here that raising awareness and critical thinking, the power of stories, the power of lived experiences through case studies and sharing research outputs to our students in the various colleges of nursing, in the various schools of nursing, not only in our region but all over the Philippines, is a very strong and powerful method of raising awareness and critical thinking. Next slide, please. And one of the case studies that we would love and we have supported with women's organization is the effect of climate change among indigenous women, because the part that I belong to is inhabited by indigenous women. And one of the researches that was conducted by Inabuyog and Seawork is, which we have assisted and which we have also helped in propagating, is climate change in indigenous women in traditional agricultural communities in this part of the Philippines. Because here, women know when there is a change, and this has something to do with the product, with the amount of produce that they have in the lands that they have. Next slide, please. And I think I have mentioned earlier that climate change and access to health services do have a relationship. And we try to show these pictures to our students and try to tell them what the relationship is. Next slide, please. So I'm telling you some powerful pictures that we get when we go to the field, and such as the impact of climate change on crop loss, as I have mentioned, so that when there are changes, when there are long months of drought or long months of rain, then crop loss is affected. Next, please. The impact of climate change further on crop loss through long rains and landslides. Next, please. And also the loss of other food sources and biodiversity arising from climate change. Like, for example, even in rivers, the amount of what do you call this, of food sources from the rivers are also affected. Next slide, please. And stories about when you have reduced water level, that it also affects whatever food sources that would come from the river. Next slide, please. And other effects such as this, you will see a hanging bridge that we would normally cross when the water level rises because of upstream water would gush in. And this is due to denudation. This is due to illegal logging, and this is due to deforestation as well. Next slide, please. And also, the impact of climate change results also to more pests and diseases. So that would also contribute to hunger, that would contribute to loss of crops. And so the cycle of poverty and the cycle of poor health continues in the community. Next slide, please. Okay, as I've said, no, poverty and hunger. Next slide, please. And so education and advocacy from communities to grassroots level, which we really go down to the people. We tell them about the results of our researches. And the height is when we also go down to the streets to tell our whatever the results of our studies are, and to push for policies, to push for the administration to do something about the situations that we find in the communities that we serve. Next slide, please. And yes, this here is a Cordillera woman from Inabuyog. This is a group of women's organization in the Cordillera who would talk about their conditions, and one of them is the effect of climate change. Next slide, please. And I also joined a, if you have time, you can watch this. There is a interprofessional pledge for planetary health, of which I represented the group. And usually we show this to our students because this is another way of pledging or trying to let advocates. It's like a Hippocratic oath or a Florence Nightingale oath, but it has something to do with planetary health. And it's usually a very good way of impacting the communities or the students as well. And the last slide has something to do with the call from the APWID. The urgent concern of rural and indigenous women is to address the climate change crisis and to look at how the dominant socioeconomic system has breached ecological limits and destabilized the planet's climate. So teaching climate change is not very easy. Even doing research is not also very easy because for one, operationally defining terms for students, corporate greed, climate change, globalization, and all these things are things that we really have to let our students, let nurses, professionals understand at this time. And it's indeed, this is the time to do it, and it will not have to be postponed, not tomorrow, not next year or next month or next week. I think the urgency to do something about climate change has started, and it will have to restart again today. Thank you very much.
Thank you so much, Dr. Palaganas. It's so great to have you here and to have you share your experiences of how climate change is impacting the Philippines and how you all are working to mitigate and adapt to those changes. And so I'm thrilled to introduce our third panelist, who is also joining us virtually. Dr. Elizabeth Schenk is the Executive Director of Environmental Stewardship for Providence, one of the largest nonprofit health systems in the United States. Under Dr. Schenk's leadership, Providence has set the boldest climate goal in U.S. healthcare to become carbon negative by 2030. And she and her team are transforming the health system to decarbonize operations while building resilience in the communities they serve. So I'll turn it over to you, Dr. Schenk.
Thank you, Kara, and thank you all for this opportunity. And it's marvelous to hear the work of my colleagues. Thank you. Next slide, please. So we have heard why nurses are so important to not only the decarbonization of healthcare, but for the climate crisis writ large. To amplify a few points that have already been made, with millions of nurses globally, the work of transforming healthcare cannot be done without nurses. Further, nurses bring crucial skills that not all professions have. We have technical know-how. We are systems thinkers, able to address complex features of health all at once: physiology, genetics, and disease, family, social resources and relationships, finance, education, and spirituality, all important aspects of health. We do this with care in the deep ethicality of our profession, and we can bring these same skills to the climate crisis, which is also complex from many voices and viewpoints, with success being dependent on a fierce commitment to equity. The world needs nurses now, as nurses care for billions of people around the world and for the world itself. Next slide. I'm going to tell you about Providence that Kara mentioned, one of the largest nonprofit health systems in the US. Our vision is health for a better world. Next slide. Providence is large. We have 52 hospitals, over 1,000 clinics, 120,000 employees, including 36,000 nurses. Next slide. We offer services in these 7 Western states. If you're not from the US, these are along the west coast of the US and in the Intermountain region. Next slide. On Earth Day of 2020, and I remind us that that was right in the middle of the pandemic, we announced our goal to become carbon negative by 2030. As Karen mentioned, this is the boldest goal in US healthcare to date. And alongside a fabulous team, I, as a nurse, am leading the work to get there. We are addressing all 3 scopes of greenhouse gas emissions, which is enormously challenging. Our commitment rests on our core value of justice, and we know that climate change is lethal, and further, that it harms more vulnerable communities the most. Thus, if we are to be true to our commitment to justice, we must address all of our carbon pollution from all aspects of our organization across both direct and indirect emissions. Next slide. I have worked in healthcare environmental stewardship for over 2 decades. Based on that experience, I developed the We Act framework. You can read about this in the journal Creative Nursing. We Act is an acronym standing for waste, energy, water, agriculture, food, chemicals, and transportation. We are now using this as a guiding framework in Providence, and we believe that these 5 broad categories cover at least 90% of our greenhouse gas emissions. You can see here some of the activities that we're doing in each of these categories. We have an enormous strategic plan, and we have many projects underway at once. You can use this framework just in your own mind. When you walk into any facility, any home, any organization, how are they doing? How are we doing using the We Act framework? And I remind you or point out the obvious that it also means that we act. We won't solve this crisis without action, and we won't solve it unless we work together. Next slide, please. Because of our commitment to justice, we are focusing on environmental justice in the communities we serve. We are learning about more specific environmental risks from Alaska to Texas. We are expanding the lens through which we see community health to include the environmental determinants of health so that we can help build climate resilience, especially with the most vulnerable. Next slide. We are developing a clinical collaborative for environmental stewardship. So it's obvious that healthcare exists to deliver care, and that's primarily from clinical experts like nurses. We have in Providence 90,000 people who are either licensed clinicians or who spend their time engaged with patients and families, and almost half of that group is nursing. Yet very often when an organization works on environmental stewardship, they don't include clinicians. This is understandable, I guess. After all, clinicians' time is valuable. We're busy, we're doing urgent, fast-paced work every day. This is all true, and yet who is better suited to transform practice? It's the clinicians. So we're starting our clinical collaborative. When we look across the clinical disciplines, we have already identified over 50 projects to address to transform clinical practice toward being environmentally safe and healthy. You may know that in the US, our standard of practice number 17 states that the registered nurse practices in an environmentally safe and healthy manner. So nurses will be crucial to the success of this work. And I look forward to creating opportunities for nurses to get involved and contribute because so many of us want to do that. Next slide, please. I have just a little more time, so I'm going to tell you about 3 other examples of my leadership. Next slide. Many of you have heard of nurse-sensitive quality indicators like CAUTI, CLABSI, falls, pressure ulcers. These are thought to be directly related to nursing care. My colleague Sarah Johnson and I have proposed the concept of nurse-sensitive environmental indicators. We have interviewed experts in the field in a qualitative study across the United States to explore this, and we have learned that using the WEACT framework as a basis, the categories in green here, waste, agriculture, food, and chemicals in particular, stand out as being nurse sensitive, or aspects of care that nurses are engaged in frequently and can impact more immediately. These are good places to start when working with nurses. Next slide. So get out your phones. I have 3 QR codes. The Chant is the climate and health tool. This has been developed by Kara Cook is one of the co-investigators and 2 other investigators. And this measures awareness, behaviors, and motivation related to climate and health. It began as a tool to measure nurses, but has been expanded to all health professionals. So if you hold your phone up to that QR code on the left, that will take you directly to the survey, or the QR code on the right will take you to the Chant website so you can learn more about the tool and how to use it. Next slide, please. And lastly, my last example is the Nurses for Healthy Environments podcast that I do for Annie. I've recorded and produced this since 2017, and it has been amazing to interview nurses around the world working at the intersection of health and environment. I see some of your names on the list of attendees today, so thank you for participating. This fall, we have produced the Climate Justice Series that Kara referred to about the announcement tomorrow about the Climate Justice Agenda for nurses. And Dr. Robin Evans-Agnew has interviewed 11 nurses so far. In the new year, we will offer the Nurse Climate Champions Series with Dr. Shanda Demarest, founder of the Nurses Climate Challenge. Fabulous leaders themselves. Please check these out. Next slide. I end by saying it is an honor to work with nurses to contribute solutions for this incredible challenge of our climate crisis. Nurses continue to blow me away with their smarts, their heart, and their commitment. Besides that, nurses are fun, and working together, we make the load lighter and go further. Thank you very much.
Thank you so much, Dr. Schenk. Your leadership is truly inspiring. And so we do have some time for questions, and we'll try to take a couple from the audience and perhaps one from the virtual audience. And I do just want to remind our speakers to, if you can keep your responses brief so everyone can chime in another time for questions. Do we have any questions from our live audience?
Hi, my name is Nicola. I'm a nursing student from the United States, from Boston College. I just wanted to direct my question at Patricia. You were talking about sort of how we can influence education, nursing education, and making climate action and environmental health a bigger part of that. I'm wondering if there's anything that students can do in order to be able to influence that. I know we're not necessarily always at the decision-making tables, but that's sort of my locus of control and power right now. And so I'm wondering what your advice is for that.
Yeah, that's a good question. And actually, a lot of the momentum around integrating climate change and health into the curriculum has come from students. So students are consulted in curriculum development. And so like I was saying before, sometimes there's windows that you can't see. So it would be worth finding out from your education institution, when are you reviewing the curriculum, and then mobilizing, getting some people together and seeing if there's any way that students can influence that curriculum. Yeah, and there's so much work around the world going on with this, and it's also in lots of different disciplines. And the learning objectives around climate change and health and planetary health are shared amongst different health professions. So it's worth having a look at papers like the AMI Consensus Statement for Planetary Health. That was an international, interdisciplinary effort to really articulate what are the knowledge and skills, the values, and that we need to teach the next generation of health professionals. And we hope that with that, the level of climate literacy will really rise so that we face fewer barriers when people practice. So that's kind of like the bigger goal.
Thank you so much.
And thank you. And I'll also mention in the U.S., the National Student Nurses Association has done some really amazing work, including releasing a policy statement on climate change and health, which is very fantastic. And I just want to remind folks who are virtually, if you'd like to ask a question, because we don't have the ability to see your hands raised, if you could just enter it in the chat and we'll grab a question that way. And we'll take one more question from folk in the room. I think I saw you. Okay, we'll go to you in the back.
My name is Rainer, and I work with Trish at Heidelberg University. I'm a doctor. So it looks a little bit as if you try to work alone as nurses, as the doctors do, so that we have two silos, which is not a good idea, I think. We all, not all, many doctors are completely not on this agenda, but many are. And so I think there should be a health worker unified approach. And I give you an example. We started a MOOC. By the way, MOOCs are great tools for disseminating knowledge everywhere, irrespective of diploma and so forth. And we did a MOOC for doctors on climate change. And Trish was the first to say, hey, why do you focus it on doctors and not on us or on all? And now we are going to do a one for health workers after that. So I think we should try to work together. I know it's not easy. I know many of you have bad experiences working with our crowd, but I think the ones that are climate sensitive, they will immediately link up to you and are very pleased to work with you.
Thank you for that question. And perhaps I'll turn it over to our panelists virtually to see if we have a response.
Cara, it's Howard. If I may come back on,
please do.
I'll come back. Yeah, it's from our colleague, the medical colleague, very well made point. And just to assure you that at the international level, the International Council of Nurses, we work very closely with the World Medical Association, the International Organization for Physiotherapists, the Organization for Pharmacists as well. There's something called the World Health Professions Alliance, which brings us all together. We all supported the sign up to the health professionals letter that 46, 47 million health professionals around the world have already signed up to. So there is some collaboration, but I absolutely agree. We always need to make sure that we're growing, that we're developing that as well, that we don't stay in our own professional silos. And I just wanted to pick up again the question from the student, just an observation on that as well. I think I think there's a part of the debate now which is really important to recognise how COVID and climate change are compounding and impacting on one another. So, COVID has exposed the fragilities, the frailties, the inequities in our health systems. Climate change will just exacerbate those even further, might lead to even more infectious diseases as well. So a lot of the global country health policy debate and discussion is in relation to how do we build back stronger? What does future healthcare look like? I did a paper with Elizabeth Hero, who's the Chief Nursing Officer, which was in the BMJ earlier this year, looking at future models of health care from a nursing point of view, which had sustainability at the heart of what those models could look like. And on a very, very practical level, I think a lot of the nurse-led models of care are sustainable models of care. Nurses who are supporting people with chronic and long-term conditions, not in a hospital setting or environment, but remote and rural, enabled with the right technology as well. I think that we have in nursing some models of health care which are good for patients, which would also be good for the planet. So to the student and the younger nurses' voices as well, wade into that debate and discussion about what our future health models and systems should look like, and the leading roles that nurses can play in all of that. Back to you, Karen.
For that response. And we are coming close up on time, so I do want to get to one more question from our virtual audience, and just a reminder to keep responses brief here. In light of burnout and exhaustion from working through a global pandemic, how can we empower and support each other to advocate for climate justice whilst acknowledging this?
Kara, I would jump in briefly.
Please do.
Only to say that I was really surprised when we launched our program at Providence right during the pandemic. I thought to myself, we will never make progress right now on climate. It's just too much. This is overwhelming. People are exhausted and scared. And that's all true. But what I found was people were relieved to talk about climate change. Now, I would have never predicted that 5 years ago, because it's usually got kind of a bummer topic. You know, people are afraid of climate change. But what I found was people were relieved that we were taking it seriously, relieved that our eyes were open, relieved that we had a plan. And so I think by, at least from my perspective, by engaging, inviting, including, and celebrating the contributions of nurses, this is a way that this can be a real positive, even though the pandemic is continually grueling. But I think there's a reason for the optimism that comes from action. Thank you.
And can I just add also, echoing Beth as well. In May 2020, at sort of the one of the peaks of the pandemic, there was a letter that was sent again from nurses, doctors, and other health professionals, and it was sent to G20 leaders. And we thought, oh boy, no one's listening to this, but they were, and they do, and that's for some of the reasons that Beth mentioned, but also because it's so interrelated, and people are hungry for connections that allow us to move through and forward with this, but also to prevent disasters and health crises like this in the future. And climate change does just that, and it's so connected to the pandemic. And to burnout and to all of the things that we're discussing. And so, yes, it is one of these sort of highlights of people's days when they get to work on issues that bring us forward and through, I think.
Thank you so much.
If I may add as well to what has been said, I agree with Beth. I agree with Erica as well as Howard. I think we should not let the pandemic stop us from advocating. And I guess I would like to encourage that the lines of communication be open. The ICN is there. I guess the ICN should lead. How many countries are there as a member of the ICN? And I guess you won't go wrong. If that collaborative system is strengthened, there will, as you have said, the voice will be there, and it will reverberate in the various halls of the world. So let's keep the lines open, and let's just keep moving. Thank you.
And what a great way to end this webinar with those comments from Dr. Palaganos. And so I want to thank you all for joining us here today. It's been such a pleasure to have our three panelists, and as well as our partners at ICN joining us and co-hosting this webinar. So I want to thank our panelists as well as ICN for partnering with this. And I hope this has given you a little snapshot of what nurses are doing around climate change and health, and we are eager to collaborate with anyone in the health profession and beyond. So thank you so much for joining.
All right, can everybody hear me? Yes, okay, wonderful. Thank you so much for joining the Solar Cookers International event at the World Health Organization Pavilion here at COP26. We are so thankful for this opportunity, so a big thank you to the World Health Organization for having us here, and we have some exciting guest speakers on our panel for you. A couple logistical things, first of all, and we do have some people joining us virtually from all around the world, which we're very excited for. We will also be recording this presentation so we can share it with people. Solar Cookers International is based in Sacramento, California, and it's 5 a.m. there, so we'd like people to be able to see it when they're awake, as well as be able to share this with people at any point in time moving forward. So all participants who are joining us virtually will be muted throughout the presentation to preserve sound quality. We do also have a question and answer section online for Zoom participants, and we will hopefully have time for in-person questions as well. So if you think of any, type them in if you're joining us online, or at the end of the session, please feel free to raise your hand, or we'd be happy to chat with you afterwards if we run out of time. So our guest speakers, we have Kendra Williams, who's a technical officer with the Air Quality and Health Unit with the World Health Organization, and we are so thankful for her joining us. We have our very own special Dr. Peg Barrett, who is a board member as well as a professor at George Washington University. You'll get to hear from Mindy Fox, who is the Special Projects Manager at Solar Cookers International, and Rab Ballas, who is a senior scientist with the Stockholm Environment Institute. So with that, I will go ahead and turn it over to Kendra.
Thank you so much for that introduction. So hello, everyone. Thanks for having me. My name is Kendra Williams. I am a technical officer with the World Health Organization, the Air Quality and Health Unit. Today, I'm going to talk to you about, give a general background about what household air pollution is, how it's linked to health and climate, and also some solutions and things that we can do to address it. So first, what is household air pollution? Household air pollution, commonly known as HAP, is released when polluting fuels such as wood, dung, charcoal, and kerosene are burned in inefficient technologies such as open fires or biomass stoves, traditional stoves. Now, this commonly happens when people burn these fuels for heating, lighting, and cooking in their homes. Now, it's important to note that we call this household air pollution and not indoor air pollution, because when these fuels are burned in households, they're not always burned indoors. They're sometimes burned in outdoor spaces around the home, or if they are burned indoors, they release smoke that escapes through windows, doors, and chimneys, and that contributes to outdoor air pollution around the home, not just inside. So the smoke that's released when these polluting fuels are burned in inefficient technologies includes a huge variety of different pollutants, including the ones you see on the screen here, which affect health as well as climate, and sometimes both. Typically in the health field, we focus on particulate matter that's less than 2.5 micrograms in diameter, because particles of that size can penetrate deep into the lungs, enter the bloodstream, and cause internal damage. However, there are many other pollutants that are released during the combustion process when household air pollution, which also have many negative climate impacts. So what's the big deal? How extensive is the use of these polluting fuels that lead to household air pollution? Currently in the world, 1/3 of the population still relies mainly on polluting fuels and stoves for cooking. So that's 2.6 billion people out of 7 billion people in the world. And those 2.6 billion people mainly live in low and middle income countries. So as you can see, this map shows the percentage of the access rate to clean cooking technologies, which are a safe alternative to polluting fuels. But you can see that access to clean technologies is particularly low in Africa, Asia, and also parts of Latin America. However, this map does show that the world is making progress towards adoption of cleaner household energy solutions. So you can see on the slide that 66% of the global population have access to clean fuels and technologies. However, note that that still means that 34% of the population lacks access, and that these 66%, it's important to keep in mind that this figure only includes those who are using a clean fuel as their primary source for cooking only. So some of those people may also use a polluting fuel as a secondary source for some other cooking tasks or for heating or lighting. So the problem could be even more extensive than this map indicates. This graph shows that we are making progress in achieving increasing access to clean cooking fuels. So you can see the orange bar, the green bar shows overall increases in access to clean cooking fuels around the world globally. However, this progress is not equally distributed across countries, and the majority of the increase that we're seeing is actually because of improvements in the 5 most populous low and middle income countries, which include Brazil, China, India, Indonesia, and Pakistan. So those 5 countries, you can see on the orange line of the graph, have increased substantially over the last 20 years. But in all the other low and middle income countries, which you can see on the blue bar, progress has been very slow, and there's been very little progress over the last 20 years. Also, we have the Sustainable Development Goals. Sustainable Development Goal 7 aims for 100% of the population to achieve access to clean cooking by 2030. But if we continue at the rate that we're currently seeing, which you can see here, only the access to clean cooking has only increased by 9% over the last 10 years. If we continue at that rate, we'll only see 72% of the population having access to clean cooking by 2030, which will fall short of the Sustainable Development Goals unless we take action, increase our efforts to make more progress. So why do we care about household air pollution? Household air pollution has many serious health impacts. It's attributable to diseases such as stroke, heart disease, COPD, lung cancer, pneumonia, and cataracts. And there's also emerging evidence that shows it's also linked to adverse pregnancy outcomes, poor cognitive development, diabetes, tuberculosis, and other cancers. And it's also women and children are the most affected because they're typically the ones that cook and collect fuel in households. And in addition to those health impacts, there are also other general health and livelihood impacts of household air pollution, including safety risks, such as burns or scalds from open fires, poisoning from ingestion of fuels like kerosene that are often sold in used soda bottles, injuries, musculoskeletal injuries from carrying heavy loads of firewood, as well as time loss from the many hours a day that it takes to collect fuel and cook with inefficient technologies. And that's time that mostly women and children are losing that can't be spent on productive activities such as income generation or education. And in addition to these health impacts, there are also many serious climate impacts of household air pollution. First of all, the emissions produced as a result of indoor burning of polluting fuels escape from the house and contribute to ambient air pollution and climate change. Cooking with these polluting fuels is responsible for about 2% of all human-created greenhouse gas emissions. And also residential fuel use is a key contributor to global black carbon emissions. So more than half of all global black carbon emissions are due to residential fuel use. And black carbon is an important climate change influencer of climate change because of its heightened warming capacity, which is almost 1,500 times greater than carbon dioxide. And lastly, the deforestation that occurs as a result of unsustainable harvesting of trees for fuel releases carbon dioxide and contributes to the heightened levels of carbon dioxide in our atmosphere. So what can we do about it? The as I mentioned, the availability of clean household energy solutions means that we have the tools available to achieve wider access to clean household energy, to reduce household air pollution, and achieve the Sustainable Development Goals. Now, increasing access to clean household energy will not only move us in the direction towards achieving Sustainable Development Goal 7, as I mentioned earlier, but also many other of the Sustainable Development Goals, including climate mitigation, gender equality, ending poverty, and improving health. So what do we mean by a clean energy solution? The WHO defines a clean technology as a fuel or technology that, when used at the household level, releases emissions low enough that keep concentrations of air pollution below the levels recommended in the WHO air quality guidelines. So certain fuels, such as solar, LPG, liquefied petroleum gas, natural gas, biogas, electricity, and ethanol, are always considered clean at the point of use, clean for health. Other fuels, such as wood, dung, kerosene, coal, charcoal, and agricultural crops, are considered polluting when used in technologies that release emissions that make concentrations in homes higher than the levels that are recommended in the WHO guidelines. But one important thing to note is that when certain polluting fuels that are typically considered polluting, such as wood, are used in improved technologies, improved traditional stove technologies, they can be considered a transitional fuel and technology combination if their emissions are low enough that they achieve some health benefits, even if they aren't quite achieving the WHO guidelines. So the WHO has developed guidelines for indoor air quality on household fuel combustion, which provide practical recommendations that countries can use to move towards implementing clean energy solutions. So these recommendations include definitions of emission rates that technologies can have in order to be considered clean. They also call for transitional fuels and technologies, when used, to be as clean as possible. They call for the avoidance of certain fuels, such as kerosene and unprocessed coal, because of the health risks that are associated with those specific fuels, regardless of the technology in which they're burned. And they also call for policies to incorporate synergies between climate, health, and energy, given the interlinkages between these three fields. So in order to help countries achieve these guidelines and implement the recommendations that the WHO has put forth for improving air quality, the WHO has developed CHEST, the Clean Household Energy Solutions Toolkit. This toolkit consists of 6 different modules, which each contain different tools and resources that are available to help countries map the current status of household energy and air pollution in their country, relevant stakeholders that are engaged in the issue, identify technologies or policies that could be implemented to reduce air pollution, to develop standards and testing for stove models to make sure that they're as clean as possible, to monitor and evaluate the household energy situation, to engage the health community in ensuring that the technologies that are promoted are clean for health, and to raise awareness about this issue. So I invite you to visit our website to access these tools and resources and learn more about the CHEST toolkit, as well as how WHO defines clean, the WHO air quality guidelines, and the other resources I've mentioned today. And please also feel free to reach out to me if you have any questions.
Thank you so much, Kendra. That was absolutely informative, interesting. We appreciate you sharing your perspective. So now we will have Dr. Peg Barrett, one of our Solar Cookers International board members, who we're thankful is joining us to share her perspective.
I'm having trouble getting my video showing, but I'm just going to go ahead here. If you can start on, let's see.
And we have speakers joining us from Washington, D.C., from Geneva, from here in Glasgow. So thank you, everybody, for being a part of this truly global event. We appreciate it.
Okay. It's not, let me see. Okay, there we go. I'm going to start, and I'm going to should be going. I'm not able to advance the slides here.
Okay.
I'm going to relinquish that control and let you advance my slides for me.
And hold on one second, we bet.
Slides, and he just can say his next slide.
Yep. Okay, our tech people are recommending I can advance the slides for you, which I'd be happy to do. So thanks everybody for your patience.
And what I want to say is that I am not only a Solar Cookers International Board member, but I'm a faculty member at George Washington University. I'm also a solar cook. What does it look like to cook with biofuels? If we could slip ahead to that slide. I'm going to show you, go ahead again, and again, because I'm going to show you a picture of what this looks like. And the next slide shows the so-called kitchen. There's a door, which may or may not be open, and there's a window, there's no chimney. And the next slide shows you looking out over the valley where many, many people are doing this solar cooking. So if we can look at the next slide, talking about, as Kendra Williams indicated, we've got pollution from indoors and outdoors from these three-stone fire, and the very small particulate matter that gets in the blood. The next slide starts my list of how we know this is bad for you. For example, you know that smoking impacts preterm birth. We know that in Ulaanbaatar, Mongolia, which has tremendous pollution in the winter, that pregnancy outcomes are particularly poor in the winter. We know from research this year that California fires impacted preterm birth. And we know there's more pneumonia where there's cooking fires. And if we go on with the next slide, you can see World Health Organization, Kendra Williams just summarized this for you. They reviewed over 500 studies. And the American College of Chest Physicians also reviewed studies of how air pollution is harmful. On the next slide, you can see the number of different functions that they found impaired by this air pollution. And on the next slide, you can see more specifically about cognition. As a developmental psychologist, I'm particularly worried about the mind. And we know that test scores of high school students are lower when there's more particulate in the air in their community. Baseball umpires make more mistakes. And the online game Luminosity, there's poorer performance with memory games when there's more air pollution. Let's go to the next slide. Echoing what Kendra Williams said, the most vulnerable are children and pregnant women. Stunted lung growth, reduced lung function, asthma, pneumonia, impaired development, cognitive issues, low birth weight, preterm birth, and moving on, even children dying. In fact, that's where this gets really scary, and we need to think about possible solutions. Next slide. So it isn't just the list that we've been giving of the things that come from that small particulate matter, but kids get burned from open fires. And money that's spent on wood and charcoal could be spent on school fees. Time spent gathering wood, I think I've got my video up now. Time spent gathering wood and could be spent on schoolwork. And being out of sight of parents to gather schoolwork could be risky, including gender-based violence. Moving on to the next slide here, the deforestation and desertification. It isn't just the human costs of the immediate health of mothers and children, but also the environment. That's why we want to be here at COP. Deforestation, desertification, these lead to poor water quality and poor soil quality. Next slide. Now, we have an answer. Kendra gave this among her menu of answers. We have free cooking energy falling out of the sky from the sun with absolutely no pollutants. Next, we can see light energy hits a black surface, changes to heat energy. We trap that heat in, and then we capture more sun with reflectors, mirrors. So let's see the picture. Next. Just a black pot is going to get a little warm. Next. Put a glass bowl around it. It's going to trap that heat in there. Next. Now you have reflecting panels concentrating the heat. Next. These are homemade solar cookers. As I said, I'm a solar cooker. I cook with these. Next slide. So you wonder, is that what they look like? Well, that's one of the designs. There's lots of different designs, and you can have homemade solar cookers that I showed you, locally manufactured and imported. Next. So here's another homemade one, and I'm making bread in my backyard. Next. The question is, can these homemade cookers cook real food? Next. So this is about 100 degrees, just a little more than 100 degrees centigrade. Next. So that's enough to make bread here. Next. And yes, it tastes good. Next. And you can cook from 82 degrees up. So you don't even need to reach 100 degrees centigrade in order to be cooking. Next. Commercially manufactured solar cookers. Next, let's see what they look like. Here's one. And this one is in the process of being tested. The wire coming out the back this is something that Solar Cookers International does. Next. And here's another one. You can see there's a lot of shiny panels reflecting the heat onto that black pot. Next. Here's another commercially manufactured. Next. And next. So these can be locally manufactured. This is in Lesotho. This large solar cooker, next, is used for commercial bakery. And here's some of the products that are made. Next. Here are people looking at a large box cooker that's made in country. Next. Another version of the large box cooker. Next. So if you have a solar cooker, what else can you do with this? You can pasteurize water, and that's going to prevent waterborne illnesses, a very serious problem with children. You can dry surplus food. Maybe you've got extra mangoes and you can dry them so that you can sell them later or your family can use them later. Next. You can run a tea stand on the streets of India, or you can keep your kitchen cool in the summer by cooking outdoors. You can pasteurize milk. You can use pressure cooking to cook things like beans faster with, for example, a large parabolic cooker. And you can autoclave to sterilize things for a medical need. Next. So I'm going to skip the practical questions. We get to those if we need to in the question and answer, but let's go to the next slide. Because deforestation is one of the serious consequences. More than half of the deforestation in sub-Saharan Africa is attributable to trees cut for firewood and charcoal. Next. So in Nigeria, half the forests have been lost in the last 5 years, and cooking is a significant source of that problem. Next. And in Kenya, only 6% of the land is forested. In Haiti, less than 4% of the land is forested. We can't be cutting that down. We need to move to solar cooking. Next. So it's handy if you have a heat retention basket to supplement your solar cooking. Next. This is what it looks like. You put the cooked pot in there. Next. wrap it up and insulate it. And you can keep the food warm from maybe 4 o'clock when it finished cooking to 7 o'clock when you eat. Or you can cook your first dish, maybe even brown rice. You can cook it for 15 or 20 minutes. You put it in a heat retention basket and it will continue cooking. Next, another supplement is a water pasteurization indicator. Next, so if you set out your solar cooker in the morning, you want to know when you come back at the end of the day, did it get hot enough so this water is safe for my children? This is a picture of what one looks like. Next, you can see the green wax there will melt at the temperature that the water has pasteurized. Next. So if I come back at the end of the day, I can see that the water has pasteurized and it's safe to use with my children. Next. And I just turn it over and use it again the next day. So how do we go about getting more solar cooking around the world? We would love to have governments write this into their policies. When Kendra Williams was talking about the options that World Health Organization is promoting, solar cooking's on the list. We need governments to put it on their list. We need to carefully assess community cooking needs so that we can figure out exactly what are the right kinds of cooker or cookers for the kind of food those people are cooking. We need to partner with local organizations. And for example, Solar Cookers International has a demonstration project in Kakuma Refugee Camp. We need other demonstration products. Next. The bottom line, more solar cooking, fewer trees cut, reducing climate change, and helping children and their families. And next, solar cooking impacts all the Sustainable Development Goals. Next. I would love to talk more. Check with Solar Cookers International website. Send me an email. Thank you very much for your attention. Let's do this for children, their families around the world. Thank you.
Thank you so much, Peg. That was incredible. And just to let our virtual speakers know, we are speaking to a full room and lots of people are showing lots of interest. They're taking pictures of all these slides. So we're getting thumbs up for our virtual speakers from the audience. So lots of great positive feedback. You're educating a lot of folks here. So thank you. So next up, we have a video recording from SCI's Special Projects Manager, Mindy Fox. It's 5 a.m. where she is in California, so we figured it would be better to hear a few words from her ahead of time. But she's been doing an awesome job in terms of analyzing a lot of that global data that Solar Cookers International has been gathering and sharing to further these efforts. So we're going to hope this sound works.
Hi, I'm Mindy Fox, Special Projects Manager with Solar Cookers International. Thank you for the opportunity to speak today in collaboration with the World Health Organization. I truly appreciate it. I'd like to share information about SCI's data and solar cooking impact analysis, our advocacy efforts regarding what countries can do to increase adoption of solar cooking, and some of the resources that can help many of you watching today. SCI has calculated the estimated economic savings for over 100 countries using data from the World Health Organization. The savings are derived from the avoided environmental and health costs achieved through solar cooking. These impact summaries show the population numbers and population percentages relying on polluting fuels for cooking. Those statistics are from the WHO database, by the way. The summaries also show the carbon dioxide tons prevented with the current identified cookers and the potential carbon dioxide tons prevented if the families cooking with polluting fuels used solar cooking. Also factored into the calculations are the annual premature deaths due to household air pollution, again, data from the World Health Organization. These deaths come at a cost to countries. Many environmental and health costs associated with cooking with polluting fuels can be avoided with the change to solar cooking. The impact summaries provide an estimated savings for each country, some of which are in the billions of dollars annually. Yes, that's billions with a B. Increasing the adoption of solar cooking through policy inclusion can result in tremendous economic savings at the country level. Solar cooking can save 1 ton of wood for a family in 1 year. This saves them time and money. Imagine the impact of solar cooking with almost 3 billion people currently cooking over open fires. People can use these projected savings when seeking partnerships and support for solar cooking projects in their country and as evidence of the value of increasing solar cooking. Hi, I'm Mindy Fox. Annually. Yes, that's billions with a B. Increasing the adoption of solar cooking through policy inclusion can result in tremendous economic savings at the country level. Solar cooking can save 1 ton of wood for a family in 1 year. This saves them time and money. Imagine the impact of solar cooking with almost 3 billion people currently cooking over open fires. People can use these projected savings when seeking partnerships and support for solar cooking projects in their country and as evidence of the value of increasing solar cooking. Because solar cooking supports all 17 United Nations Sustainable Development Goals, solar cooking is a viable solution for countries to include in a variety of national plans and policies as a climate mitigation and adaptation strategy. SEI strongly encourages countries to include solar cooking in their nationally determined contributions and voluntary national reviews. This slide shows a summary of the nationally determined contributions, or NDCs, submitted for COP26 this year. The NDCs are at the heart of the Paris Agreement. NDCs embody efforts by each country to reduce national emissions and adapt to the impacts of climate change. The Paris Agreement requires each country to prepare, communicate, and maintain successfully nationally determined contributions that it intends to achieve. At this time, 194 countries have submitted their first NDC report. SEI has been tracking the inclusion of clean cooking and solar cooking in the NDC reports for several years. Out of 194 countries, 66 now mention cooking or cook stoves, acknowledging that how people cook impacts climate. The 66 countries include plans to switch to clean or cleaner cooking. Of those, 25 mention using non-polluting fuels for cooking. We are encouraged to see that including using non-polluting fuels for cooking is growing over the past 2 years. Haiti is a good example of a country including clean cooking in their NDCs. Haiti is embracing solar cooking in many areas, including at the University of Notre Dame in Hench. SEI worked with several collaborators, educators, and solar cooking advocates to develop a solar cooking curriculum. Students are learning how to make and use solar cookers and to collect data for the ever-growing evidence base of the effectiveness of solar cooking. In addition to research and advocacy, SEI is building the capacity of the solar cooking sector by offering a multitude of resources to increase solar cooking internationally, nationally, and on a community-wide basis. SEI creates and shares these materials to connect people and organizations to those materials and to each other. Through these resources, SEI shares best practices to encourage increased adoption of solar cooking. This resource is named after the dedicated solar cooking advocate, John Collentine. The toolkit is an online collection of materials geared for multiple audiences and serving multiple purposes and arranged into user-friendly modules. It is equally effective for a novice solar cook looking for information on how to solar cook their very first dish, or for a Prime Minister of Energy planning on scaling up the adoption of solar cooking in their country. We encourage everyone to use this online resource to increase solar cooking in your country. The Solar Cooking Wiki is the world's largest online solar cooking resource, with approximately 1,800 pages of information about best practices, country-specific solar cooking tips, how to build solar cookers, and news and events, the Solar Cooking Wiki is a wealth of helpful knowledge. Information on the wiki can be translated into 45 languages, so you can explore and add your own information to this very powerful resource. With the help from solar cooking experts from around the world, SCI has developed surveys and assessments to assess the need and desire for solar cooking in communities and to gather data about the adoption and impacts of solar cooking initiatives. The data is critical in building the evidence base about the effectiveness and impacts of projects. Newly trained solar cooks provide feedback about using solar cookers, how much fuel and money they are saving, and what challenges they are addressing with continued follow-up. The compiled quick needs assessment data can help you and planners, project managers, and decision makers formulate the appropriate solar cooking initiative for your community, and the Adoption and Impact Survey results help SCI identify best practices to share with the solar cooking sector at large for successful increased adoption of solar cooking. Thank you for the opportunity to participate today, and thank you for your efforts to combat climate change and improve health for many around the world. Thank you.
All right, thanks to Mindy for sharing some more information about the ways that Solar Cookers International builds capacity. All right, next we've got Rob Ballas with the Stockholm Environment Institute, sharing some exciting updates on the work that he's been doing in policy research.
Thanks so much, Caitlin. Turn my video on, and here we go.
Perfect.
Okay, so thanks everybody. Kendra already reviewed all the impacts from cooking with polluting fuel, so I'm just going to hop right in and talk about a project that my organization, Stockholm Environment Institute, which I often abbreviate as SEI, and I'll try and articulate to ensure that we don't confuse it with SCI, did in conjunction with the WHO to collect as many as policies from around the world as possible that seek to enhance access to clean household energy, primarily clean cooking, but also touching on clean heating and lighting. The motivation here is the need to achieve universal access to clean cooking, heating, and lighting. It's just a massive undertaking if you think about the numbers and the geographic spread. And you can't achieve that without well-designed policy. You can do small-scale projects, but you'll never reach the scale unless you have policy engagement. So Stockholm Environment Institute partnered with the WHO to develop a household energy repository that will hopefully enable different stakeholders, policymakers, practitioners, advocates to learn from past experiences. This repository forms a part of the CHEST toolkit that Kendra mentioned earlier. In addition, policies, we're including independent policy evaluations, so third-party analyses of policies to try and understand what worked and what didn't, which should hopefully help synthesize lessons that could be used to design more effective policies in the future. We finished the first phase of this work recently, and we launched the repository in late September. So for today's presentation, which I'll just take a few minutes to do, I want to review a couple of notable policies and share some of the lessons that we drew from the overall effort. Important to note, the repository is technology agnostic. We're not looking to pull in specific technologies, just to try and get a global overview of what's happening in this space. The examples that I'll pull, one comes from Indonesia and another comes from India. Both supported increased access to LPG, which is obviously not solar cooking, but still I think we can draw generalizable lessons from them. And they did this for different reasons. So I want to talk about what the motivations were, what the outcomes were, and then I'll also review where solar thermal cooking fits in the whole policy landscape. I wanted to touch on our methods briefly, but I'll skip over that in the interest of time and just jump right into these examples. Any questions, of course, you can contact me individually after the presentation. So one example from Indonesia. Indonesia had subsidized kerosene for many, many years, and the cost put tremendous strain on national accounts. Expenditure on kerosene grew to more than fourfold between 2001 and 2008, exceeding $4 billion US. To reduce the costs, Indonesia shifted subsidies from kerosene to LPG, and they chose LPG, or liquid petroleum gas, which comes in these canisters that you see on the screen, because the cost per unit of useful energy was lower and distribution infrastructure is relatively simple to put in place. Again, this is a generalizable lesson, not specific to LPG, but for any kind of technology you want to approach. You need to think about what the infrastructure is required. LPG is also cleaner than kerosene at the point of use, for sure, so it can achieve health goals if implemented correctly. And this program specifically provided free LPG starter packages and subsidized refills while gradually withdrawing subsidies for kerosene. And it worked. Indonesia saw a 93% reduction in kerosene consumption between 2008 and 2016, and an increase in the percentage of households using LPG as a primary fuel from less than 10% in the early 2000s to over 80% today. One evaluation estimated that government saved over $15 billion by 2016, but the cost of LPG subsidies continues to increase. It was $1.8 billion in 2015 and increased to $4 billion in 2018 before the pandemic kicked in and put a little bit of downward pressure on demand. The government is still feeling pressure to implement additional reforms to reduce these costs. For example, by shifting from a universal subsidy on small cylinders that's bought by rich and poor alike to one that just targets the poor. And if you think about any kind of subsidy program, targeting is key. It's a linchpin of any subsidy program, and poor targeting can often lead to policy failures. So the next example that I'll talk about comes from India, where targeting was really the key to its success, but there's still some caveats about how the program turned out. So India's LPG subsidy is an example of what can be done to improve targeting. Their access to LPG was increasing steadily from the early 2000s, but it didn't reach the poorest strata of society. In 2016, to boost access, the Indian government introduced this large program, Pradhan Mantri Ujjwala Yojana, or PMUY scheme, sometimes just referred to as Ujjwala. The scheme subsidized both LPG connections and cylinder refills specifically for women in households that are classified as below the poverty line, which is an official household designation in India. The connection subsidy covered about half of the total cost of new LPG hookups, including the first cylinder and associated fees and equipment. And by mid-2019, the program provided LPG access to 80 million households. Think about that. That's nearly the population of the United States. The scheme's targeting and financing were key to its success. Enrollment is limited to the poor. They're identified using nationally issued biometric ID cards, and subsidies on refills are paid specifically to bank accounts that are linked to the ID. So they're paid after the purchase is made, and this reduces fraud and misappropriation of funds. Overall, the program achieved its main goal by providing access to 80 million poor households, but there's evidence that most beneficiaries continue to use polluting many policies. We reviewed over 100 policies that have been implemented, not just NDCs, in fact, very few NDCs, just actual energy policies or health policies or climate policies. So many mention clean cooking, many mention the need to reduce the impacts of polluting fuels, but very few actually explicitly mention solar thermal cooking. One example is in Ethiopia's national energy policy says they want to promote alternative fuels for rural areas, biomass fuels, biogas, solar cookers, and electricity. One of the presentations mentioned Somalia, and they did mention solar cooking in their intended nationally determined contribution, their INDC in 2015. However, it didn't show up in their more recent updated NDC of 2021. Okay, so specifically for solar, there's a long way to go. As one of my colleagues mentioned, the need to work into a stated policy will go a long way, I think, toward promoting the technology. Okay, so stepping back more generally, are these household energy policies successful? Have they been? And some are. So in addition to India and Indonesia, which both achieved their main objectives, Kenya has seen a huge shift from charcoal and kerosene to LPG in the past 10 years. In South Africa, the percentage of households cooking mainly with electricity has steadily climbed over the past 20 years. And in China, there's been a dramatic decline in the residential use of coal, specifically for household heating. But there's still lots of challenges. Many of the evaluations we collected noted the high cost of cleaner energy options, even when subsidized, were a barrier to access and regular use. So this is true not only for poor families in India, but also in Ghana and Cameroon, where smaller scale programs, similar but smaller scale, were also implemented to promote LPG. This is true for other energy carriers and end uses. So even China's coal ban, which is largely considered a success, failed to reach some of the poorest households. So I'll end here with a brief look at what the repository looks like. If you visit the page, this and you can navigate through, use searches and filters to specifically seek out what you might be interested in. There's a search bar, etc. And close here with some links. If you want to view the repository itself, you can visit the first link, householdenergypolicies.org. And we also invite anybody to submit policies or evaluations that have not already been included. This is not a universal, not a universal repository. We couldn't possibly access everything. And so we're turning to the public to ask them for their own submissions. You can submit new policies at the top link and submit evaluations of those policies if you know of any at the bottom link, and we will gladly accept them and work them into the main website as we can. Thanks very much, and I'll pass back to Caitlin.
Rob, thank you so much for that overview. And this is why Solar Cookers International finds it so helpful to strengthen our relationship with organizations like the World Health Organization, because then it allows us to access and be a part of these things that you've been working on, Rob, in terms of gathering this information and making sure we're part of the conversation. So thank you, Rob, for reaching out to Solar Cookers International as an expert as part of your information gathering in this process. We really appreciate it. And thanks for sharing the overview today. So now I'd like to open it up to questions. We'll start with questions from the in-person audience members first, because we should have everybody's email address who registered online. So worst comes to worst, we can follow up with you. But we'll start with questions in person. So if you have a question, go ahead and raise your hand. And I'd like to invite all of our guest speakers to to turn their cameras back on and join us on screen. I'm going to stop my screen share here. So hopefully that means we can show all of our speakers. I can see Rob and Kendra and Peg, which is fantastic. So good. Let me see if I can actually change. Unless Jennifer, are you able to view that or no? Okay, great. We've got everybody up here. Okay.
I'm Rainer Sauerborn from Heidelberg University in Germany. The focus of the presentations was on sun and LPG, and you need energy, but you also need the cooking device. And my little experience from sub-Saharan Africa is that people are traditionally so much married, in inverted commas, to their 3-stone stove that you see a lot of them the solar cookers abandoned next to it, and they returned to the traditional one. I think the cultural dimension of food quality and smell and so forth, could you expand a little bit on this?
Sure, I'd be happy to address that. So as Peg mentioned, Solar Cookers International is currently working in Kakuma Refugee Camp. And actually the demand and requests for solar cookers are more than we can provide for at the moment. So the solar cookers are being used quite a bit, and one of the things that we do to help facilitate that is we'll do a needs assessment when we go into a community or we begin working with a local collaborator and find people who are already open to cooking with different methods and who can understand the benefits of solar cooking and also have, a sunny area around their house in order to do that. So that's one step for key to success, and just sharing that example from Kakuma of the demand just far outpacing what we're able to supply at the moment. Training and follow-up is essentially important for any behavior change, whether it be riding your bicycle more or doing different ways of cooking. So that's something that we found to be really successful, as well as having local champions, especially women within communities who are solar cooks themselves and can lead by example and continue to foster that within their communities. So thank you very much for your question. And Peg, did you want to add to that?
Yeah, excellent question. Let me add to that a little bit. Food is very, very fundamental, and we continue to cook the way that our parents cooked and our grandparents cooked, and so it is difficult to make these changes. The model there might be from agriculture, where over the last generations, we've used agricultural extension agents and local community people to help drive changes in agricultural practice and even the foods that are cooked that are grown and cooked and eaten. So this has to be a process that goes on over a period of time. You can't just drop a solar cooker into someone's home and expect them to start using it every day immediately. Thank you.
Thanks, Peg. That was a great example. We have another question from the audience.
Hi, Rob, Kendra, and Peg. This is Praveen Kumar from Boston College. Great presentation. I have I have basically a statement, and I would want your thoughts on this. The real problem of household air pollution is not that we are scarce or we have dealt with technology. It's the problem is stacking. And so my thought is that as far as solar cookers are concerned, it takes an infinitely long time to cook, and they are relatively expensive, except the one that is displayed over here, which is the parabolic. The vacuum box stove. The other three stoves essentially take a whole lot of time to cook. So what have been observed by the evidence and the studies that we have done in South Asia is that people not only use solar cookers, but they also use other types of stoves, primarily the traditional stoves. So this entire issue of addressing the household pollution falls flat because of stacking processes. So here is this situation where we make a clarion call for policy and more funding in solar cookers, but solar cookers themselves as a standalone technology, it's going to be very difficult for them to address household air pollution. So in that scenario, where do you think the solar cookers or this entire technology should proceed on? I'm right now working on this project with IIT Bombay on solar induction stoves. The prices have been coming exorbitantly low these days. So is that the way to proceed? Or it's just that I'm a little perplexed. What is the way forward for solar cookers?
I can start with a quick reaction to that. Thanks, Praveen. So I guess I would just say that fuel stacking is not inherently a problem. It can be a solution if the fuel stacking is done with all clean options. So, fuel stacking is actually common in most countries. I'd say most of us use a microwave and a stove and a toaster and a rice cooker to cook our foods. So as long as all of the stoves that are being used are clean options, stacking is not necessarily an issue. The challenge for us is ensuring that households have access to a suite of clean household energy options. So that can include a solar cooker for the tasks that can be done in the solar cooker. It can include other clean options for tasks that may be harder to transition to a solar cooker that communities are not willing to give up. So agree with you that there are many things that there are some things that you just can't do in a solar cooker. It's not the one's end all solution, but it is an important solution that can make up a suite of options for clean household energy transitions.
Let me add to that too. It could be a suite of solar cookers too, because the panel cooker might be like your slow cooker, and the parabolic cooker might be like cooking on your high burner on your stove. So that is a possibility. When Solar Cookers International has done some of its calculations, they've calculated savings if as little as 25% of the cooking is done on solar cooking with solar cook stoves. So you still get way significant savings. We're still making progress at that moment. Thank you.
Thank you. My name is Esther from Kenya, and I am quite impressed by the whole presentation. Actually, there is so much to learn from it. And when it comes to Kakuma, a refugee camp, I am a witness that there is a lot of deforestation around the camp due to cutting of the retro vegetation that is available for firewood. And the solar cooking actually has gone a long way to assist in alleviating that problem. And I wish the same can be extended to other parts of the country where similar deforestation is occurring as a result of firewood, like Kajiado and among other places. Also, from the second presenter's slides, I saw now that you are using small boxes to do the cooking, because initially there were big boxes that people were saying, no, I cannot have this in my house. But the small boxes now, the ones I saw, I think many households can be able to accommodate them. Thank you.
Thank you so much for sharing your perspective. Other questions from the audience? These are great. Thank you. All right. I'm looking for our another question. All right, perfect.
I'm Karen Kendrick Hands with Rotary International.
Could Rob finish his thought about the impact of subsidies on LPG in India? You timed out, and we missed your bottom line about people setting aside their new cookers, even with subsidies.
Sure. So I don't know that I had much more to add. It's just the subsidies only get you so far when you're dealing with very poor households, and other options still exist. So the other fuels are low cost or zero monetary cost. The cost is in the labor for people who collect it. And it's accessible still, even if landscape is degraded around the communities. So people make a consistent calculation. So if you imagine you design a policy once and you roll out the funds once, but the decision about what fuel to use is a continual decision, right? It's something that households, that individuals, that cooks, that women make every day. So it's just going to be a trade-off between what do you want to do on that one day, or that one week when your cylinder runs out. Do you go refill a cylinder, or do you use what's available nearby? And that calculation, the decision, it's complicated, and it's just going to vary from time to time. And the poorer you are, the more financial constraints you face, and that's just, it's a fact of life. We do the same thing. It's just we have far fewer constraints, let's say. That's it. It's something you need to keep in mind, and this is true for anything. So if you have an option that has zero operating cost, then it might be, if the upfront costs are high, then you need to consider about how to make that accessible for people. So whether it's solar or some other option, it can be an attractive choice. And I'm glad Praveen mentioned the notion of stacking. It's essential. People will always be using multiple options depending on what fits their needs that particular moment.
Thank you, Rob. And we have one more question. We're running out of time, so you're going to be our last question in person. And thank you to everyone who submitted questions online. We will do our best to follow up with you, because we should have your email addresses as well. So I appreciate everybody's patience.
Okay, I'm Bahati Joseph from Uganda. I'm working for a banana industrial research and development center, and we are working with farmers who have formed cooperatives, and we are adding value to the bananas. We cook, dry, and mill. But now the process of the solar the cookers is our interest. How would we be able to access these?
Yes, thank you so much. Well, we'd be happy to talk with you after this event. So definitely come talk with us, and we'll connect you with all of our resources and figure out how to carry on the conversation. For those of you who aren't here in person, definitely solarcookers.org. You can sign up to receive more information and hear about opportunities that we have to share information and resources and opportunities throughout the year. So with that, I do want to be respectful of the World Health Organization Pavilion's time. I want to say a really big thank you to our guest speakers for joining us literally from all around the world today. Thank you so much for everybody who joined us both in person and online. We really appreciate making this a global experience. And I wish everybody a beautiful morning, afternoon, evening, wherever you are. And please enjoy the next time the sun is shining wherever you are. Thank you so much.
Good afternoon, everybody. Welcome to the COP26 Health Pavilion, and very welcome to our side event here on Act Now, Policies and Tools for Health-Centric Climate Action. This event today is the principle behind it is we keep talking about the urgency for action. And what we want to show here is often we get the arguments that people are waiting because they're putting the policies in place or they need more evidence or more tools to support them. And this is an opportunity for us to show a little bit what's already out there, the tools and the policy support that is already in place to support that immediate action that we need to get now. I would like to welcome everyone who is here at COP26 physically with us, and also everybody who is participating both via Zoom or following the live feed on the GCHA YouTube channel. Some of the panelists, you will see two are sat here with me, and I'll introduce them when we get there, but we also have a few virtual panelists joining us as well. To keep with our program and the timing, I would like to jump straight into, we have a opening welcome statement from Dr. Hans Kluge. He is our WHO Regional Director for Europe, and we asked him the question, why is our health so critically dependent on climate action?
Dear colleagues, dear friends, our climate is changing. We have known this for decades, but the evidence is more solid than ever before, according to the latest Intergovernmental Panel on Climate Change report released this year. Climate change is already threatening our health, our future survival. This COP26 is the deadline for the Paris Agreement to be put into action. All parties need to agree on an evidence-based pathway to a zero-carbon future. We need to build a resilient, inclusive and green global economy that will be a turning point for our planet and health. For the first time, health is a central science priority area. The COP26 Health Programme was established to bring stronger health focus and ambition to COP26, to provide the impetus for action to adopt the implementation guidelines of the Paris Agreement. Immediate, strong and sustained reduction in emissions of carbon dioxide and other greenhouse gases would limit climate change, although it could take at least 3 decades to see global temperatures stabilize. The good news, however, is that reducing emissions would immediately benefit our health through improved air quality. So the urgency is clear. Let me illustrate why our health is so dependent on this action. Only months ago, floods in Western Europe, the worst in a generation, left hundreds of people dead. Floods cause drowning and injuries. Infectious diseases and mental health problems can persist long after the water subsides. Several countries across the region have seen severe wildfires that pose health risks linked to smoke inhalation and injuries. Like flooding, wildfires also cause destruction and devastation to infrastructure and communities. Heat waves persistently threaten our global health. Particularly at risk are older people, infants, the chronically ill, and people working outdoors, including emergency workers. In Italy, a temperature of 48.8 grades Celsius was recorded this summer, what is believed to be a new European record. These are impacts of climate change just this year. direct impacts on our health, expected to become even more frequent and intense as a result of climate change. Globally, the effects are even more devastating and catastrophic, threatening food and water security. This is why our health is so critically dependent on climate action. This is why last month I wrote to every Minister of Health in the European region, encouraging them to champion the initiatives of the COP26 health program. Commitments that will make a significant and long-term contribution to protecting the health of our people and support the goals of the Paris Agreement. By signing up to it, ministries of health become agents for change, leading by example. This is why 2 months ago, tasked with rethinking health policy, the Pan-European Commission on Health and Sustainable Development, chaired by Professor Mario Monti, in its final report was heavily focused on One Health, emphasizing its interconnectedness to climate change, environmental pollution, and loss of biodiversity, calling for a coordinated action to reduce environmental risks to health. In September, at the 71st session of the WHO Regional Committee for Europe, I stressed that the health response to climate change deserves our undivided attention. But within the health sector, we need to introduce another layer of action. We often address climate change through emergency responses. It is now time to accept that these emergencies are here to stay. We therefore need a sustained response beyond emergency management, making our health systems more resilient, better prepared to respond to the climate crisis. The WHO Regional Office for Europe, in particular through our European Centre for Environment and Health in Bonn, Germany, of which I am so proud, continues to provide evidence on the health impacts of climate change together with guidance to member states on health adaptation planning and the health co-benefits of mitigation. We stand ready to support our member states in developing and implementing health-centric climate policies. Together, let's strengthen the voice of the health sector for climate action. Thank you.
Thank you very much, Dr. Kluger. Indeed, it makes a very valid point that often a lot of Western Europeans see that climate change is something happening far away, but just this year we have seen how it very much is an emergency here in Europe. And even in the past week, we have again seen horrendous flooding in the Balkans, particularly in Bosnia and Herzegovina. So it is very much a European emergency as well. Moving on quickly with our program, I would like to now present Dr. Hans Breunings. He is the Executive Director of the European Environment Agency. And the question we would like to ask you is, what information can we provide to policymakers?
Okay, thank you. Thank you for the invitation to be here. I'm going to take this off. That's easier to speak. I will stand up because that's easier to speak as well. And I have a couple of slides that I prepared, and I will focus on the role that the European Environment Agency plays.
Yeah, carry on.
I will focus on the role that the European Environment Agency plays in this field in support of EU policies. Yes, next slide. Okay, well, I think Hans Kluge, the other Belgian Hans operating from Copenhagen, I would say, has focused already on a number of the health impacts of climate change. And what people underestimate is that heat and floods have already caused, also in Europe, a lot of damage to human health, people passing away, high cost to healthcare systems. Also underestimated, I think, overall, is that changing climate doesn't only mean average temperatures that increase, but also really strange cold spells that appear in places. Think of North America, China as regions where that appears, and also vectors of disease. The new kid on the block, I would say, that has been getting more and more attention is the mental health aspect across generations. Yeah? Not only people suffering from this impact, but people worrying about their own future, the future of their grandchildren. So we hear from the psychologists and psychiatrists that that is a new dimension. Yes? Okay, what we focus on is bringing knowledge to policymakers. And if you take the business as usual scenario, this is where we would end up with the tiger mosquito. Yes, next click, and next click. By the end of the century, look at where we would have a conducive environment for the tiger mosquito as a vector of disease in Europe. We could show... Is the sound still on? Okay, great. Okay, we could show similar pictures for West Nile fever, yeah? And when I show West Nile fever in Europe, I always emphasize that it's not West Rhine fever, it's West Nile fever, yeah? So we have a specific context there, yes? What we do in our knowledge base is we have a platform called Climate Adapt, where we link the various elements of climate adaptation to knowledge and to European and national policies. And what we've added rather recently to this Climate Adapt is the European Climate and Health Observatory, where we tap into the knowledge on the link between climate and the health system in that. What we have is a policy context framing. This is really important. We also do country profiles, yes? What we also do, yes, next click, is we bring evidence together on health effects, and that can be linked to heat and health, vector-borne disease, water, air pollution, really important, yeah, wildfire, flooding, all of these elements. But we also are developing with our partners increasingly tools that allow you to go into what is expected, what sort of data is available, and how can we use that in the planning of public health systems. What is important is that this is, of course, not something which you do as an environment agency standalone. The key message, if we want to address this type of topic, is collaboration, networking, bringing knowledge together, connecting the dots. Unfortunately, public institutions are not necessarily set up in that way. They have a history of fragmentation, yeah, and segmentation, and the same is true on the scientific side. Scientific community is often highly fragmented with subfields and sub-subfields that don't necessarily speak to each other. So bringing together players and actors is absolutely critical. So our key partners in this are the European Commission, Health and Climate, the World Health Organization, Europe, and we're so glad that we can build on a long existing collaboration. The Lancet Countdown, where you bring in hardcore science, and of course at the European level, the European Center for Disease Prevention and Control, really well known now with Corona. And on the more environment and data side, ourselves, EFSA, the Food Safety Authority, because the food system is often a way in which we are confronted with impacts of all sorts of nature, and the Copernicus project. Copernicus is the strongest Earth observation capacity on the planet. It is Europe's eye on Earth from space. You can use this also in modeling, in prediction, and in ultimately also in preventative type policies. Yeah? We link this to legal and policy context. We all are here for the COP, so we know what the global one is. At the European level, there is actually a whole host of policies that make the connection increasingly between health, environment and climate. The strategy on adaptation being an important one, but also other elements. And at the national level, I think it's fair to say that in many places this is still a very early emerging, almost to say embryonic field of connecting the dots in policy making. So we hope through our work at the European level that we can stimulate that debate in Europe. I will leave it at that because I promised to be brief. I hope this gave you a glimpse. Please contact us, be in touch, and go to Climate Adapt. Everything is freely available. And if you contact us, we do reply and we come back with responses to your answer. And now I need to apologize. I don't have a habit of running away from panels, but if I don't run away, I am 100% sure that I miss my flight home. I shouldn't fly, I know. If I leave now, I have 50% of missing the flight, and I am not going to take the risk. So thank you very much, and happy to continue the collaboration.
Hans Bronix, many thanks for joining us, and we knew you're going to have to run, but we are honored that you spent your last few moments at COP to come and speak at our event. In particular, re-emphasizing that, that it is here in Europe, that it's the West Nile virus here in Europe. I think that's a good illustration there, but also the need that we need to break out the silos, that we need to work together, and the observatory, how it brings together the food, the environment, the health sectors. It brings together different sectors, and I'm sure there's room there as well to embrace the larger community that is involved in tackling climate change and achieving the action that we need. Moving on to our next speaker, I'm happy to welcome Dr. Dorota Jaroszyńska. She is the Program Manager for Living and Working Environments at the WHO Europe, based at the European Centre for Environment and Health in Bonn. And Dr. Dorota should be joining us virtually. The question that we asked her was, how can improving air quality protect health and mitigate climate change? Dorota, I see you're online. Welcome.
Hello, James. I hope you can hear me and hope you will soon see the slides. May I have the first slide, please? So it's indeed very timely and appropriate to briefly talk about air quality, and in particular in the context of the recently published air quality guidelines at this event that is focusing on the need of urgent climate action and focused on health. Let me just very briefly mention what are the air quality guidelines that we published just more than a month ago. The document, which is of a global relevance and which provides a series of recommendations of the levels of air quality that are needed to be achieved to protect population health worldwide. And this is a very important reference, evidence-informed reference, developed through a very rigorous process to be then picked up by decision makers to develop standards, policies, and actions, and to design measures that will be effective in reducing air pollution and protecting human health. The guidelines should also prompt and stimulate research to address the remaining gaps and to even better protect people's health from the impacts of air pollution. Next one, please. However, the air quality guidelines are not only giving this very robust health argument to address air pollution as such, but they are also a powerful tool for climate action. And this, I think, is of particular importance in the context of this session and of this event. If we think of the main sources of both emissions of greenhouse gases and sources of air pollution related mainly with combustion of fossil fuels, but also with activities in other sectors like agriculture, we will realize why air quality guidelines, so a document bringing the message about the necessary improvements in air quality to protect human health, matters. So all the measures that contribute to mitigating emissions of greenhouse gases and also other climate pollutants, they will contribute to improving air quality and vice versa, and all this ultimately to protect human health. Next one. Just a glimpse into the guidelines. I will, of course, not go into the details, but based on the review of the new evidence, most of the recommended air quality guideline levels are lower than they were in the past. The previous edition of the guidelines was issued in 2006. But making the guidelines a useful public health tool, the document provides also a set of so-called interim targets. So these are the steps and milestones on the path towards improving air quality and indicating that every improvement of air quality matters. Air quality document provides also a very new feature, which are so-called good practice statements related to black carbon, ultrafine particles, and desert and sun dust. Because the quantitative evidence didn't allow to derive guideline levels, but we have some proposals for management and exposure reduction measures for those. Next one. Next slide, please. The new air quality guideline levels are very ambitious, and there is quite an effort for many member states to achieve those, hence the relevance of the interim targets. But in addition to air quality guidelines, the levels, interim targets, and good practice statements, the next one, we are offering also other tools to support member states in building the argument, the health argument, also in the context of intersectorial discussions. I would like to very briefly mention two of them. One called AirQ Plus, which is a tool that allows quantification of the health impacts of air pollution at different levels. And next slide, please. And a tool that some of you might be familiar with called Carbon Age, which is a tool to quantify the health and economic effects of climate change mitigation through improvements in the air quality. I am saying that some of you may know it under the name of Carbon Age, as the tool is now undergoing a process of changing its looks, so developing a new and even more user-friendly interface. And with this change, the name of the tool will also be changed into Climate Age. However, the essence remains the same. Please click one more click. So still the tool answers these two main questions on air pollution and health benefits achieved through reduction in domestic carbon emissions for climate policies under the nationally determined contribution submitted by member states, and also the magnitude of the health and economic benefits due to the future changes under the nationally determined contributions. And while the tool is getting a new interface, it's already been used, and some participants might have followed the events when the country examples were presented, as these country examples are available for Colombia and Pakistan, and we are also working with the European member state. And those colleagues who are enjoying participation in this event at the spot in Glasgow might also have the opportunity to meet a key expert behind this tool, Dr. Josef Spadaro, who is also in Glasgow. And with this, the last slide, please, I would like just to acknowledge all who supported the work on the air quality guidelines. Thank you. Over to you, James.
Many thanks, Dorota. That's fascinating. It was also having been involved in the launch of the air quality guidelines, that was a mammoth piece of work that's been put together over many, many years, and I very much do encourage people to look at that. But also it's proving that these policy support tools already exist. They can quantify what the effects of these policies are going to be, and they can serve as a justification for immediate action. And as Dorota just hinted, in the development of the Carbon H and now what's called the Climate H tool, Dr. Spadaro is actually sat here with us today for if there's any technical questions, we may be able to answer those. In particular today here at COP, it's Cities Day. So we are particularly happy to welcome Elko Ehrenberg. He is the Vice Mayor of Utrecht, and he is now going to give us, right down at the local level, a very local cities perspective. And we would like to ask you, Mr. Ehrenberg, how can cities create a healthy urban living for everybody?
Well, thank you, and thank you all for inviting us, and it's a great honor to be with you today. Hello from Utrecht, and we've prepared a short presentation that I would like to share with you. So I'm not sure if you're already looking. There we go. So first of all, let's say what my key message is that if we want to take immediate action, I think we should, with all these challenges with regards to the climate. We should start with urban planning. We should start as cities, and we should redesign our cities. And I think that we should redesign cities with health in mind. And that's something that we at least try to do, and I think we do it pretty good in our beautiful city of Utrecht, and I will elaborate on that a little bit more. We are a city in the Netherlands. In the previous slide, please. So back. Oh, yeah, thank you. So we are a beautiful city in the heart of the Netherlands, in one of the most densely populated areas, and we are growing. We are growing really fast. We think that in the next 10, 15, 20 years, our population will increase by 20%. And we thought about a strategy how to accommodate this growth without posing a toll on the climate or on the health of our citizens. And therefore we have a healthy urban living for everyone as our core strategy, which is basically a healthcare in all policy strategy, where we look at health in a broad way. It's about healthy people, it's about possibilities to cope with physical, emotional, social challenges. And as you can see in the illustration on the right-hand side of this slide, healthy urban living for everyone is about everything. It's about playgrounds, it's about nature, it's about energy, it's about education. Basically, it's about being a nice and modern city for everybody. And I will give you a few examples. So next slide, please. We have this, I think you could go a little bit further. First, the bee-friendly bus stops. And as you can see in this picture, we have these bus stops, and the roof of the bus stop is green. In the spring and summer, it has nice flowers on it. We have all these bus stops in our cities, and we ask the market, if we want to be a healthy urban living environment for everybody, what can you do? And some companies said, well, we designed these bus stops for you, and why should we green them? And of course, it's not huge in terms of metrics, but each and every bus stop in our city now has this green roof, which helps with climate adaptation, but most of all, it helps with telling a story to our citizens. Everyone who's waiting at the bus literally sees that we need to change the way we do things. Then the other picture that you see is this, well, it's 6 lanes here, but there are places in our city that it was 12 lane. We have a 12-lane highway straight through the city center. And if you go to the next slide, you'll see what we did with that. In a couple of decades, it took some time. We got rid of this highway, and now it's a canal, and it has this beautiful, lush green area around it, and it helps with recreation. People tend to walk there or do some exercise or, well, just enjoy the sun and the canal. So it really changed the way that our citizens use our city. And of course, all the cars are now gone here, so the air quality really improved. So next slide, please. So another example, this is also from our city center. You can see our beautiful dome tower at the background. This is the way we designed cities for decades. And we are going to change this. And we're actually changed this at this spot. So you see all the parking places here and all the cars. And if you go to the next slide, you see what we turn it into. It's now no cars, and there's plenty of room for bikes and plenty of room for people traveling by foot. And there is a strategy behind this, because in our view, people use the city in the way you design the city. So if you design the city to be used by bikes, people will actually increase their bike usage. And we have all sorts of nice and little systems to allow for this. So for example, we have lots of parking places. We have the biggest parking garage for bikes. We have a system that shows you the nearest free parking spot for your bike. It's always guarded, it's always dry. And when you invest in these types of facilities, people will start to use the bike even more. And of course, we want to be a city for all our citizens, or we want all our citizens to use these bikes. So we have programs for people with a low income to get almost free bike, and people who are new to the Netherlands and never rode a bike before can get a bike coach and learn how to use them. So if you design around the bike, people will use the bike, and you will get a much cleaner and friendlier and healthier city. Next slide, please. So another example, this is a huge canal on the, well, basically also through our city. There are two neighborhoods, and there's the canal in between, and we needed to build a bridge. And we said, well, we need to do two things. It needs to be a bridge that, again, allows for bikes, design it for the bike, and it needs to be an icon. It needs to tell a story. And we had a beautiful place where we could build this bridge, but there was already a school there. And then we said, why not combine the school, renew it, and turn a piece of the school into this bridge. And I'll show you on the next slide what it turned into. So this is our new school. It still is a school, but it's also a bridge. It's also actually fun to ride it by bike, as you can see. It's quite challenging, but it is fun. And people exercise there, and lots of citizens at least want to try it once, because it's almost sort of an attraction. And that helps tell a story and improve bike usage. And well, again, helps being a healthier city for everybody. And in that way, help with the immediate action to reduce the climate change. So to summarize, because these were a few examples, our view is taking immediate action is about urban planning. And when you plan for a healthy city, and it will become a greener city, it will become a bike-friendly city, it will change the way people use the city, and it will do two things at the same time. At one hand, people will become healthier by these design choices, and on the other hand, yeah, climate change will be reduced by this. So as it is Cities Day, I totally agree. We are basically in charge. We can make this thing, we can do these things tomorrow, and we can make this change happen. Thank you very much.
Round of applause there. Thank you very much, Mr. Ehrenbach, for taking time out of your busy schedule today. I think the key message there, I love what you said. It's like a city will be used in the way that it's built, for the purpose that it has been built for. Very often we use these examples from Utrecht or Amsterdam or Copenhagen, and a lot of the comments we get is people go, oh yeah, but that's Utrecht or that's Copenhagen. Well, as he's just shown, it wasn't always like that. They made it like that. They decided at some point it needed to change, and they changed the city, and you make it bike friendly, people will use bikes. And I think that's a very important message. It doesn't have to be Amsterdam, Utrecht, Copenhagen. It can be Jakarta, Bogota, Seoul. It can be anywhere. We just need to make that change. But sticking with that concept of cycling and urban transport, I would like to invite Harry Rutter. Professor Harry Rutter from the University of Bath is also working on the Lancet Chatham House Commission on improving population health post-COVID-19. And Professor Rutter, the question we would like to ask you is, how big is the role of active mobility on the climate and health agenda?
Thanks very much, and thank you very much for the invitation to this session. The answer to your question is easy. It's enormous. Sadly, not everywhere is like Utrecht, and as we've seen at COP this week, there's a huge focus on electric vehicles as the so-called solution to sustainable mobility. But merely changing the fuel in a vehicle from petrol or diesel to electricity doesn't magically make it sustainable. Can I have the next slide, please? Active mobility is central to sustainable transport, but we've seen far too little investment in it. Cars will undoubtedly have a place in a low carbon world, and those cars will need to be powered by sustainable electricity or hydrogen or whatever, but they will need to be reserved for the residual journeys that can't be made by truly sustainable modes. Walking and cycling, truly sustainable modes, have, however, received insufficient investment and inadequate policy attention. Next slide, please. A group of us, led by Francesca Racciopi from WHO, who now heads WHO Europe, who now heads up the Bonn office, set out over 20 years ago to identify ways in which the health benefits of active travel could help to shape transport policy, transport investment, and importantly, action. And we base this, next slide please, on a simple question. For a given volume of cycling, what is the economic value of the health benefits? And this was really important. What people tend to do in health, and certainly what I'd previously done in health, was to think about the health benefits. But we were trying to influence transport policy through transport economic appraisal. So what we needed to do was understand the economic value in terms that meant something to transport economists. And I'll come back to that shortly. Next slide, please. And the health benefits of regular physical activity are enormous. And one of the best ways to get regular physical activity is by walking or cycling to work. And when we set out 20 or so years ago to put this, to get this work moving, perhaps the best study available at the time was the Copenhagen Heart Study, led by, this paper was led by Lars Bo Andersen and colleagues. And what they showed is that those people within the study population of 30,000 people, it was, I think, 7,000 or 8,000 of them who regularly cycled to work. Their risk of mortality in any one year was about 40% lower than that of the general population, the rest of the people in this study. And that was after adjusting for the fact that people who cycle to work are likely to be healthier than the general population in the first place. So you adjust for all that, and still this regular physical activity from commuting by bicycle had an enormous impact on their risk of dying in any one year. Really powerful intervention. So next, please. So if we come back to this core question, for a given volume of cycling, if X people regularly walk or cycle an amount Y, what are the health impacts in terms of premature mortality, and what's the economic value of those benefits? Next, please. And we put this into, oh, it hasn't come out fully, I don't think, but you can look this up online. I've got a link in a minute. A really pretty simple and straightforward algorithm, a simple flowchart that just relates the volume of cycling to the volume of cycling in that Copenhagen Heart Study, and estimates the impact of that volume of cycling at population level on the population level likelihood of dying in any one year. We then related that using transport economics principles through the value of a statistical life to the economic value of the number of lives saved. And as an example, for a decent sized city, if you had an extra 10,000 people walking for an additional 45 minutes a day. So just about a 20-minute walk on the way to work and on the way home from work. And they did that every day. You'd get 20 fewer deaths in that group of people every year. And the annual benefit in terms of transport economics, in terms of value of a statistical life, would be over 30 million euros a year. So the economic value in the way that feeds into transport appraisal is enormous from a behavior that is not only healthy, but of course also truly sustainable. Next, please. And then again, so we've looked at physical activity, and when we first started this tool, we looked at cycling. We then added in walking, and next slide, please. And now we've added, next one. We've now got air pollution, traffic crashes, and carbon emissions are factored into the tool. But I would come back to this core point, next slide, please, that one of the key principles here is that we didn't do what people in public health tend to do, which is to shout louder and louder about health. We stepped into other people's shoes. We stepped into the shoes of the transport economists, the transport appraisers, the people making decisions about active travel policy and infrastructure, and we played by their rules. So not all the health economists agreed with the way we were doing this, but they weren't the audience. The audience was the transport domain. Next slide, please. So we have this tool. You can find it easily online. There is actually a URL for it that we can circulate that's for some reason missing from the top of this slide. But it's an open access tool. It's straightforward to use. There are various ways of estimating the volume of walking and cycling. You can feed them in, and for your city, your region, whatever the population that you're looking at, you can estimate the impact in terms of physical activity, air pollution, crashes, and carbon emissions resulting from the kinds of increases in active travel that we're talking about. So next slide, please. The key points here are that we built a tool that was simple, clear, and transparent. We used the best available evidence, and crucially, we involved and focused on the users, the people on whom we want this information to have an impact in order to try and shift transport policy in a healthy and sustainable direction. Thanks very much. If you just move on to the next slide, it's a set of acknowledgements and thanks. Next slide, please. That shows that this is a truly international long-term collaboration with a huge number of people. I'm representing, I'm just one small part of this huge project, and it's been going on for over 20 years, and I'm hoping it'll last another 20 years still. Thanks very much.
Thank you very much, Professor Rutter. And I can actually confirm, at least for the participants here and hopefully online as well, the URL was actually present on the top of the slide. So
Great,
hopefully
thanks.
people can find that as well. Thank you very much. Again, proving that we can actually quantify these impacts of policy changes. We can actually use that to feed into evidence-based policymaking, and these tools already exist. And this isn't even a new tool. This is something that is pretty established, and it's out there. For last but not least, I am very happy to come back to a physical present panelist, and I would like to introduce Revati Felke. She is with the newly named UK Health Security Agency. Revati, the question to you is, what are the essential policy needs for immediate action?
Thank you very much, and thank you for the invitation to be on this panel. And I think I will try to, bring the conversation back to the higher level conversations, because we've heard excellent inputs from colleagues before how this can be done in practice. And I think of course, before I begin, I would also like to say that as the previous speaker said, I'm also speaking on behalf of a team. I'm speaking on behalf of Jutta, who is the chair of the Health and Climate Working Group of the WHO region, and very dear colleagues, Oliver Schmoll, Vladimir Kendrovsky, and Sophie, who is in the room. I think this paper that I am going to talk to you about, the Zero Regrets Strategy for the WHO Europe region, wouldn't have seen the light of the day without the contributions of these people and other members states from the region. So again, speaking on behalf of people. Next slide, please. So I would like to, if you could click, if you could put, oh yeah. So I would like to make 3 points. I think that the 3 main policy needs that I would like to identify. The first one is, of course, that we've seen that the collective commitments that have come out of the NDC so far, they are falling short. And they will put us on a dangerous pathway of crossing beyond the 2-degree limit that we have set. So I think the first very important policy need for all of us is to keep the ambition for 1.5 alive, and then put activities and actions and other activities that we do so that we can still keep 1.5 within reach. I think this is the first policy need that I strongly would advocate for. The second one is, of course, that how can we put policies in place that can ensure, scale up, sustain, and make accessible the finance that is needed for countries to achieve the action that we are asking them to achieve, and accelerated action. So we are asking for urgent action, but if you are not going to put resources behind it, then that is probably going to put us again on a pathway of less success than we would have hoped for. And I think the recent analysis by OECD has said that the 100 billion pledge that was agreed is delayed, and we won't be achieving it by 2023. And by then, some of the costs for adaptation and mitigation would have escalated. So I think that is the second policy need that we would say, that, scale up sustainable finance and make it more accessible to countries that need it. And then the third thing is, again, that if we are asking for action at scale, that needs to be backed up by representative evidence. And we have heard many times on the WHO Pavilion as well that there are still existing gaps on how research is being delivered across geographic areas, across the different health outcomes of concern for climate change, and also the difference between what level of research is happening for adaptation science. So if we are asking for scaled up action, we need to have the evidence that puts behind, that tells us what works and also what doesn't work. So I think that learning from each other will only be possible. And the other thing is that we can't wait until all the evidence is available to us. So it's that parallel, simultaneous implementation and learning from that implementation. I think that is an important policy need as well. And how can we support action-oriented research that is well funded and is representative for all regions and all countries within the region as well. Next slide, please. So together with the members of the Health and Climate Working Group, we put together this concept about 9 asks. And what you see on the screen, of course, the first one is to strive for net zero by 2050. Accelerate a resilient, sustainable, inclusive transition from COVID-19, and we know that it is a very good opportunity for us to reset business as usual to the best as we can, to drip feed the climate for health action and the health for climate action into the policies as they are being renegotiated and rewritten to some extent at the national level, but also at the regional and the subnational levels. Of course, I don't think I have to reiterate this one. Previous speakers have also said a lot about it. It's about the siloed working. And we saw some examples of excellent cooperation working, and we have to stop talking to the converted. The health sector has to reach out and talk to people who can make the difference, on action of whom we can draw co-benefits and multiple benefits from. Of course, optimizing the synergies between mitigation and adaptation. So yes, mitigation is the first kind of line of treatment, I would say, but simultaneously scaling up action on adaptation as well. Prioritizing health co-benefits in every climate action that we take, optimize climate resilient and sustainability within health systems. As you know, that this is one of the COP26 health program priority areas, and up to 52 countries have signed up for this initiative as of the latest that I saw on the website. Of course, most of the adaptation is also locally led. So we do want to request facilitation of locally led, people-centered decision-making for action on climate change. Again, another COP26 health program priority of strengthening the voice of health professionals, and by health professionals, as wide and as inclusive as a definition that we can, people in the front line, the community health workers, but also the policy makers, and how can we kind of strengthen their unified voice in asking for scaled up climate action on health. Mobilize and sustain resources, and basically all of these things will happen at different scales, at different countries, and basically we have to revisit the conversations of how this can be implemented in the discussions that are ongoing. Then this is also matched up, next slide please, this is also matched up with some it's not a complete comprehensive list, but some indicative guidance on how this can be achieved. And the first one is, of course, to assess, quantify, and communicate the risks. And we know this, and we've also discussed this, that there are gaps in current availability of data infrastructure and also data in improving our understanding of the risks, but also our understanding of the response. So baseline assessments, follow-up assessments for both where we are with mitigation plans and where are we with the adaptation plans, I think is very important. Where feasible, quantifying these impacts and making that evidence available to both people who are at the frontline community level and people at the policy level taking those decisions for implementing those actions, and practitioners, of course. If you could click one more, yeah. The second one is, of course, to lead and advocate. And I think we've also heard this numerous times that we need to reinforce the negotiating capacity of health professionals in the climate discussions. And of course, we know that we need to have steep reductions in emissions and the targeting of net zero as quickly as possible, preferably by 2050. And we do have to lead by examples by assessing our own carbon footprint, not just for the curative side of the healthcare systems, but also of the preventive and the public health side of the health systems. And then, of course, using this evidence to promote for scaling up of the ambition for both mitigation and adaptation. Next slide, please. And it's not enough to kind of, we have to walk the talk. So I think the next action is, of course, that knowing the risks, acknowledging them is not enough. All of the awareness of the risks need to be backed up by action, and that will not be achieved without improving the capability and the capacity of the healthcare professionals. The second thing, of course, is also institutionalizing these practices. So not as, independent standalone programs, but institutionalizing the discussions of climate in health and health in climate. When we talk about action, obviously we can't ignore that we have to take an all-hazards approach for it, and also making sure that we have multi-hazard surveillance systems that are implemented, that work, and that are backed up with action again. And then how early is the action, and how the financing for those action is made available when it is needed, to whom it is available. When we talk about awareness to action, it's not just action in the health system. Of course, it's action in the WASH sector, it's action in all the sectors that are determining health of populations, and how can you make them climate resilient. And this also includes climate proofing health programs and climate proofing the interventions that are being put in place. Next one, please. And of course, this is the decade for action, and we do have concrete goals set for 2030. But of course, there are other regional strategies and priorities that have been set. So aligning and adjusting how policies are implemented, how practice is shaped in the region and globally, I think would be key. So we do have the Sustainable Development Goals and the universal health coverage targets that the countries are doing. And in addition to that, you have, of course, the Regional European Programme for Work, the WHO Manifesto for Healthy Recovery, and of course all the asks that we have put forward, the 9 asks that we have put forward in the Zero Regret strategy. So how can we align action on this and then put indicators in place so that we can monitor the progress that countries are making towards it. And then last but not least, we have the deliver and monitor function. And when we are doing the monitoring function, of course, making sure that equity and equality considerations are cutting across all the interventions that are being put in place, having monitoring and evaluation processes that work, and of course, facilitating mutual learning So we've seen fantastic examples just from the previous speakers of how policy implementation can support improvements in health. And I think we have to facilitate that learning across countries and communities to be able to justify the resources and also to scale up action. Thank you very much.
Thank you very much, Revati. Round of applause. And thank you very much for being here in presence, so I'm not sat here on the stage by myself. I think what I want to sum up here is that we started off with a little bit of the why, just a quick reminder why we need an urgent action and why it's so important for our health. But going on, we're also showing that there isn't really much of an excuse for not taking action now. We have outlined what the policy needs are. There's plenty of information out there to support evidence-based policy making for climate and for health. And we've also shown concrete examples of how that can be applied, how it can be applied at the city level, also capitalizing on today being the city's days, the city day. And we've also shown that the tools for the quantification of those policies, they exist, they're there, you can use them. I just want to pick up one thing that Revati just said is we do feel an awful lot that we're preaching to the converted. And I just want to highlight, I'm very happy to see there's a lot of people, a lot of you here today. There's also a lot of people following us online. But what I ask of you now is we've brought this to your attention. You know these tools are available. We've led that. We would like you now to go back. I see here we've got observers, we've got parties, we've got negotiators, but take that message and now we ask for you to help disseminate that and to disseminate those links. And on our very last slide, I would just like to show that I'd like to echo what Hans Browning said. There's our email address and we also answer emails. So please do get in touch if you would like to have links to any of those tools or policy frameworks that are there. You can either find them on our website at euro.who.int or take a quick note of that email address, euroclimate@who.int, and we would be happy to get back to you and also to support you. I would like to wish you all a successful and healthy last few days at COP, and thank you very much for joining us. Goodbye.
Hello, welcome everyone. You guys ready to get started? Gabby? I can't hear you on mine. You can't? I think you need to turn at... it's on channel 1? Probably 0. Channel 0, yeah. And can I get a thumbs up that everyone can hear me great? Okay, thank you everyone for coming here today. Thank you to everyone in the audience in front of me. Thank you to everyone that's streaming online on YouTube. It's a pleasure to have you here. My name is Shivam Gai from the Slow Cat Partnership. I work as the project officer in policy and advocacy, and it's my pleasure to be here today, giving the opening speech here with my colleagues. Our event here today is on active mobility for health and safe cities, the case for electric 2 and 3-wheelers. It's being hosted by UNEP, STA, NUMO, SlowCat, of course, and I want to extend a special thank you to the World Health Organization for hosting us here in the Health Pavilion. It's really a pleasure. We're here today to discuss the climate crisis. The climate crisis is without a doubt the most large threat to health of our world today. In the current trajectories of warming, we're expected to see 2.7 to 3.1 degrees this century alone. The goals, as per the Paris Agreement, is of course 1.5 degrees warming. Every 1/10 of a degree we go over that, the health and safety implications, they go tenfold worse and worse every single time. And of course, while no one is safe from these risks, the health burden falls largely on the global south, specifically on the people who contributed the least to the climate crisis in the first place. Not only that, but they're the least equipped to protect themselves and their families from the adverse effects themselves. An example of this is air pollution. Air pollution causes more than 7 million premature deaths every single year. To put that into context, that's 13 deaths every single minute. And this, of course, impacts the global south predominantly. As transport professionals here today, as health professionals here today, we must recognize that we have an ethical obligation to address this rapidly growing crisis that could be far more catastrophic than the COVID-19 pandemic ever was. To understand that integrating health and, of course, equity into climate policy will protect people's health, maximize returns on investments, and build the public support we need to see at COPs or throughout the year in this urgently needed climate actions. I've laid out somewhat of the issues that we see today, but I want to discuss a specific mode of transport that can be used to address these exact issues, that being 2- and 3-wheeled electric vehicles. The electrification of road transport, as you've seen at COP26 and yesterday at Transport Day, has been without a doubt the focus from the presidency. But in terms of road transport, they focus specifically on cars, trucks, vans, neglecting the power of a 2- and 3 electric vehicle, which is predominantly used in the global south. So much so that the global south has been stepping up its efforts with these types of transport modes. In Africa, Asia, and Latin America, and the Caribbean, the 2- and 3-wheeled vehicle mass market has been growing exponentially. A case study of this conducted by SlowCat shows that in Brazil, Venezuela, and Colombia, between the years 2000 and 2015, they saw almost 300 to 400% growth. That's absolutely exponential. So this is a part of the market of transport that we cannot ignore. Additionally, walking and cycling infrastructure improvements, the expansion of them, have been a focus of Global South governments throughout their NDC and VNR processes. So much so that some African cities, including my home, Nairobi, Kenya, has seen upwards of 20% of the overall transport budget going towards exactly that. In order to take advantage of the true potential of these electric 2- and 3-wheeled vehicles, we need to provide a safe environment for people. In order to create this shift, people have to want to use them. It's not as simple as just placing it out there and expecting them to just take it. It has to be safe, equitable, accessible, and of course, affordable. We have to think about everyone's needs in these societies, considering not just their differing economic situations, but maybe their gender or any other barrier to their safety in using these. This can be done. Let's maximize the opportunity that electric 2- and 3-wheeled vehicles can provide them. And this is what I'm saying here is just the first approach to this fascinating topic, and we hope that we can expand this conversation of electrification worldwide. And I'm happy to say that this is exactly what this event here today is going to do. And it's my pleasure to now pass the floor to my colleague, Gabriela Moera, from the Transport Decarbonization Alliance, who will be moderating the panel discussion, as well as introducing our amazing speakers here today that will be showcasing some case studies of exactly how you can execute the things that I've just been talking about. Thank you very much for having me.
Thank you, Shivam, for this wonderful introduction. This topic is very close to my heart, as not only that the Transport Decarbonization Alliance, we work with a community of interest on active mobility, but also because I lived in Indonesia for 3 years using a motorbike every day. So I'm very, very keen and excited to hear what all of the speakers are exposing today. I'll start with a fellow Latin American, Carlos Pardo, Senior Advisor of the New Urban Mobility Alliance. Carlos, the word is yours.
Hi, thanks for having me here. I'm going to present very quickly in 10 minutes or maybe less, something which I hope provides sort of an overarching view of the questions surrounding how we can improve two and three wheelers. And I was inspired by one of our colleagues when we were preparing this, because he said, you have very nice information and opinions from the global north and the United States. So then I'm just going to show examples of how two and three wheelers are crucial based on pictures from places in around the world. First of all, I want to tell everybody and invite everybody to look at the shared mobility principles. We at NUMO are, let's say, an outgrowth of the shared mobility principles. So I'd like you to take note and look for them and read them, because they're incredibly interesting. And I'm sure that you'll be very happy when you read about them. And many of the people that you see sitting there in person have been part of the discussion to create them. So one very important thing, many people know this drawing or version of it. It's the inverted pyramid of modes. This is the typical one that we've been talking about. Non-motorist transport and active transport have more priority, while larger, less efficient vehicles or more polluting vehicles such as cars and SUVs have less priority. Despite what you may be seeing in the COP, having an electric vehicle is not wonderful. I think Henry has to close his microphone. But the important thing is that this has, in the past few years, we've had an explosion of modes, many more modes, many more vehicles, things that we haven't even seen yet, like magic carpets. And I could talk about this for a very long time. But let's start seeing the reality in different places. A lot of people have started to worry about this. And this is a typical pictures that we have seen in many places in the world, in those cities which did not have any problems with disorganized smaller vehicles. This is in Washington, D.C. But of course, we have been asking these questions for a while now. And as you can see here, when I took this picture in Bangkok, my question was, is the dog allowed to ride the motorbike without a helmet? Then I rode a tuk-tuk in Bangkok. So then the question is, what vehicle standards should we have for two and three wheelers? Because this is a three-wheeler with a very, very horrifying engine and very high speeds and tons of lights. And of course, when you start looking at what people or where people are parking and what they're parking for, you can also start asking the question, who is allowed to park in each place? Like here, this is Dar es Salaam. And then you can see that many people are parking in order to sell their different things that they're selling. So what is the cost of this? Who is allowed? Should they be allowed? Should rather cars be allowed? I would think that this is a perfect and wonderful way of using space, and they shouldn't pay for this, but many people would disagree. And then there's many other questions around, should we put age limits to who can and when can they and where can they ride these vehicles? And you can see this in many different places. This picture you can take in many places in the world of children riding a bicycle, which for some reason, for some people, they should not be allowed in certain places. So they should use a helmet or they should get registration, which to my mind are the wrong questions. And of course, as you can see in Kampala, you can also ask the question, how to organize the street? Who should be allowed where? How should you organize this And of course, this is a very dramatic scene, but it is a typical scene in which I was taken by a Boda Boda. When I asked him, take me to the most difficult place in your city, he took me here. And then you can also ask, how do you define the dimensions? And again, how do you allow, can somebody with a horse ride in the same place that a person in a motorbike or a person in a bike taxi? So these questions have been there for a very long time. We are now just seeing that the vehicles are different and the vehicles are newer. We are seeing that this incredible amount of vehicles are being produced and launched by very cool companies with a lot of venture capital behind them. And the questions are the same. They just have nicer vehicles and they have much more money behind in order to deploy them either in an organized fashion or an incredibly chaotic fashion. So in reality, what we see is more colors and flashier things, but in the end, it's exactly the same. And in the end, we have to ask, is this a bicycle? Is this a bicycle? Is any of this a car or is it not? And how should we start to see what should be promoted more? What should be regulated differently? And of course, the key question here in general is, don't we have many things that we don't want in the street? We have a lot of cars without any speed limiting software or devices which could have them, and they're killing almost 1.5 million people every day. So we should start taking 2 and 3 wheelers more seriously, understanding how we can make them better, and then seeing how we can improve the streets, we can improve regulations so that they are given many more spaces in better conditions, because they allow mode shift, they reduce emissions, they are safer or can be safer, and they have incredible versatility. So I feel, and in Numo, we are promoting a lot the idea of us being able to use and to regulate and to allow in more places smaller, slower, cleaner vehicles, because they also make us happier, which is a topic that we have to think about. So the last thing I wanted to say is, what should we do? So I guess we have to define what is desirable. I would just say, let's define that as smaller, cleaner, slower vehicles. Let's also improve regulations for these vehicles. Let's give them more space, safer conditions, clearer regulations, and let's promote their use by generating tax benefits, clarifying the messages around these vehicles. And again, it is not about having electric cars. The key word there is car. It is about having a better understanding of what is the best thing, vehicle, service that we have on the street, and how we can regulate them properly. And when you think about that, it is most probable that all of your answers will be closer to bicycles and speed limited, slow, small, clean vehicles than something else. If we don't do this properly, then again, let's go to Bangkok, where you see many different things. We will have 5 people without helmets at a high speed looking to the side to the person who's taking the picture. So that, I hope, gives us a clear view in the first 10 minutes of our talk, so that we can continue the discussion with the other people who have most probably more interesting things to say. So thank you very much for the time. Look forward to others' presentations.
Thank you, Carlos. That was a great presentation. And I think you point out very well about the importance of the questions we ask, the how, as you mentioned, and removing the word car for vehicles. Thank you so much. Now I will give the word to Rebecca Fisher, who is here with us at COP. She's the Associate Director of Road Transportation of the Climate Works Foundation. I'll give the word to you.
Thank you so much. It's wonderful to be here with all of you, and we miss all of you online. We wish we could see you in person, but we're supportive of your decision to be healthy, save carbon emissions by staying home. Today I'll talk a bit about the Drive Electric campaign, and I think yes, okay, it's up there. I'm just looking to see, because I can't really see the slides here, but let's go to the next slide. So the Drive Electric campaign is something that the Climate Works Foundation, which is where I work, which is a philanthropy, has developed with all of our partners, over 80 plus partners that are span the philanthropic, NGO, and research institution space, with the goal of aligning all of ourselves towards a goal of zero emission transportation across every duty sector, including 2- and 3-wheelers, buses, light duty cars, medium and heavy duty vehicles. And in the effort to align ourselves, we can then essentially have greater impact in the work that we do. So the first one is that road transportation is fundamental to modern life and society. So, you know, we can dream of a world where we're all kind of, you know, staying at home, kind of like what the last 2 years looked like. But really the reality is that we all want to move around. It's just a question of how can we move around? What's the most efficient way? What's the least polluting way? And essentially, we need that to get to work, to drop our kids off at school, to pick up groceries. And, you know, I think the stat on the slide speaks for itself, which is that every year over $4 trillion is spent globally on the transportation system. And really, we need to shift all of the resources that are going to the dirty tailpipe, or you know, resources that are building roads that don't have dedicated bike lanes or mobility lanes, into the 21st century to support active mobility. Let's move to the next slide. And I want to quickly talk about it. I'm sorry, I can't see my slides, so I'm just going to scooch forward like this. But our cars and our trucks and our motorcycles and our buses and the traditional polluting vehicles are killing us and the planet. So we need to figure out how can we get an all-electric future, an all-mobile future. And that's really what the Drive Electric campaign aims to do. Let's go to the next slide. So as I mentioned before, we've all aligned ourselves, our 80-plus partners have aligned ourselves on these following goals for electrified transportation. And you can see it starts off in 2030 with 2- and 3-wheelers, buses, light duty by 2035, and then freight trucks by 2040. So what we're here to talk about today is the 2- and 3-wheelers and how we can electrify that segment of the market, which is key, as we heard earlier, for the Global South, and making sure that we improve air quality in the Global South. Let's go to the next slide. So, you know what, I think the most important thing on this slide too is that it's not just about cars and vans, which is what we've heard at COP a lot. Unfortunately, a lot of the big announcements this week and yesterday on Transport Day were focused on cars and vans. And my hope is that over the next year, and as we go to the Egypt COP for COP27, that we can have a greater voice for 2- and 3-wheelers, and particularly for e-bikes and electrified transport that's beyond just the light-duty vehicle, because this really is somewhat of a one-sided conversation when you're just talking about cars and vans. So many people in the world do not use cars or vans to get around. And I think that that's kind of my key message here for all of you who are at COP, is that let's expand our discussion around EVs to include 2- and 3-wheelers. Let's go to the next slide. Okay, and that's me, right? That's my, yeah. I don't think that the image is coming through, but we can go to the next slide. Okay, yeah. So the Drive Electric campaign is centered on kind of these 3 pillars and what we like to call the theory of change, which is that through smart government policies, pushing business leadership, and people-powered coalitions, we can help really accelerate the electric transition. And the people-powered coalitions are the thing we cannot do without, particularly as we're talking about 2- and 3-wheelers in the Global South, because it's already the form of transport, but we need to be able to provide a cost-effective and a type of mobility that fits the use case for people around the world. Let's go to the next slide. Sorry, I'm going quite quickly. So this is a picture I took this week of the electric bus. I don't know if all of you have been transporting yourself here to COP on 2- and 3-wheelers or on the bus, but I just wanted to highlight that there's no 2- and 3-wheelers, electric 2- and 3-wheelers highlighted at the COP that I've seen yet. And again, let's have next year's COP be the COP of electric 2 and 3 wheelers on Transport Day. And the Drive Electric campaign, of course, supports electrification of all modes. But one thing that, of course, is key to having electric be for all is making sure that we are indeed providing a source of mobility that can be afforded and fits, again, the use case of everyone. I'll end with that. I think that's my last slide. And thank you so much for having me here today. I look forward to our discussion.
Thank you, Rebecca. That was great. And it's so true about the importance of the 2 or 3 wheeler. And it's great that we have this space today to have it at COP and to present this conversation. Thank you so much. Now I will give the word to Alexander Korner, Program Officer at the Sustainable Mobility Unit from the United Nations Environmental Program. They actually launched this global electric e-mobility program yesterday. So I'll give you the word, Alex.
Thank you. Can you hear me?
We can.
This is very good. Then now you should also be able to see my screen. Oh no, it didn't work. 1 second. Yes. Do you see my screen? Very good. Okay, yes, thank you for the introduction. As you just said, so yeah, my name is Alex. I'm working for the Sustainable Mobility Unit of UN Environment. I'm actually based in Nairobi, so have a first-hand impression of the importance 2 and 3 wheelers play for mobility in low and middle income countries. So what I would like to do over the next couple of minutes is to walk you briefly through that Global Electric Mobility Program, which we launched just yesterday, and then to highlight a little bit the role of electric 2 and 3 wheelers in that program. So basically, what we are doing right now is we are supporting about 50 low and middle income countries around the world to develop and implement electric mobility projects. For this, we have leveraged $70 million in grants and over $250 million in loans from donors like the Global Environment Facility, the German Climate Initiative, the EU foundations, bilateral development aid, and so on and so forth. It's actually really a pretty sizable program, purely focusing on electric mobility in low and middle income countries. And of course, we are not doing this alone. We're doing this together with partners such as the Asian Development Bank, the European Bank for Reconstruction and Development, the International Energy Agency, Centro Maria Molina in Chile, the UNDP, UNIDO, and then also our partner project, which is Solutions Plus, funded through the EU. So now really, what this slide is showing is the structure of that program. So, of course, most importantly, we have the 52 country projects working on electric mobility on the ground. But then the nice thing is that with the help of the GEF, we could now launch this global support project, which actually provides support to these country projects. And this support is provided on the one side on the regional level through 4 regional support and investment platforms. They are being launched or have been already launched actually in Africa and Asia and the Pacific, in Latin America and the Caribbean, and in Central and Eastern Europe, West Asia and the Middle East. They are implemented together with partners. I'm going to talk you through in a second what these support and investment platforms are for. And then on the global level, there are 4 global thematic working groups on electric light-duty vehicles, on electric 2 and 3 wheelers, on electric heavy-duty vehicles, and on charging infrastructure, batteries, and grid integration. And again, I'm going to tell you in a second what these working groups are for. This is really just to provide you an overview about the program. Basically, country, regional, global, all sort of levels are covered, and we want to really develop a lot more projects with this, implement more projects with this, and raise funds to actually help those who are doing things on the ground to switch 2 and 3 wheelers and other modes to electric vehicles. Now, a quick introduction to what we are actually doing on the ground in these country projects. So most of these projects, they have sort of 5 main components. On the one side, building capacity and creating awareness. That's of course very important. I mean, in many countries, people just simply don't know much about electric mobility. very important is also to establish roadmaps and strategies. If you want to do projects, if you want to leverage funds, if you want to implement things, you need to have targets. You need to have a clear idea. Where do you want to be in 2035? Where do you want to be in 2040? Of course, the development of adequate policy frameworks is very important. So if we want to scale up electric mobility, either in bus fleets or in other shared mobility fleets, we need to make sure that we have the right policy environment, because otherwise it's also going to be very difficult to find the financing. Yeah. And then, yes, business models, finance schemes, again, very important part. How do we pay for all this? How do we make sure that these applications are profitable? Otherwise, nobody will go for it. And then last but not least, we're also piloting electric vehicles on the ground. I think it's also a very important part of the puzzle to actually show and generate some experience which can then be built on to scale it up, to make it bigger. These regional support and investment platforms, they have actually, let's say, four main objectives. One is creating communities of practice. Yeah? So basically, this is the place to go if you want to attend trainings on electric mobility, if you want to attend workshops on how to develop demonstration projects, how to monitor data, how to analyze data. This is basically the delivery mechanisms for the capacity building of the program. On the other side, very important part of that of the regional platforms is the establishment of marketplaces where we want to bring together current and future projects, be that national, be that city level, with the EV industry, be that local or be that international, and with finance. And we really hope that this is coming to be a place where we can make nice relationships between these partners to actually put in place bigger projects. These platforms will also provide a help desk which can be used, for example, to seek for expertise. So the project is going to build up a network of experts, either local or international, which can, for example, be used to provide their services in the projects. And yes, of course, we ourselves are also going to provide technical support and training to countries and cities. These platforms, they are going to be open to all countries. I mean, it's not because they're CHEF funded and only CHEF countries can participate. So it's a participative approach. Now, the global level, there will be 4 thematic working groups. Some of them will be executed by our partner, the International Energy Agency. Some of them will be executed by ourselves. Really here, the idea is to establish forums where we can develop and discuss global and regional targets, for example, where we can provide policy advice, where we can sort of stir that discussion to harmonize standards. Why would we need 3-4 different charging standards for vehicles in the world? This will also be a place where experts can gather to help us developing analytical tools and knowledge products, and all this is going to be made accessible through a toolbox, which is actually already online in a very draft version, basically mostly done by our partner project Solutions Plus. You can access it under this web address, which is shown at the bottom of this slide. So basically, this is that new global program which we launched yesterday, and indeed 2 and 3 wheelers, they play a very important role in all this. Why? Just to give you a few numbers, and I believe those numbers are actually quite old. On the left side, you see market breakdown for motorcycles. On the upper in the upper plot by region, in the lower plot by engine displacement. Why I choose these 2 graphs? That upper plot really shows how
Excuse
important.
me, Alex. I just
yes.
wanted to tell you if you can just wrap it up in 1 minute.
Yes,
Sorry.
1
Thank
minute.
you.
Very good. How important motorcycles for 52 million being sold every year. Lower slide shows that it's actually small motorcycles which are really workhorses. So basically, all this is coming on the market every year, and there's really a big opportunity to electrify these vehicles. And really, the technology is mature. The business case is there. What we now need is the projects on the ground to show the world that it's actually working. And yeah, this is what we're trying to do together with partners. This last slide providing a small overview about our country projects. And close to half of these country projects are actually dealing with 2- and 3-wheelers, being shown as those little motorcycles in this table here. I think that is actually all I wanted to say. I mean, I could have said a little bit more about the actual applications in Kenya, for example, but I think we leave it here and we keep that for the discussion. Thanks very much.
Thank you, Alex. That was wonderful. We'll certainly want to hear more, hopefully in another session. Now I will quickly give the word to Nyaga Kebuchi, Director to the Sustainable Transport Africa. Mr. Nyaga, the word is yours.
Thank you very much. I don't know whether they have you have the slide, my slides over there.
Yes, we do.
All right, fine, thank you. Yeah, so basically, Sustainable Transport Africa is an NGO based in Kenya with the aims of making transport accessible and reduce harmful environmental and health impacts. We have heard about the 3.2 million premature deaths per year that the WHO mentions every now and then. Really, there's been a huge proliferation of motorcycles in East Africa. And where I sit in Nairobi, I can see there's been a huge increase in numbers of motorcycles. And one of the drivers that drives this huge increase is the informal public transport, which has very low customer satisfaction. And because of this, you find people look for alternatives, and one of the most affordable ones is the motorcycle. At the moment, proliferation is quite big. We're talking about, I think I put 5 million in Kenya, but it's actually about 5 million in the whole of East Africa. Out of the 2.5 million registered vehicles per year in Kenya, about half are motorbikes. So that's quite a huge number in Kenya alone. So one of the reasons, apart from the poor public transport for the increase, is that motorcycles are, I would call, versatile economic empowerment tools. These have really empowered the ordinary man and woman. They carry a lot of things. I mean, it's difficult to imagine the kind of things that a motorcycle can carry. I saw the pictures that Carlos put of Bangkok, and I think we have similar images in Kenya. You find them carrying sofa sets. You can see the image in my slide of one carrying a lot of jerry cans, empty jerry cans, that probably a light truck would carry. And so many other things. Meet 3 or 4 passengers apart from the driver. So, you know, I would say motorbikes do everything. Tuk-tuks, and which are the 3-wheelers and motorcycles, an advantage, of course, is point-to-point transport is very quick, very convenient. However, I'll focus more on the motorcycles, where, you know, we have seen a major increase compared to the 3-wheelers. The negative side, of course, is the road code breaking. You know, you find them riding on the wrong side of the road. I'm specifically referring to motorcycle taxis here. Enforcement of road rules is very difficult. Many are used as getaway vehicles in crime. And perhaps if we had more CCTV and number plate recognition, there'll be better enforcement. They're also taking over pedestrian footpaths, which is quite a big danger, as you can imagine. And because of the frequent number of accidents by motorcycle taxis and courier motorcycles, you will find that hospitals have a lot of injured people. Next slide, please. Now, because of this huge number of motorcycles, of course, the harmful emissions. Global warming, of course, is one of the things we're looking at to reduce. Hence, 2- and 3-wheelers should really move towards electric. It should be electric in the future. That will reduce fuel and maintenance costs. And of course, legislation is catching up. And the internal combustion engine motorcycle will soon be under, under threat in terms of legislation. So we have done a pilot together with UNEP. I saw Alexander didn't get a chance to talk about this, so maybe this is an opportunity for me. The pilot is now to foster the transition to two and three-wheeler battery electric type motorcycles, mainly for courier services and border borders, which are the majority. This project has been done in conjunction with Shenzhen Shenling Car Company in China, which donated 100 motorcycles for this project. Project partners are Power Utility, Kenya Power, Kenya Forestry Association, Municipal Authority, Kisumu County Government, a motorcycle startup, and with our assistance, of course. And these were brought down as partly knockdown kits, which were put together by young engineers and technicians. So there is transfer of technology. So that's one advantage. Next slide, please. As you can see, we have looked at several factors. The electric motorcycle we have seen is able to carry 177 kilos. That's the maximum weight we have seen recorded carried. A maximum speed of 80 kilometers an hour was recorded, but in general, they do about 60, which is below highway speeds, unfortunately. Range, 100 kilometers was achieved in Uganda, but in general, we have seen them do about 50 kilometers. I think in the rough conditions, we have found the chain type seems to be preferred. One of the things we have seen is that the odometer doesn't give the remaining range. So, at 60 volts, we have just found that the energy of the motorcycle just cuts off. One of the other challenges we have seen is frequent electrical faults. So these need to be looked at. Next slide, please. Next slide. Here just a short overview of the challenges. Electronic tracking, I think, is essential if we want better data to be captured. Electronic gremlins is what we have seen is a frequent.
Excuse me, Mr. Nyaga, just wanted to say if you can just wrap it up in 1 minute. Thank you so much.
All right. Okay, I'll do it really quickly. Long charging time is a challenge. Low range, odometers that give the wrong readings, below highway maximum speeds, and residual value of motorcycles not really well known. Things like training of drivers of these motorcycles, which are different from the internal combustion engine motorcycles, is important. The lack of noise is a good thing, but it's the other side. It's a danger to pedestrians. Safety, how to tell whether it is on or off. At times you're not sure. And electrical metering, odometer, and the battery density should increase. Last slide, please. Yes, basically, pilots, of course, should lead to upscaling, and that is one of the things that we want to see in future. Companies must rethink their business strategy to look at energy as a very important aspect, and this is where electric vehicles and two and three wheelers come in. Electric bicycles we find are very expensive. They haven't yet caught on. We hope the price will come down, and perhaps maybe they can be sourced at cheaper rates, and maybe there will be an increase, but I haven't seen any in Kenya. So basically, that's the end of my presentation. Thank you very much for listening.
Thank you so much, Mr. Kebuchi. That was great. And as in your words in one of your slides, motorbikes can do everything. I really like that, and I think the audience will remain with that phrase as well. Now I will give the word to Mr. Mizandaru Wikasono, Transport Associate from the Institute for Transportation and Development Policy in Indonesia. The floor is yours.
Okay, thank you. So let me share my screen. Okay, I hope you can all see it. So In this session, I would like to tell you about the condition of two and three wheelers, particularly towards the motorcycle, which are being used, massively in Indonesia, and the development of electric two and three wheelers here in Indonesia. So, as I've mentioned before, that motorcycle currently dominates the street in Indonesia. It accounted for more than 80% of all the motorized vehicles here in Indonesia, apart from being used as private vehicles. They are also being used to transport passengers. They are also being used to deliver foods, goods, and then all sorts of things that makes them really, attractive for people to own. Although it provide opportunities for people to access better income, better jobs, and so on. They come with their set of issues. The first one is regarding the emissions. They are one of the most polluting mode in Jakarta, mainly due to its high population. And so the next issue is regarding safety. 73% of all accidents in Indonesia have involved motorcycles, which is caused by mainly due to their behaviors. This is one of the reasons for that poor safety reputation here. They usually, disobey traffic laws, such as running through a red light, driving on a sidewalk, even driving in the opposite direction, and so on. So this not only present danger to themselves, but they also impose additional safety risks for other road users. This had led to motorcycle restriction in some places in Jakarta. However, due to their huge population, and then they are majorly, come from a lower group of income who cannot buy cars and other, vehicles. It was met with massive objections from all those people. So this is where the electric two-wheelers can come in, because the two-wheelers has already huge population, which makes them costly politically to be regulated even further. So with the electric two-wheelers with their low population, as of now, we could create a better environment. For example, to establish a clearer mode hierarchy, where the less sustainable mode of transport would be used to support the more sustainable mode of transport. Such as, for example, to set the operational limit, or to put the limitation on the operational distance for electric two-wheelers, so that they should only use as the first and last mile connectors for mass public transports. The electrification of two-wheelers could also reduce the emission as well. And lastly, they could also, leverage the domestic industry. In fact, currently in Indonesia, most of the players of electric two and three wheelers are the new players that mostly come from local manufacturers. This is some opportunities that could be taken forward from the electrification of two wheelers in Indonesia. I think that's all from me to say. I give it back to you. Thank you.
Makasi, Mr. Wikasano. It was really interesting to see this. As I said, I actually learned how to drive motorbike in Indonesia for 3 years, so it was very, very insightful, also on a personal basis. Now, I would like to ask a question to all of the panelists here about how shared mobility and other services are provided through and three-wheelers around the global south. How can we improve their conditions to maintain and avoid shifting to individual cars? So I will start with Ms. Rebecca Fisher here.
Thank you. Yeah, that is really the question that we need to all be asking ourselves, right? So you know, who are we to say what people can and cannot drive? But the goal is to encourage as many people who can continue to use micromobility to do so, and shift to clean micromobility and not necessarily shifting to personally owned vehicles. But for those for the industries where or the markets where two and three wheelers are a huge part of the sector, I think that one of the biggest barriers that we need to overcome is the economics. Two and three wheelers that are electric are still predominantly more expensive than two and three wheelers that run on diesel, petrol. That is the key, because a lot of folks use these two and three wheelers to do their job. They're either driving around goods or driving around people or driving around their families. And really making this an economical decision for them is key. I know there's a fantastic startup in Rwanda that has removed the battery cost from the cost of the two and three wheeler so that it's at cost parity with the internal combustion engine vehicle version, and has it basically as a swapping battery system where they own the battery and continue to have a cost associated with using the batteries and recharging them, but it really does make it an economical choice because they're saving on all of the gasoline or petrol costs to fuel their two or three wheeler. Those type of business models and other really innovative ways of rethinking the cost structure, I think are one of the key things that we need to do and really focus on to overcome the barrier. And of course, I would be remiss if I didn't mention safety and improving the ability of two and three wheelers to move around our cities all over the world. I think that if people don't feel safe riding them, they'll switch to something that they feel safer in, which is usually a larger vehicle, and we really do want to try and avoid that.
Thank you. That was great. Now I'll give the floor to Alexander Korner.
Thank you. I think it's really a very important, a very interesting question. I mean, just a couple of numbers. I mean, if you keep in mind that in a country like Kenya, you have about 50 motorized vehicles per 1,000 inhabitants. If in Europe, that's probably 550 vehicles per 1,000 in Europe, 1,000 inhabitants. In the US, it's 700 something. Yeah? Now, first of all, it really says shared mobility is the big thing, yeah, because most of passenger kilometers are actually done using shared mobility. And this is also why I think actually the global south is pretty well set up for electric mobility, because shared mobility means also sort of known mission profiles. You can charge it overnight. I mean, that's all one thing. Now, how can we keep it there? How can we make shared mobility attractive? So I think there's maybe four important things. I mean, first and foremost, I would say urban planning. Yeah? So making that interconnection between public transport, mass transport, and sort of last mile connectivity comfortable, and plan for it from the very beginning, making the sort of planning the city, planning the roads, planning all these sort of things from the very beginning. I think this is a very important step. I think the other thing is regulation. Rebecca, you just talked about safety, and I think that is one very important aspect. But then I believe there's more to it. Make sure that road codes are taken serious, make sure that good vehicles come into the market, make sure that the vehicles are maintained, all these sort of things. I mean, regulation, I believe, is very important in this game. Now, one other thing I believe it plays a major role, which is digitalization. Yeah, basically. Give the user of mobility the convenience to make choices, on the way, to see what options do I have to come to go from the point I'm now to another point. And I think in all this, digitalization, mobility apps, gathering of data, of traffic data, I think it's very important. And last but not least, I think the economic offer needs to be right, making it attractive by a good pricing. Yeah? I mean, if you look at Nairobi, if you go through Nairobi, you need to change the matatu twice or three times. You probably pay like 300 shillings, yeah, which is like $3 roughly. Yeah. If you live in Paris, at least when I lived there, the metro ticket was about €1.60, yeah, and for €1.60 you could go through the entire city by metro. Now the average wage in Paris is probably 10 times higher than in Nairobi, so you see the disparity of what it actually costs to go from A to B and what the service is. So I think there's really a lot which can be done, and yeah, I think. These four things: planning, regulation, digitalization, and providing a good offer is probably what it needs to keep people with shared mobility.
Thank you, Alex. That was great. So safety, choices for customers, quality choices, regulations, and just keep incentivizing shared mobility. I'll give the word now to Mr. Mizanduro.
Yep. So here in Indonesia, the ride hailing, one of the major use for ride hailing is to connect with the transit hubs. So basically, if the transit or the public transport service is not good enough, then people will stop using them. So that is one thing that we need to make sure that our public transport services are in their top shape all time. Apart from that, we could also, improve the service of ride-hailing fleets by electrifying them. So yeah, we know that the TCO or the economic cost for the electric two-wheelers are still higher than that of the ICE two-wheelers. However, the ride-hailing fleets usually travels twice the distance of the privately used two-wheelers. Therefore, they should have a comparable TCO with the when using the electric two-wheeler. So I think the electrification of ride-hailing fleets could as well elevate the whole electric two-wheelers ecosystem in the city and in the country. So I think that is one way to improve the ride-hailing context here in Indonesia.
Thank you so much, Mr. Wicasano. Electrification, certainly. Now I'll give the word to Mr. Carlos Pardo.
Thanks. That question is very interesting. I think the first thing, or one important thing to define, is what exactly do we mean by shared mobility? If we ask that question generally, I think that the perfect example of shared mobility is a bus. But because we're talking about two and three wheelers, then I think that once we know what we mean, and I guess we mean any type of service where somebody either voluntarily or by sort of promotion from the government is using a service with more than one person that they don't know otherwise. One thing that is missing in the context of policies is defining clearly or even creating spaces in the streets where these services can ride safely. And that means that if we have an avenue, if we have a street, we should say, okay, there's this entire lane, which is going to be specifically for vehicles that are speed limited up to 20 or 25 kilometers an hour, electric or without any engine, and that don't generate any significant impacts to society. And this is very important because what is happening now in many places is that when we have a new entrant, like a new electric vehicle, a new electric bicycle, a new electric motorbike, cities and governments automatically take them away from the street and into a bikeway or a sidewalk. And this increases the risk for vulnerable users. So we need to really do the opposite. we need to create spaces in the remaining places in the streets which have the majority of the space. And that may improve conditions, quality of service, and also safety for many users when we understand these shared mobility services and provide them with better context and policies.
Thank you so much, Carlos. That was really important. The spaces, how they're figured, and how it's not necessarily important to change them completely, but just to adapt them. Now I'll give the word to our last panelist on the question, Mr. Niaga.
Yes, as has been said, we already have a lot of shared mobility in the global south. You'll find motorcycles carrying, apart from the driver, maybe 2 passengers or 3. But whether that is safe, of course, that's a big question. But there's a tendency to share mobility, and we have seen it with the ride-hailing apps, which you find that there's been a very good uptake of some of these apps, showing that there's a need in society for more ride sharing. So I think there's one of the challenges, of course, is price. If it's a little more affordable, I think there'll be a very good uptake. And I like the idea of battery swapping, because the range for electric vehicles, and particularly electric motorcycles, is a huge challenge. So improving on battery swapping and making it more common would, I think, be one of the big drivers of electric two-wheelers. So yeah, that's one of the things I think that really needs to be developed. Good charging, and then good parking facilities for 2- and 3-wheelers. There's a lot of parking for 4-wheel vehicles, but for 2-wheelers, it's always a challenge. And they're shown some parking in some remote corner of any facility. So I think that is another aspect that needs to improve. Thank you.
Thank you so much, Mr. Niaga. Safety, regulations, spaces, many things to talk about. I'll give the final words now to my colleague, Shivam from SLOCAT.
Thank you, Gabriela. Okay, I'm checking the time, and I have a short amount of time left, so I'll keep what I'm about to say short as well. Our speakers did a fantastic job of convincing me, right? And I don't say that simply because they're all partners of SLOCAT. I truly believe this. This subsector of the transport sector, if you will, does have the ability to transform and empower livelihoods in the global south. And I know I constantly talk about the global south, but that's my interest, if you haven't guessed it. So now that they've convinced us of that, where do we go from here? The thing is, we have 365 days until an African COP. An African COP is a unique one in the fact that the challenges are unique, which means that the solutions have to remain unique to the region. COP26 has remained electric, if you will. That's the way things have turned out today and yesterday, and that simply cannot be the reality of COP27 and moving forward. So it's up to us here for the next year to flip the dialogue to where we want to see it, to put certain modes of transport higher on the priority list where we want to see them, assuring that the modes of transport that we advocate for aren't simply just green, but they're healthy, they're safe, and they're equitable. Because there is no climate justice unless we couple that with socioeconomic justice at the same time. And that's all from me today to wrap up before our next speakers come on. I'd like to thank everyone here today on behalf of the SLOCAT partnership. Thank you to the audience in front of me. Thank you to the audience online, however many of you there you are. And we hope to see you soon and see you at COP27. Thank you, everyone.
colleagues,
Recording in progress.
thank you for connecting. The event will start shortly. We are just allowing more people to join. Excellencies, distinguished delegates and participants, dear colleagues from all regions of the world, welcome to the event Climate Change Crisis and One Health. A very good morning, afternoon, or evening, depending on your time zone. A dialogue between experts from the Food and Agriculture Organizations of the United Nations, World Health Organization, the UN Environment Programme, the World Organization for Animal Health, and EcoHealth Alliance. This event is included in the program of the WHO Health Pavilion in COP26. My name is Julio Pinto. I am a veterinarian and epidemiologist with the Animal Production and Health Division in FAO, based in FAO Liaison Office in Geneva, and I will be moderating today's session. Before starting our event, allow me to share some details regarding the logistics and housekeeping for these virtual discussions. The webinar will be in English only with no interpretation. It will be recorded and will later be available on our website, along with the various related resources relevant to this session. The event is scheduled to last 1 hour, and you are invited to update your name and organization on the right-hand corners of the box where your own personal video stream appears. For optimal viewing of presentation, please kindly use the speaker view option. Should have any problems or technical issue, please send a message in the chat box to ask for additional support. There will be a question and answer session today. Please write your questions using the question and answer module, not the regular chat box. Kindly state your name and affiliation when you type, and we will try to address as many questions as possible. We are very honored and pleased to have with us today a number of distinguished experts and speakers who will convey the perspective and actions of their respective organizations on their work on climate change and One Health. In this event, we will hear opening remarks from Dr. Keith Sampsons, Chief Veterinary Officer of the Food and Agriculture Organization of the United Nations and One Health Program Coordinator. After that, we will have an expert panel dialogue discussions with the following experts: Dr. Vittorio Fattori, Food Safety Officers at the Food and Agriculture Organization of the United Nations, Dr. Tiana Brand, Advisor Foresight at the World Organization for Animal Health, OIE, Ms. Cristina Romanelli from the Environment, Climate and Health Department at WHO, the World Health Organization, Ms. Doreen Robinson, Head of Biodiversity and Land, United Nations Environment Program, and last but not least, Dr. Catherine Machalava, Senior Policy Advisor and Senior Scientist, EcoHealth Alliance. Dr. Catherine Machalava Also, she serves as the science officer for the Future Air One Health project, and she is currently connected from COP26 in Glasgow. Thank you all for your time and agreeing to be with us today. First of all, we would like to thank WHO for including this event in the program of the WHO Health Pavilion in COP26, and also to thank OIE, UNEP, and EcoHealth Alliance colleagues for accepting the invitation to participate as panelists. Climate change crisis is a fact. Climate change is the greatest challenges for our time. Reducing the impacts, mitigating its effects, and adapting to climate change is a global and urgent priority. One Health is an approach that can contribute to the solutions to mitigate and adapt to the impact of consequences of climate change acceleration. These two issues are interconnected and linked to human, environment, ecosystem health, and animal health. With this webinar, we would like to share views, visions, and the work of different organizations on how to address the consequences of climate change on health and how to use effectively the One Health approach for building mitigations and adaptation strategies and policies. Without further delay, I would like now to stray into the substance and give the floor to Dr. Keith Sampson, Chief Veterinary Officer of FAO, who will give his opening remarks on climate change and One Health and the vision and work of FAO. Keith, the floor is yours.
Thank you very much, Julio, and thank you for the invitation. And to everyone who's here, whatever time of day you're joining us, this is the greatest time of all to be talking about climate change and what we can do individually and as organizations working together to contribute to try to ensure a safer and sustainable future. So in the global context that we have, I don't need to really remind you of this, that one of the most significant things we can say is that transformation is needed in all parts of our agri-food systems, and that we need to have interventions on the supply side and demand side in agri-food systems, and we need to make immediate, rapid, and large-scale reductions in greenhouse gas emissions, and consider that maybe 37% of total greenhouse gas emissions are attributed to food systems. FAO, like other organizations, is considering what will its strategy be in this area of agri-food systems. Where does it feed in? Well, very clearly, one organization, however big, cannot do this alone. It has to do this together with its partners, and it has to be done practically globally. So we fit our developing strategy into this area of influencing and accelerating progress through the countries we work with, through data, technology, innovations, and governance. This is not about FAO strategy, but just simply to say that there's a development of a strategy in FAO to address our contribution through the agri-food systems to ensure their climate resilience and adaptive to the impacts of climate change, to contribute to low carbon economies while providing nutritious food, diets, feed, fiber, and fuel through innovative solutions. And the transformation of the agri-food systems is central to FAO's strategy for the coming years. And we do that because almost all parts of our agri-food system contribute or are affected by climate change, and the impacts of those are a connection between climate, human health, ecosystem health, and animal and plant health in our agri-food systems. And that's something that both contributes to potential climate change, but also has to adapt to the consequences of change. Now, One Health high-level expert panel is developing a new definition of One Health, very much anchored in a set of principles, recognizing the equity and importance of ecosystem health, animal and plant health, and human health in its approach. So it's really thinking far beyond what are the impacts of climate change on human health, on the two-way relationship between what we do in health and our planetary health as well. So we have a lot of connections and drivers between the increase in temperatures and over 58% of in our estimate of animal diseases are climate sensitive. Vector-borne diseases we've seen in the last few years moving to almost equalize their distribution between places like Africa and Asia. So climate change is really already affecting the way that we manage diseases and which diseases we manage. But it's not just about disease spread, it's also about the impacts of climate on food. And we'll hear a discussion about that and hear more of those connections as we go through. Multi-sectoral problems, all caused by similar drivers affecting animal, plant, forest health and their productivity, foodborne disease, biodiversity loss, the pandemic risk, and antimicrobial resistance. They need a multi-sectoral One Health approach. So together, the 4 organizations, FAO, OIE, WHO, and UNEP are working on a global plan of action for One Health at the moment, and trying to ensure that we will be able to contribute strongly together, particularly in the area of adapting to the risks. But let's not forget that mitigating climate change is vital, otherwise we'll simply be adapting to a changing climate. Climate change also depends on what we do in the agri-food systems. And for example, health can make a very positive contribution to mitigation. If we consider livestock alone, boosting efficiency of livestock production would be one part of this, ensuring that the greenhouse gases which currently are produced might be offset or mitigated through the things that we do. Now, a simple example, but I think it's important from the livestock side, is that if we take this graph and we shows the intensity of emissions of CO2, and on the bottom scale, the efficiency of production of proteins in milk. We have high productivity systems that can be relatively low in terms of carbon. We can have very low productivity systems which are very high in terms of their climate impact. So if we move to high productivity systems, what would be the impacts of that? There may be other health impacts that we have to consider in the One Health system, but if we move in that direction of efficiency through health and other gains, that might be a major offset or a major way of reducing methane, for example. So much of our attention is to adapting to climate change, preventing, preparing, and responding. And just to give you an illustration, here's a quick movie which we'll run through right now. I hope it plays. So I think that's compelling by itself. And if we consider, for example, other things which are affected by a climate crisis, some people don't realize just how much AMR is also one of those things which is positively influenced, but not in the right way, by the climate crisis. So really, in our work together, we have to consider the broadest impacts of the climate on increasing transmission, not only of pests and diseases, but of resistant microbes as well. Pandemic diseases, of course, this last year have been a huge topic, and they will remain so. And I think other speakers are going to talk more about this in terms of the risks that are associated with the way that we have managed our environment. Now, as we move forward, we have to ensure that we put prevention at the top of the agenda. Now, that means fitting the One Health approach that we advise as being the best one for this into the main areas of work against the major crises, including through biodiversity mainstreaming and making sure that One Health is part of that, but pretty much part of all of the development of our approach, and to be able to better prevent, because we know that preparation is often not enough and responding is often too little and too late. So building back better, we have, as 4 organizations, come together to try to identify the scale of the change that would be needed as part of a global approach to prepare, prevent, and respond to pandemics. And we would estimate that around $1 billion a year is needed simply to give the technical support to countries to be able to better prepare, prevent, and respond. So in summary, climate change is affecting health in multiple systems. One Health is relevant both to mitigate as well as adapt to climate change. The adaptation and mitigation should be multidisciplinary, multi-scale. From the individual to global, we can all make a difference. Evidence-based, gender-sensitive, flexible to circumstances, and sensitive to all of the aspects of different sectors. And finally, we have to be innovative about how we do this and bring innovative funding to the fore. We cannot continue as we used to do. Thank you very much. Back to you, Julio.
Thank you. Thank you, Keith, for your opening remarks and for highlighting the importance of the One Health approach to prevent and address the risk posed by the climate change crisis, and specifically the work of FAO to develop and support mitigation and adaptation strategies for the agriculture sector in all member countries. And now I would like to open the panel discussion and inviting my colleague Jeff Lejeune to facilitate the panel discussion with our speakers. Jeff, the floor is yours.
Thank you very much, Julio. Again, my name is Jeff Lejeune. I am a veterinarian and a food safety officer here at FAO, based in the HQ in Rome. So thank you all panelists for joining us. I have a number of questions. How we're going to work this, I have one question. I kind of will go around the room and ask everyone on the panel the same question, see what different responses that we'll get. And then we'll go with a second round, and we have kind of specialized questions for each individual person. Now, I appreciate, maybe I'll just tell you so you can prepare a little bit. We'll go through Doreen, Christina, Tiana, Catherine, and then Vittorio in that order, so you can prepare. I'll ask you to keep your responses to a minimum. We want to be able to have time at the end for questions from the participants as well. The question, however, is probably longer than the 3 minutes I've asked you to restrict yourself to. Okay, so just pay attention, and hopefully, if you need to be repeated as we go to the next person, that's fine, but you can think about it as we're going on. You all have the same question, and it's a 2-part question. So from your organizational viewpoint, and we heard a little bit about some FAO things that Keith mentioned in his talk, but from your organizational viewpoint or perspective, how can a One Health approach help address the multiple shared drivers of climate change, biodiversity loss, and ill health? So how can we use One Health to address all these different things, okay? And then the second part is kind of the flip side. if we don't use One Health, what are the possible missed opportunities of not taking advantage of a One Health approach? So, from your perspective, what are the opportunities for the drivers, and then the missed opportunities if we don't? So we'll start with Doreen, please. And don't forget to unmute yourself. Great, fantastic.
Yeah, thanks so much. Okay, 3 minutes. That's a big question. So from an organizational perspective, first I want to react to something that Keith said in terms of the opportunity. Right now, adaptation only is a race we will not win. And so we really have to get into mitigation measures. And I think what's really important about understanding that is that the drivers of climate change are the drivers of human health risks. As climate change goes up, we have 10 billion people a year dying from air pollution. We have all these complex interreactions between increasing risks of zoonotic disease tied to unsustainable food systems, tied to malnutrition, tied to obesity, tied to micronutrient deficiencies. So when we address the climate change crisis, we are addressing all these other factors, and they all contribute to sustainable development. But from an organizational perspective, we're taking a kind of three-pronged approach to it. First, we've got to get the science right. If we don't get the science right, we don't have the evidence we need to make smart policy decisions. And so part of what we're investing is that science, both the biophysical science, understand how climate change interacts with health risks, but also the socioeconomics aspects as part of this complex risk assessment. The second part is turning that science into usable policy. And that's where I'll talk about where One Health offers a real solution is this interdisciplinary approach to complex problems. These are complex problems, they're interrelated problems, no simple solutions. So by taking that approach, by bringing these different sectors together, the co-benefits are more likely to emerge in that process. And then the last part of our focus is also particularly, we're really focusing on the food systems aspects of this. We know that, we saw that number up to 37% greenhouse gas emissions from food systems. We know that about 14% come from the livestock sector alone. We've got to solve those food systems problems if we're going to solve our climate problem and vice versa. The answer to your second question is simple. The missed opportunity is threatening all life on Earth and not achieving our sustainable development goals, which is not an option for us. Thanks. You're muted.
I got caught. Thank you. You gave us a lot to think about in 2.5 minutes. That's great. We'll move on to Christina, please. Are you good with the question, or you want me to repeat?
Yeah, no, it's great, Jeff. It's a multi-pronged question, a really big ask, but I'm going to give it a shot. It's great to be here, amongst such a terrific panel of partners at the WHO Health Pavilion at COP26 for the first time. So fortunately for me, Keith and Doreen have done such a brilliant job in setting the scene, so that makes it a little easier. And I'll jump right in by adding that the climate crisis, the biodiversity crisis, and the health crisis we're all facing, not in future, but right now, are not standalone challenges that can be easily compartmentalized, but are all part of one broader global challenge, one bigger picture. And as such, they're also the quintessential One Health issue. So the missed opportunity is right there. If we don't address it as such, that is our opportunity. That is our missed opportunity. We are beginning to compartmentalize, which is what we've already done, which is how we've already failed. And One Health in itself does make it possible to adopt a more holistic vision and approach to safeguarding human, animal, plant, and ecosystem health in a much more integrated way. But why do we need to have this holistic vision? Because the drivers of biodiversity loss, whether we're looking at deforestation, overfishing, other forms of land use and sea use change, habitat conversion and destruction, invasive alien species, or the homogenization and intensification of our agri-food systems, among others, the confluence of these drivers are not only driving biodiversity loss, they're also exacerbating climate change, and in so doing, are increasing our exposure and risk to disease emergence, both infectious diseases, which affect over 2 billion people annually, and that is pre-COVID numbers, 2/3 of which are indeed of zoonotic origin, and non-communicable diseases, which continue to pose an enormous health burden globally, exacerbated by climate change and biodiversity loss. Just to give a few additional numbers, Doreen had already mentioned some, 7 million are affected every single year by air pollution alone, and an estimated 11 million people, adults, have been affected every year by unhealthy diets. So we can't compartmentalize these things. There are many, many lessons that arise from, but have also preceded the COVID-19 pandemic. And among them, and to complement some of the points that were already raised, one is that our health is simply not negotiable, and we're fully dependent on a healthy environment and stable climate for healthy and productive lives. Two, the impacts of the COVID-19 pandemic on our social, economic, and health systems is only one of many examples in a long series of broader, not only sectoral, but systemic failures, including the failure to make the connection between our own health and healthy ecosystems with our climate and, importantly, our socio-political and financial structures as well. Third point is
Third point.
building, and I'll stop right after this one, is that building back better and stronger from the COVID-19 pandemic implies that we have to do things better, not only better, but differently, with greater urgency, coordination, ambition, and coherence. And with a focus on equity as a linchpin, because it's precisely those most vulnerable populations that are least responsible for climate change, biodiversity loss, and ecosystem degradation that are most directly affected by their impacts, and those least covered by social protection mechanisms. So there are the opportunities in a nutshell.
Great, thanks for that comprehensive response. Now I'm thinking we probably should have drawn straws to see who went first and who went last, so they have novel things to say. But as we say in education, if you repeat the thing three times before it sinks in, I think we'll see some recurrent themes here going on. But everybody is providing some valuable insight. Let's turn to Tiana and see what's your response, please.
Well, I think all our participants can see how excited we are to be working together as 4 organizations, and also to be working with partners in our One Health high-level expert panel. And Catherine is a part of that, and she'll have lots to say on that. So as my 2 colleagues have just said, One Health, the whole point of it is to collaborate together across multiple disciplines to attain optimal health for people, animals, and our shared environment. So no one is going to be excluded. No thing is going to be excluded from the range of impacts of climate change. We are simply going to need all hands on deck to understand better and act on the drivers and impacts and solutions. So for certain, with various diverse with our diversity in our disciplines, undertaking whatever we need to do, whether that's risk assessments or overlaying our data on top of one another to really explain to the public and to to support our member countries about what is happening in real time or not, with respect to climate change and emergence of diseases and impacts on health. We have so much data out there we can use together. So certainly climate change responses are ripe for multi-sectoral collaboration. We all have to do it, but also for political support and the financial investments in the preventions and mitigations, or tackling the root causes and drivers, if you will, as well as the adaptation. I absolutely agree with Doreen. Playing the adaptation game, we kind of lose out, but at the same time, we still need to build the resilience of communities and systems. But Jeff, maybe I'll just leave it there because I know we don't want to run out of time for the other panelists. So I'll just close it off there. I won't, if that's okay.
Thanks, Tiana. You mentioned the time is ripe for a multi-partner collaboration, multidisciplinary. And what happens if you don't pick right fruit? It rots and it goes to waste, and we could really lose out here if we don't move forward.
We can make a nice cider.
All right, let's go to EcoHealth Alliance. And Catherine, please.
Thank you so much. It's really an honor to be here. And I'm here at COP26. You can see behind me the Health Pavilion, but I'm also next to the Congo Basin Pavilion. So I want to talk a little about deforestation and also reforestation and sort of where One Health can inform on those, the action on the shared drivers of biodiversity loss, of climate change, and pandemic risk. So I think this added value of One Health, when we really think about why it's needed, it helps us to identify the risks more comprehensively. It also helps us to optimize resources, collaboration, really have those co-benefits that Doreen mentioned. But it also helps us to avoid the trade-offs that we see all too often. So if we think about something like reforestation, we know it's really important for many ways, for ecosystems to be restored, to again provide the ecosystem services, including carbon sequestration, which we know is so important for climate action. In some cases, it can actually increase disease risk. So vector-borne diseases, zoonotic diseases, this isn't a reason to not deforest, but it is a reason to say, well, we need to build in proactive monitoring, surveillance, risk reduction measures. So I think, if we only look in one dimension, we sort of miss that opportunity to mitigate those trade-offs. We look at the value of leaving a forest intact and the carbon sink, the ecosystem services that it provides, the cultural and spiritual services, and then all of the suite of health services, and really cost those out. I think that currently there's a missed opportunity in doing that in a systematic way. So we know the value of cutting down the forest for certain industries, but we're not really thinking comprehensively societally about maintaining forests and ecosystem service. So just to say that there's a huge value addition from a One Health approach, and it's great to see the partners working together. Thanks.
Thank you, Catherine. Now we'll turn to Vittorio from a food safety perspective, or FAO. Please.
Thank you, Jeff, and good day to everyone. Thanks for the opportunity. Without trying to repeat what my colleagues have already said, looking at it from a food safety point of view, I cannot think of any better subject where the One Health really is needed. Climate change threatening our food safety systems, really, it's something that we need to consider. Under best circumstances, keeping and ensuring safe food is not an easy task. But if we consider the drivers, the challenge that we are living in, one of those, of course, probably the most defining challenge of our time, climate change, putting additional pressure on us to make sure that our acts are actually right, to make the right thing, which means that we need to work across the system, the agri-food system, from the farmers to producers, to veterinarians, to medical doctors, to environmental specialists, to us food safety professionals, down to, of course, policymakers, regulators, and down to all of us as consumers. We also have some responsibility as consumers to make sure that we do the right things, we make the right choice. So we need to be informed. We also need to make sure that we have adequate information to make the right decisions at different levels. So from the FAO, what we are trying to do also with respect to food safety and climate change is exactly shedding the light on what are those impacts. We have been talking about climate change for decades now, but still, some of the impacts on food safety, for example, were not well understood until quite recently. And so we are trying to bring that knowledge, that science that we were speaking about, in terms of making that the foundation for a policy decision-making process. So that's, for us, it's important. So we want to make the science that it's available and we know the things that needs to be done, and make sure that the message is passed in the right way so that policymakers, people that make the decisions, know what needs to be done. And just to conclude, I cannot think, as the other has said, the one silo approach we know doesn't work. So we need to change it. The one silo / we keep the one, but we insert the One Health instead of a silo. So I'll stop it here. Thanks.
Yes, thank you very much. That was a quick round of first questions, and I can just feel the excitement and enthusiasm of all our panelists coming through. The time just flew by. But we want to keep moving, keep up the pace here. we'll turn back to Catherine again. I mean, you mentioned a couple things about One Health and being a collaborative program, but how can we you want me to expand a little bit on how it can be used programmatically to maybe give some examples of how we might use it to adapt or mitigate, probably more importantly, the effects of climate change crisis?
Yeah, thank you so much. Well, I think at national level, we're seeing such exciting models of One Health in action through these national One Health coordination platforms. And we know that, each country has its national adaptation plan, its now national action plan for health security, action plans on AMR, national biodiversity strategies and action plans, and agricultural livestock development plans. And these are all really important plans, and they have really important objectives that are crucial. But if we have them so separately pursued, again, we miss these opportunities for resource optimization, working together, identifying actually the risks that may emerge if we're not sort of coordinating. So I think on climate action, there's a lot of great work here at COP26 that we've heard about, including from NHS Greener here in the UK, which is really taking a low or no carbon emission approach to the UK's healthcare system. I think if we broaden that out and say it's not just human health, it also needs to be animal health, environmental health systems. As we build up those laboratory systems, surveillance, healthcare systems, we need to do that in a way that is really green. So Christina mentioned building back better, and we need to be able to respond when there is an epidemic or other a natural disaster where we have injuries, but we also need to be preventing and really detecting better as well. And we need to do that in a way that is climate smart, climate sensitive, and really preparing, and also not just driving more emissions, but actually helping to build up systems in a more resilient and green way. Thanks.
Thank you so much. That was helpful to add to the discussion. The next question, I have a list of questions here, and actually this one's for Doreen, but it's actually, I see my list, there's like 5 questions packaged together. So what I'm going to do is I'm going to read the question out to you, ask you, and give you a minute to think about it. And I need to make a little announcement while you're talking about it, and then get back to you to respond. So you'll have a second to gather your thoughts. So the question really is, how does the climate change and this crisis we're in affect zoonotic disease emergence and transmission? For example, how does it affect the drivers of disease spread? Okay, and looking at these things such as habitat encroachment, intensification of production, food availability, land use, all these factors. Can you weave that into a little story for us in under 3 minutes? And what I wanted to do while Doreen is thinking is I wanted to draw your attention to the Q&A box in the discussion. So if you have a question, type it in there. We will try to get their panelists to answer some of these questions, and we'll draw from those questions that are there during the discussion period to answer them, some of them, as many as we can, in the time that remains at the end of the question period here. So Doreen, back to you.
Okay,
Drivers
here we go.
of emergence.
Drivers of emergence. Well, so first of all, I'm gonna move up and down the scale a little, so we can understand this. First, in terms of if you look at that pathogen, species, environment interface, we know that temperature, rainfall, humidity changes. Basically, sometimes the pathogens themselves, sometimes the species they work through. There's some emergent evidence that in some particular infectious diseases, it's actually driving genetic mutation. So we're actually affecting the disease itself and how it's spread at that very micro level. But at different diseases operate in different ways. And that's really important. There's no one answer on that. Let's take it up a notch and go to the ecological level, the ecological scale, the landscape, seascape scale. Right there, if we look at that level, what we know is that shifting agroecological zones that may or may not emerge from climate change, hopefully not, also drive the movement of species. And when I say movement of species, I mean the human species as well. And as that happens, it changes a very complex risk factor. What's going on in terms of how humans are adapting to the risks that they're under, and that can further drive use of environment as a means of coping and adapting, it can also change the novel interfaces where these diseases can spread into new species or not. So we have to look at it at that level. Now I'll take it up to the macro level where we look at it. And there we talk about this vicious cycle of land use change and unsustainable consumption. And I'll go back to some of those numbers. We already talked about the role of changing habitats, often driven by an intensification of agriculture. We know that 25% of all infectious diseases since 1940 had at least some implication with intensification of agriculture, 50% of the zoonotic ones. So we know if we don't address at that level what is happening in terms of agriculture desire for cheap meat in particular, for some, for other people, they don't get enough protein, is driving the way we use habitats, it's driving the change, and it's reducing the resilience and the buffer of our natural systems to provide the services we need to stay healthy, but also changing that risk factor. Thanks.
Oh, great job there. It was interesting how you bookended your description by the invisible. There's certain things that we can see, but it gets down to the molecular level that we can't see, and it goes all the way up to the planetary level that unless you have, I don't know what the price is to go up in a spaceship and look down, we can't see that either. So there's what we see evident in front of us, and there's a lot going on that we don't see. Interesting. Vittorio, that video and that video I think is available online if people want to go and review it again, but it went by really quick. Can you kind of maybe give us a few key pointers in terms of the specificity of the effects of climate change on food safety?
Sure, and hopefully also by giving this just some quick examples, it will be even come clearer how the One Health approach is really needed in this case. For example, one of the key features of climate change is rising temperature. We know that climate change does much more than that, extreme weather events and other things. But if we just look at rising temperature, we will see that the rising temperature has a multitude of a cascade effect on food safety. There are evidence linking rising temperature to increase incidence of disease related to foodborne pathogens, Salmonella and Campylobacter, for example. If we look at the marine environment, we can see how the rising temperature in the water is leading to creating some environment where algae blooms can actually be spreading. And these algae blooms most often comes with also marine toxins, which in turn are consumed by fish, which are consumed by all of us, human beings. So we are exposed increasingly to marine toxin also to that route. If we stay on the marine environment, we know that, for example, one of the key contaminants that we are concerned from a food safety point of view is methyl mercury, because it has a huge impact on the development of the brains in the fetus. And we know that the methylation of mercury in the water is temperature dependent. So the more the temperature increase, the more methyl mercury you will actually have. I'm making simple just to get the message across. But that's another key point. Again, on heavy metals, arsenic, it's one of those hazards that has a huge impact in terms of public health because it contaminates water and some staple crops such as rice. So the uptake of rice is facilitated by also the raising of the temperature. And just one final example, just again to show the diversity of impacts, it's on fungal infections that may lead to the presence of mycotoxin. Mycotoxin, for those that are not familiar, are some metabolites toxic produced by some fungi species, and they can contaminate staple crops, such, for example, maize. And this again has a huge impact in terms of public health burden, but not only, also in terms of trade, because it can impede access to trade, to markets. So just to say, those are just some quick examples. We have illustrated them more in a recent publication from FAO, but I think it's important to show the diversity of these impacts. And just to conclude, those impacts, again, do not happen in isolation. They happen together. So the burden is huge and we need to do something. The only one thing that I can think of is really do One Health. Stop here.
Great, thanks. And not only happen to everyone, everybody eats. So we really have to be concerned about what's going on in this world and what we're putting in our mouths. Let's turn to OIE, Tiana. My question is maybe more veterinary specific, and in this time of crisis and disasters, how can we anticipate what's coming in the veterinary services that need to be adapted to be more resilient to what appears to be more frequency of these disasters, pandemics, epidemics? So how can we prepare for these a little bit, and what guidance and work do we need in One Health in the veterinary area and animal health services?
Oh, another tough question, hard to answer in 2 minutes, but I'm not sure my answer will be satisfactory, but I'll give you a few things to consider, if that's okay. One thing I mentioned in my opening was we have information everywhere. We have data. It's most of it is accessible. We have the opportunity to do things like disease modeling and forecasting, to give us a bit of a picture of what's happening now and maybe, out a little bit as well. A lot of times forecasting is set up to do some predicting of the future, and predicting the future is not a great business to be in, but you can at least use this information. I mean, predicting the future, it's volatile, it's uncertain, things can happen, novelty can arise, and you kind of throw your whole system off track. So a lot of things that myself and some colleagues have been looking at is, we need more. We need a little bit more. We need another lens on this. Forecasting only kind of gives you one kind of lens, and why not something like futures thinking and foresight and futures literacy frameworks that sort of lend ourselves to creating conceptual views of possible futures and allow users to better understand and identify implications. And so this is where needs a lot of diversity of thought and perspective as well. So it's similar to taking a One Health approach. So this type of thing can help us a bit in prevention. We need to come up with some excellent what if questions. Questions that frame futures thinking can be powerful motivators for change, including changing narratives. A lot of times when we talk about health, we think about public health, and that we can change that narrative with these what if questions, recognizing that health of the environment, wild spaces, animals, plants, water, soil, air is public health. So what if we thought that way? What if we all thought that way? What if we had that in our systems, our educational systems, had everybody speaking that way and thinking that way? I think that it's not just for veterinary services, but certainly at OIE, we're thinking about that within the UN system. There's a lot of emphasis on foresight and foresight frameworks and futures thinking and futures literacy as well. And I think this area is kind of ripe for that because it opens up a dialogue and a space to bring others in. So I'll leave it at that.
Yeah, great, thanks. You mentioned a lot of terms, future thinking, forecasting, foresight.
Yeah.
It sounds like you have a magical crystal ball there, but we do a little bit of that too at FAO, and I'm sure WHO as well. It's not really mystical. It's actually science-based. And I think when we put our heads together with a little picture that we have from this angle over here and your angle and all the other angles, it can bring them into focus a little bit more. So I think that's a really a good point that you bring in. These are using data. It goes back to the beginning to be able to see what we can see and be prepared for the future. Thank you very much. We have time for one more question, then we'll open up some questions to the audience. So back to Christina. And your question, facing climate change crisis and health outcomes, how can One Health be integrated as an approach to strengthen a health system? I mean, I'm sure you could talk for more than the remainder of the time that we have in this seminar on this, but if you could limit to the high points and get through in a few minutes, and then we can turn to some questions. So how can we strengthen public health systems and so that we can prevent some of these future pandemics, especially those associated with climate change? Over.
You're right. This is definitely a discussion that can take much longer than 2 minutes. But let me try to bring in some high level points. So, how can One Health help? I think that one of the things that we need to be doing right now, One Health is not a new concept. It's something that we've all been working on for well over a decade, including most of the partners around the table, with the possible exception of UNEP, which we very much welcome because we've we've very much been neglecting those environmental and socioeconomic drivers. So one of the ways we can do that is by strengthening overall social and ecological resilience. One Health is an essential tool to really get to that. And I mean, there are many activities in which that we're jointly engaged in. This global plan of action for One Health is an excellent example of how to get there. The establishment of the OLEP, the establishment of the expert working group on biodiversity, climate change, One Health, and nature-based solutions. All of these are really important entry points to really bring us together and to strengthen that resilience, not only of public health systems, but of health systems as a whole. And what does that do? That also means that we have an opportunity to tackle the 1 in 4 deaths that is currently attributable to preventable environmental factors. And that is before the COVID-19 pandemic struck. And another one that I'd really like to just emphasize, and maybe on a closing note, because I know we have limited time, we were talking about missed opportunities, and there's really a huge missed opportunity to invest in prevention. At present, right now, less than 3% of the budget is geared toward prevention, and 97% of that is actually turning toward emergency response. If we're looking at missed opportunities, there's a crucially important one. It's not only short-sighted. It's absolutely unacceptable, given the breadth and scale of the challenges that we face, particularly since prevention is infinitely less costly than response, with some estimates showing that investment in prevention is up to 20 times less costly than emergency response. So one of the things that One Health does is precisely afford us that opportunity to get to those root causes, to invest in those drivers, in those common drivers of biodiversity loss, climate change, and global health challenges that we face. Can I just name two resources that I would like to point participants to? I won't get into them, I promise, but for further reading, I would very much like to point out that very early on in the pandemic, we had published a WHO manifesto on a healthy, green, and just recovery, which very much speaks to a lot of the topics that have been raised throughout this discussion. So I'll be putting a link in the chat box there. And another one is an important one. We've also recently launched the health argument for climate change. So while I can't wrap it all into 2 minutes, it is a very important document, 10 really succinct points, and I would like to draw everybody's attention to it. And you will be happy to know that One Health is front and center in there. Thank you so much.
All right, if you want to have the time to, you might be on a hotspot again with the question, but type in the links to those in the chat or the Q&A, that would be helpful. I'm looking back to my colleague Julio. I've been enthralled by these responses and haven't been able to look at the Q&A questions yet. Did you have a chance to pick one off there that we might be able to have somebody address? Let me see if I can zip through here.
Thank you, Jeff. I think this has been terrific and very, very rich discussions with the panelists, and we have very interesting questions in the question and answer box. I want to just pick up one or two questions because we will not have enough time to address all of them. But there is a very interesting question related to the education. I think the education on One Health. And Jeff Farber is asking how we can do a better job of incorporating the One Health approach in undergraduate programs so that young scientists can have an understanding of this holistic approach at that early stage of their career. If I don't know who wants to pick up this question, but we are inviting any member of the panel, or Keith, if you want to jump into the discussion as well, how we can do a better job incorporating the One Health approach in the education at the undergraduate level of young scientists.
Thank you, Julio. Well, it's a long time since I've actually taught undergraduates, masters more recently, but I wonder why we start with that level. Why not start at schools? I mean, why not start in primary education? I mean, really, it's in part starts with respect for the different domains that need to be protected, how they contribute, and build from there. So I think there is an emerging science about One Health and its evaluation, which is not about just zoonotic diseases or AMR, but it's about how do you understand to how you value the different benefits that come from different. So there's an economics of One Health. There's also the science of understanding the models of interaction. So, I mean, there's a lot you could explore in terms of education without giving them lists of diseases, without giving them all the negatives. So focusing on the positives that would come from understanding how these complex interactions and cycles work. So I haven't got an easy answer, except that there's plenty of rich materials for anyone who's in education to be using in real life classes and assignments. Thank you.
Thank you, Keith. There is another very interesting question related to the funding and financial aspect of One Health. How we can influence and advocate at the policy level and policymakers in countries that they can allocate resources to the work of these national One Health platforms, or to stimulate the development of capacities in countries using the One Health approach. Someone wants to pick up this question, how we can influence at the national level the decisions of policymakers? Doreen, I think you can. Okay, thank you.
I wish I knew the actual answer to this, but I have some ideas. And one of them is we talked a lot in the panel about co-benefits, and people have to understand the co-benefits of implementing approach. When you provide real evidence of what those mutual benefits can be across sectors, that creates an opportunity to pool resources. It's not about stealing money, and I've had this conversation with countries, stealing environment money to work in the health sector, work in the environment sector. That's not what we're talking about here. What we're talking about, what is the full suite of resources that have to come together to actually meet sustainable development goals. And if we go back to that first question and we're able to articulate the risks in a much better, smarter way with evidence, you can make the case better.
Maybe Julio, I can just add to that, to what Doreen says. I mean, I think with there's several sort of points where there may be sort of significant funding and investment may come, and one of them is in relation to preparing, preventing, and responding to that side. Now, if loans to countries are actually contingent on them having a proper level of pathway towards One Health as part of that, I think that would focus a lot of minds at country level in terms of ensuring that they put in place the types of structures to be able to build that, as well as the indicators and targets. And maybe the other side is it could possibly come from the environment side. When we're talking about innovative finance for mitigation or adaptation, then potentially, if it's with innovative routes, that might make might create some potentials for new and innovative ways to link what is the health contribution, the climate contribution of better health systems. Getting that to work is going to be, we're going to have a lot of top brains are going to be needed to do that. But we can imagine it might even work at the level of a farm, that you get incentives to put new performance measures in place.
Keith, while you have the stage, do you want to make a few concluding remarks? And we're going to have to wrap up here before several of us, I mentioned in the chat, get locked in their offices overnight. Please.
Yes, well, thank you. No, I'd really like to thank everyone who's joined. I think the questions have been fantastic. I think our speakers and our panelists, should have enthused everybody that not only have we got a huge crisis that we have to address, but this crisis is requiring us to work together and to work in new ways and to apply things at a scale that we've not done before. So this isn't going to be about what a few organizations can do. This is going to be about influencing the many, in fact, across the globe to be adopting and adapting to the risks around them and insisting on better in terms of national approaches and doing things different at the personal level, whatever we're doing, from livestock keeping through to education, through to policy making. So we have huge challenges ahead, but we also have, I think, good ideas. Now, we really do need our global leaders when they're considering investments to ensure that they do include One Health as part of the solutions, both to reduce the risk of climate change, to mitigate it, but definitely on the side of adaptation. So thank you very much to everyone who joined us, and let's keep working together on this.
Thanks to all. Thank you.
Thank you all. Have a good day.
Bye-bye. Thank you.
Thanks to all of you.
think. Is the mic working? Yep, good to go. Okay, a very good evening to you today, our audience here and everyone who's joined us online for this event. I know it's late in the day and it's coming towards the end of COP26, so it's wonderful to see so many faces here. I'm Professor Tassine Jaffrey, and I'm the Director of the Centre for Climate Justice at Glasgow Caledonian University, and I'm joined this evening by a wonderful set of speakers representing young people, Indigenous groups, women and girls on the front line of the climate crisis. And our focus is on climate change, climate justice, and a burgeoning mental health crisis. Globally, there is very little research that pays attention to the mental health impacts of climate change. The lack of data makes this a prolific and least understood area of study. The limited evidence base is a major barrier to addressing the problem. The knowledge and evidence gap that exists currently cuts across two domains: the health data set and the social data set, and more explicitly, the social and climate justice data set, human rights, climate inequality. And these two data sets need to fundamentally come together to help us make sense of the size and scale of the problem, but also to help us develop solutions that are much needed on the ground. So the focus of this event today, this evening, is to put the spotlight on the lived experiences of women's mental health and climate change experiences. We will then explore the development of a research framework for building further insights into how we tackle this knowledge gap. And third, we will discuss what needs to be done in terms of policy and practical solutions that can support the mental health needs of women and girls, as well as protecting their human right to life. So with that, I'm absolutely honoured and delighted to have our first speaker with us, Ashley Komanyapik Rose Cummings. She is an Indigenous rights activist for Inuit communities in Canada. She's a member of the Canadian Prime Minister's Youth Council, and she will be joining us online to just talk us through some of her experiences and that of the Inuit communities on the mental health crisis of climate change. So over to you, Ashley, if you can hear us. Welcome, and please, over to you. Thank you.
Namig, thank you. Unukut atiga komangapik panil tumutayang akisiani mana White Horse Mipunga. Good evening. My name is Ashley Cummings. My traditional name is Komangapik. I'm from Pangertung, Nunavut, Canada, and I'm currently living in Whitehorse, Yukon, Canada. As an Inuk woman, I feel it's very important for me to give context to how I exist in this world. My story is not unique at all, and it's the story of many Inuit and Indigenous folks as well, especially here in North America, in Canada. My hometown is very small, about 1,500 people, and much of everyone's lives are spent out on the land. And when the weather is nice, whether that's clear skies at -25 Celsius or overcast at 20 Celsius, as much time as possible is spent enjoying the land, hunting, gathering, enjoying each other while we're on the land as well. An unfortunate part of this is with colonialism came exclusion. The land is now accessed by those who can afford to do so. Not everyone can when poverty rates are so high in rural and northern Canada. We were forced into small communities and taken away from the nomadic lives we had lived for thousands of years. That took a toll on our mental health to begin with. On top of this exclusion, our land is changing vastly. Glaciers are melting, animals are found with enormous amounts of garbage in their stomachs. Our own garbage is typically burned instead of shipped out to be recycled or taken care of by other means of waste management. Because of these changes, our cultures and well-being are changing too. I grew up with caring uncles and hilarious aunts and loving parents. And despite that, I still suffer from depression and anxiety. Just weeks ago, I was hospitalized for a mental health breakdown. Fortunately, I live in a small city now with all the amenities I need on top of excellent access to land, as I live in a small, quiet cabin just outside of the city. I access where my well-being is best, even if it's not my traditional territory when I am out on these lands here. Many Inuit cannot access appropriate mental health care after such breakdowns, and we have few counselors in our regions and do not have addiction services existing in a culturally appropriate manner, which we do have issues with addiction as well. Inuit have suicide rates at 11 times higher than the rest of Canada. And for young Inuit men, these rates are cited as much as 48 times higher based on some studies. These are people who are being further marginalized by the government's lack of action on climate change, as well as a lack of drive for basic needs such as food and drinking water. I'm here to hold my government accountable, and thank you for hearing me.
Thank you, Ashley. And it's heartbreaking to hear your story there and your personal journey, and also it's sad to hear that you've had to that you have had a recent mental health breakdown. And I personally wish you speedy recovery, and we're here to support you in any way that we can. And we're going to do that support just by having this conversation at this event at COP26, and we hear your voice, and we are with you. So you've provided some, really meaningful and powerful insight there with the suicide rates. It's astonishing. What I would like to do, thank you, Ashley, for your contribution, is now introduce to you Peter Gondway, who's the Executive Director of Life Concern Organisation based in northern Malawi. This is an organisation that we currently are working with on trying to get some evidence and data on the mental health impacts of climate change. And he's going to introduce a short video that he has recorded for us to hear. So a very good evening to you, Peter, if you're there. Welcome to this event. If you would like to say a few words, and then we will show the video that you've kindly put together for us.
Yeah, thank you so much, Tassin, for giving me such type of opportunity to speak at this wonderful meeting. And I'm ready, and I'm happy to be part of this panelist. You can show the video, then I think I'll speak after the video. Thank you.
Ine ndine Linda Phiri fumira muzi wa Rowoka, Chief Principal Chimalabantu.
My name is Linda Phiri from Chimalabantu Village, Traditional Authority Mwankunikira, here in Rumpe District. I am 42 years and I have 8 children. I was really affected by the floods. Imagine my 2.5 acres of land was washed away. I grew groundnuts, maize and soya beans, but everything was gone. I did not harvest anything. I'm just staying as I am. I was really affected because what happened was a disaster on my life. Look at my family. How can I survive with such a big family without food? Then I started doing some piece works to feed my family. One part of me was telling me to kill myself, while the other part wanted me to get divorced. But through perseverance, I managed my situation up to now. Imagine having 8 children with no food on the table. What was I supposed to do? Oh, my parents are dead. I have nowhere to get the money. The major cause is that people are cutting down trees carelessly, a situation which has led to soil erosion, leading to floods. As I'm talking, I lost 6 chickens to floods. The whole kitchen was full of water. My house developed cracks because of these floods. After the incident, there was no peace in my family. When there is no food in the house, children suffer, you know that. We received rice, salt, beans, and a basin. We faced a lot of abuse from chiefs. They told us to share our relief items with other people that were not affected by the floods. At the moment, I'm still facing a lot of challenges in my life. When I get money, I invest in my potato selling business. I pay school fees for my child who is at a community secondary school. Things are not okay with this coronavirus. Look at how the environment has been destroyed, and the coming in of coronavirus is making our lives very difficult. You can't make money through business because people also have no money at the moment. I sell potatoes, but the pandemic has disturbed a lot of things in our day-to-day life. People no longer buy things. There is a lot of gender-based violence in our families, communities. Men are not supporting us. For instance, my husband has been sick, he's psychiatric, for a long time. He can no longer support me. That means I have to look after the whole family, myself. There are a lot of abuses in these houses. Men are no longer supporting us. I have been abused by my husband. I have been patient up to now. He has been beating me, but with the coming in of non-governmental organizations, now he has stopped. I need food. I need money for school fees. I need financial support for my businesses.
Chakwamba kuti vanifizira mwana fees ningakondwa chomene. Then ine nani kuti vanipasa support ya kupanga top up business yani napo ningasangara chomene. Ine ndine Linda Phiri kufumira mmuzi wa Rowoka, Chief Principal Chimalawantu, TA Mwamuni.
My name is Linda P.
Thank you, Peter. I wonder if you could just spend 1 or 2 minutes just describing, just describing how difficult it is to conduct research in this area.
Yeah, thank you so much, Tassin. Indeed, disasters in Malawi and Lumbi district where I come from, every year we experience disasters because of climate change. And usually we experience some floods, landslides, and storms. And whenever these things happens, usually we go to the communities and we support them with the relief items. But there are two problems which we don't address usually, and most organizations, they don't address those problems. That's gender-based violence and issues of mental health. Because people are traumatized, people are affected, gender-based issues, they are rampant, and yet no organization addresses these problems. So people, they suffer with mental health issues within their minds, and nobody comes in to address those problems because we are always looking at the relief part of it. We want to see people, they should have food in their houses. What are they going to eat? What are they going to dress? But we forget about gender-based issues. We forget about mental health issues. So at the end of the day, the story of Linda, you find that Linda wanted to commit suicide after the disasters because she lost everything. And yet no one talks about that suicide issue. No one addresses that problem. So this is the challenge that at least together, we need to look at it as development partners to see what can we do in relation to mental health whenever we have disasters in the communities. Thank you.
Thank you, Peter. And your voice is loud and clear. The message that video, the farmer there, that she was, it's so heartbreaking. And I think it's so abundant, as you said there. We're looking at, growing crops. We're looking at all infrastructure, but we're forgetting about the invisible, what you can't see, which is a mental health crisis that is burgeoning due to climate change. And what I would like to do is now hand over to Jacinta Silakan, because she is sitting in front of our audience here, and she has experienced firsthand what it's like to deal with gender-based violence and mental health. And I know it's hard to talk about that in just a few minutes, but she'll convey some very important and key messages, which I think the world needs to hear. Jacinta.
Thank you very much. My name is Jacinta Silakan. I come from Kenya, an organization called Sangida Foundation, which advocates for the rights of women and children with disabilities. My story is I come from the Maasai community, and I experienced GBV firsthand as I got married at an age of 12 years. My sister, who is elder, got married at 9 years, and she accepted to stay in marriage. I stayed in marriage for 11 days. I was married for 11 days, then I ran away and went back to school. I completed my college, and my father and my relatives had nothing to do with me because of disrespecting them. And then after I finished college, I got a job. Then I got married to someone that I loved, and then I had a child, and this child had disabilities. And the community could not forget. They said that I got a child with disabilities because I disrespected my father. So it became a burden, and my child was called a child of sin. And since then, I've been going through trauma, I've been going through stigma and discrimination. No one talks about, no one wants to know what you're going through as a mother with a child with disabilities. They imagine everything is okay. They just imagine okay. They never want to know. No one finds out, how are you? How do you cope with a child with disabilities? This is the stories that I and many other mothers with children with disabilities go through among the pastoralist communities. There is no forum, there is no voice, there is no platform for us to be heard and to be listened to. With climate change, it makes it even worse because now the droughts are becoming worse, and it takes even worse for for a mother with a child with disabilities, because the rest of the family, they will move with their cows. So they will move away with the resources. And then the mother with a child with disabilities will be left alone with no resources. So this mother will see her child every day dying of starvation. They get severely malnourished. They have nothing to do. You can imagine the trauma of that mother, seeing her child fading away every day until one day when they die. These are the trauma, these are the things that people don't talk about. We are talking about the big things, and yet the things that matter, the mental status of those women is what matters a lot. And I have not heard in this COP26 people talking about the mental status of people, and especially people with disabilities. Mental health is important. Mental health is real. We are going through issues, and these things needs to be addressed right now. It's now, it's now, it's urgent. Thank you.
Thank you, Jacinta. And my heart goes out to you. And you're very, very brave to have come through your journey. And I find it hard personally to be able to chair this event and this conversation, because these women that we're speaking to, they're not just presenters for me on this panel. Indeed, they are my friends and colleagues. So it's challenging to run this conversation. But like I said at the beginning, we don't have the evidence. We don't have the baseline. This is a conversation that is missing across all of COP. It's never been raised, and we have to talk about this to protect women and come up with solutions that will give them the support that they need. And in terms of, so Peter and Ashley, I'll come back to you just shortly, but in terms of getting the support we need that evidence base, we need that insight. So I would like to introduce Runa Khan. She's founder and executive director of Friendship, an international social purpose organisation supporting remote vulnerable communities in Bangladesh. So I'm sure in Bangladesh, also Runa, you have heard many accounts of the trauma that women are experiencing. But I wonder if on this occasion, you can maybe talk us through how do we begin to get this evidence base off the ground? Where do we need to start with this? It's such a difficult thing. Where do we begin?
Thank you very much, Tasin. I think today's panel is extremely important, because at the forefront of everything is that one individual. And it's that one individual that in these big communications and in these big conferences and people communicating on, they forget. And every life matters. I mean, we need to start with that responsibility. So 20 years, I've been working with climate migrants. 20 years, I never said that we work with women only or with children only. We work with everyone. in doing everyone, what do we find? We find providing health, 80% women, providing education, 60% are women, providing those who need aid and relief, 80%, 85% are women. How does this happen? When we have governance work, when there is something which broke my heart, and I understand, because what we saw during this COVID time, all my 20 years of work seemed to be for nothing, because child marriages just skyrocketed. Nupur, 14-year-old, father can't feed her because they've got 4 children, marry them off. 20 years older, father's friends, she's married off. You know, you have old men, you have even young men who know, aware that they shouldn't marry, but they marry once, twice, 3 times, leave the wives, go away. Result, fistula operation, for example, if a woman needs it, socially totally ostracized because of the migration during climate events, they cannot have it. Whole life, an 18-year-old girl can be socially ostracized. And this is a reality. And you come, Tahseen, as you said, we come from a place where there are no data available. We work with gender-based violence. You know, we have the Rohingya communities, 1 million people there. We have people in these migrant communities. We are kind of working with 7 million people are accessing our services every year. But in this, the most difficult part is GBV and mental health, because we really do not have any mark on which to start and how to approach these people. Over the last 2 years, we have been working very strongly with this, with the GBV, women, and also with mental health issues, MHPSS, and we found that working through the communities or with people who the communities are trusting has started to bring in results. So we make people within the communities the operational or the heads, and then because they get the trust of the communities a lot more than anyone coming, and these are things you don't speak on. And when an organization or an academic field comes in, or from research they come in, or people want to hear, it is just impossible to actually get the truth. So we started bottoms up, community women telling community. And then we have a supervisor who would go and get data from there. And then that would move up to another level, incorporate it. We found within our little scope, 68% of the women have got some sort of a mental issue, some difficulties, either tackling children. I have had women coming to me with a child saying, doctor has said there is nothing I can do. Should I kill my child? Because she just doesn't know what to do. You see? And these are things we are faced with daily. These are things that we see daily. And it is impossible to work on something a bit more global, a bit more national, unless we have pure scientific data to work on. You can go and ask any questions in the field. You will get a lot of answers. You think you can base your evidence on those replies. It doesn't work like that. I give you a little example. Once I go into a community, and I ask, how many children do you have? Two. Everybody's got 2 kids. The whole island is filled with children, hardly any grown-ups. Then I asked, okay, how many children do you have? Actually, do you have any child beyond these 2? Oh, yes, 2 of them are married. I have another infant in the house. So there are 5 kids, I get 2. This is the reply which continuously happens, and difficulties of collection of data. So thank you very much for bringing up this such important, work to the forefront.
Thank you, Runa, for that. And before I turn my attention to Steve Trent, who's the CEO of the Environmental Justice Foundation, who'll give us some insights into collecting, not collecting, but pulling together that evidence and insight, particularly for those who have migrated due to climate change. It's another layer of complexity. But I'm wondering, before I go on to Steve, Ashley, if you're still with us, if I can rope you back into the conversation just now. Ashley, can you give us some thoughts from your perspectives, from your experiences? Where do you think we should be starting in terms of generating that evidence and that insight from a climate justice perspective? Because what we're hearing is that this is a huge injustice and a huge injustice on people's right to a decent quality of life. So Ashley, I wonder if I could bring you back into the picture and give us some thoughts on that.
Absolutely. I think that Inuit are such a prime example of the ways that mental health is really impacting people, especially in how tied it is to climate change and climate justice, especially growing up so connected with the land, growing up, spending as much time on it as possible. That was where I got a lot of my well-being, and that's where I continue to get a lot of my well-being. And even just seeing the mental health crisis that's happening for Inuit right now, for Indigenous groups across the Arctic, I think it's evident that our climate is changing so deeply. And of course, that's impacting us. Who are we without our land and without our culture? They're intertwined. They can't be taken apart. I'm so thankful that I am very connected with the land, and we need to continue supporting that. But with the climate change and climate justice, it just gets more and more exacerbated on our mental health because, we can't access the land as much as we would like if we have the means to even do that. And then the lack of action on the government's part, at least in Canada, is just so frustrating because I witnessed these changes firsthand. I witnessed trees falling over because there's too much snow in this desert climate in Whitehorse. I see so many different issues coming to light every day. Whereas when you're in larger cities, whether that's Toronto or Vancouver, you don't necessarily see it other than poor waste management, for example. And so Inuit are almost this unfortunate case study on how poorly our mental health is doing, how little access to resources we have, and how the government's inaction on climate change is continuing to exacerbate these issues and perpetuating all of these problems for Indigenous peoples who already don't have access to proper physical health care, let alone mental health care.
Thank you, Ashley, for that. And I'm wondering, as you're describing their case study, Peter, if you're with us, if you could just talk us through some of the challenges that we faced in setting up our research in northern Malawi to begin to document scientific evidence from the lived experiences that women are experiencing on the ground, and it kind of lifts the conversation from what Runa has been explaining there, how hard it is to just get to that insight, but somehow we need to translate those stories into information that can be used by policy and decision makers. Peter, could you just give us a few steps as to what we are doing and the challenges that we faced in getting our study off the ground?
Yeah, indeed, there are a number of challenges. I think one of it is a lack of data. There's no available data in terms of mental health and GBV in relation to climate change, and that has been a challenge to us. So in setting up our research, what we did was to come up with the policymakers together so that at the end of the day, we can plan together and look at the issue critically to say, what are the real issues that are affecting the community in relation to climate change, but also we are looking at the GBV. So currently, I think we are having very good positive response from different types of stakeholders, policymakers from the government, and other even universities. They are coming in to support us, but also in the community. But now the challenge is when you go to the community, you talk about mental health. People, their mental health is associated with stigma and discrimination. So automatically, people, they will not talk about mental health directly. But if you look at the issues of gender-based violence, but also associated issues that are relating to climate, to mental health, people are able to mention. issues of trauma, issues of suicide and the like, then you are able to link up to say, yes, I think there are some mental health issues in the community. So currently, our study, we have started with the baseline, looking at the two communities which have been heavily affected with the climate change, the intellectual part of Malawi, Chalo area, and the other area which has also been affected with floods, as you have seen the video, the community where Linda comes from. So these are the two study areas that we are focusing on. And at the end of the day, we want to see, maybe we can also come up with the data that other people, policymakers can also start using. Because currently, even when you are looking at the response initiatives, they don't address mental health issues because we don't have data. So that's the major challenge. I believe the research that we are going to do will lead us, it's a step ahead towards addressing mental health issues in our country, Malawi. Thank you.
Thank you, Peter. And indeed, it is. You know, it was. I'll have to be very honest. Just to get a small study off the ground has taken an enormous amount of time, an enormous amount of energy, and an enormous amount of convincing, which is very, very hard when these stories are so real, but also very hard to convey to others, to say, we need to get this work done. We need that insight, because if we don't have it, then we are facing a burgeoning mental health crisis for women and girls. So we will have opportunity for questions from the floor. But what I would like to do is just ask Steve to come in quickly. Steve Trent, CEO of the Environmental Justice Foundation, to give us a few perspectives on where do we even begin to look at the mental health crisis amongst those who are migrating and displaced due to climate change. Steve, a very warm welcome this evening.
Thank you very much. I think the first thing I want to say is thank you to my fellow speakers. I think it's very brave of you, and it's not easy. I can't imagine. So thank you for that. And for me, it's very important to learn to hear those voices. I think this has been one of the big lessons at COP26, that we need to hear more of these voices. And they need to be in the negotiating room, may I say. I think that is fundamentally important. I think the first thing that I wanted to put to this meeting was just to give some idea of the scale, actually, of what's happening, because I think we need to put it within the framework of what's going on. And so just a few key figures. If we look at what's been going on in reasonably near history, since 2008, weather-related hazards, which are increasing in frequency and severity as a result of the climate crisis, have forced over 21 million people to leave their homes each year. That's 41 people every minute. And that figure does not include those that are forced to flee due to slow onset climate events such as desertification and sea level rise. Now, for me, the critical point in this is that 95% of this displacement and 99% of all deaths resulting from weather-related disasters are occurring in developing countries. And if you look at that and you understand that in the 20 countries that are deemed most vulnerable to the climate crisis are also mired in long-term conflicts, places including Yemen, Afghanistan, Democratic Republic of Congo, Somalia, all of which have large populations of internally and internationally displaced people. And then if we look into the future, we've heard from the Climate Action Tracker this week that the current actions that are being taken still put our planet on a path to a 2.4 degrees increase. So what does that mean? You know, these are kind of rather bland figures, but at 3 degrees of global heating, we will leave 3.5 billion people living outside of the historically habitable temperature niche for the human species. Now, when you think of people that are forced from their homes, and we've interviewed many in many different geographies around the world, talking to them, trying to understand the nature of their plight, how they're responding to it, what help they need, I confess we had not looked at the mental health dimension. And I think it is a huge gaping hole. I mean, I look at this and say, how can you access any healthcare? But mental health care in particular, it's important. When you've been forced from your home, you've lost your livelihood, maybe you can't feed your children, you have been removed from the context of the geography you grew up in, the culture you grew up in. What does that do to your mental health? It's devastating. The other point that I think is very important, which has already been touched upon by one of the speakers, is the fact that it is women and children overwhelmingly that are being impacted by this. And we see that again and again and again. We witness these problems happening in any geography we look at. And it can be in actually wealthy developed countries and as well as those that are developing and have less economic resource. So I can't speak to this issue as a mental health expert, I'm not, but I can speak to this as somebody who has for the past 20 years documented what is happening to climate migrants, climate refugees, call them what you will, then the impact of our heating planet on primarily poor and vulnerable communities. And I think what it is crying out for is far greater ambition, far greater action. And I will finish where I started almost. We need to hear the voices of the people that you have brought together here at this meeting, at this convening, and to understand what the impacts are on each individual, on their well-being, on their security, on their ability to feed, clothe and house themselves, and on their mental health. And I hope that we can see far more action and far more money dedicated to these issues to allow us to develop the baseline studies, the scientific data and the framework, which will deliver the architecture, if you like, in which solutions can be developed and which answers can be given. So I'd like to thank you for inviting me today to speak. I feel unqualified, and I would actually like to hear much more from your fellow panelists. So thank you, and I will finish there.
Thank you, Steve. Indeed, the figures, though, that you've presented speak volumes, and it just puts the perspective on the scale, the unimaginable scale of the disaster that is upon us. And it's difficult when you hear figures like that. It's difficult to think about how we need to still be on the defensive to try and get work and funding to get this work off the ground, not just for the evidence, but indeed for the solutions and the support that is needed by women to get them through this crisis. So we'll open up to questions. If you have any questions for any of our panel members, please do raise your hand, and now's the opportunity to do that. If you would like to ask a question of Jacinta, Runa, Peter, Steve, Ashley, the floor is yours. Yep, there's a question at the back there. If you can, I want to try and get in as many questions as I can. So if you can say who you are and who you're representing, and then your question.
Let's see. Can you all hear me?
Yeah, we can.
Okay, perfect. Hi, my name is Karan. I'm an undergraduate student at Vanderbilt in Nashville in the United States. My question is, a lot of you mentioned how it's very important to amplify these stories, especially just, making sure that these voices are being heard. And I was wondering, what would you say are the best next steps to take beyond just looking at policy? Because I know you mentioned getting these voices in negotiations, but I think at the same time, it's also important that we engage in greater conversations and discourse beyond just looking at policy, and to I guess achieve that cultural shift where mental health becomes something that we're more comfortable talking about collectively as people. I was just wondering where y'all think we should get started with that.
Yeah, thank you, Karen, for that. And if you don't mind, I'll direct it to one of my speakers, because then we can get in more questions that way. So I'm wondering, Jacinta, whether you could handle that question. So it is about going beyond policy. This is more about how do we talk more openly about mental health, particularly in difficult and challenging circumstances, and so you're not stigmatized.
For me, the best approach here is on sensitization of mental health to the community, to the grassroots level, so that everyone understands that mental health is not a stigma, because again, at the community, when you start talking about mental health, they will start thinking it is stigma. So, but when they are educated, when they are sensitized that you can open up, you can talk, bring people together as support groups so that they can support each other, then I think this issue of mental health will be better. Because for me, like, I went through for many years, maybe over 20 years, I didn't talk about what I was going through until one day when I got someone who took me through it, and I felt that it is very good. And I went back to the women, the support women group, and we came together and we started talking about our journey of what we go through as women with disability, with children with disabilities, and we felt like there was a relief. And so talking about it and sensitizing the women to keep talking about it, I think that is the first approach we should take. Thank you.
Thank you, Jacinta. Any other questions? We've got any other questions for any of our panelists from the audience here?
Hi, I'm Caroline. I work with Médecins Sans Frontières, Doctors Without Borders. And in a lot of the locations where we run medical or humanitarian aid projects. Can't hear? Can you hear me better now? Okay. Sorry. So in a lot of the locations where we run medical or humanitarian aid projects, we are seeing a growing burden of mental health. In a lot of the locations, there are also hotspots, climate hotspots, but it's very hard to set up a program that both gives you a baseline and then also can somehow find the attribution science. Do you have any advice?
Yes, I'm wondering if I could hand over to Runa on that, and then I will come back on that. Runa?
It's a mapping. So we do mapping of all the vulnerable climate impacted migrant movements, areas which are most impacted by the climate issues in Bangladesh. It's quite easy. You have all the rivers, you have the coastal belt, and you have some hauer lands, which are like flatlands, which become like the sea in summer. Those are the areas where you have the maximum climate impacts. Put the map of our working area are all there, and on that you put in the health issues. It's just a question of mapping. And I think it works fairly well doing that.
Yeah, I think what you're dealing with there in that situation is moving targets, right? And it's very hard to compile an evidence base when you're dealing with social construct and movement of people, because what you need the baseline for is to establish what's happening on the ground, and then to overlay that with solutions to try and establish change on the ground. But I think what is important is to include that in the approach and the methodology as you begin to understand the dynamics of on the ground. And I think, let's be honest about this. Just because it's a moving target doesn't mean to say we shouldn't try to begin to work on that. And like I said, the research in this area is so thin on the ground. I think at the moment, at best, what evidence is out there is scant, and it's in bits of literature. But what isn't out there is the evidence from the lived experiences. And however challenging it is, we need to start even if it means developing the approach, developing the methodology and coming into this from an academic lens, it does take time. It's not something that can be rushed into, but if it's done well, then the results will speak for themselves.
Dasin, if I may just add something to this.
Sure.
It's a question of working in coordination and solidarity. You know, people working at the field with the academia, with the research scientists, with the climate scientists, with the researchers, you need to work in coordination. If you are going to work in silos, we will never get the results, you know? So I really believe that we're doing it that way also.
Thank you, Runa. Anyone else got a question for anyone for our panelists this evening? Any thoughts? Yep, there's a question at the back there.
So much to all the speakers. I'm Catherine. I was interested in the video about the influence of NGOs and sort of the positive outcomes of just like, I don't know if it was accountability, but in addressing gender-based violence. And I wonder if you could address sort of what are those enabling forces that NGOs on the ground, whether it's climate or environment or animal health or human health, can kind of do to create that positive norming, I guess.
Yeah, thank you for that. I'm wondering, Peter, if I could bring you in here, because it relates to the video that we showed from Malawi. How do we look at this, creating enabling forces? I guess what we're talking about is how do we create change on the ground? How do we use our insight into developing that positive support service and provision, and that's exactly what our research is about. Peter, could I bring you into the conversation to talk about where we intend to go once we have gone through the journey of collecting that evidence?
Yeah, thank you so much. Thank you because of the question. One of the areas that we are looking at is organization. They are based, they are working with people and they stay with people in the communities, and they are able to know the problems that people are facing. So currently, I think our research, as Tasina said, we are also looking at the GBV as well as mental health. And what we are doing with mental health, we are working with medical team who are trained in relation to mental health issues to offer support services to those who have been those who are showing signs of mental health or they are raising challenges in relation to mental health, so that at least they can be helped and they can be supported. So at the end of the day, we'll be able maybe to come up with other methodologies to say whenever people are coming up with such type of problems, how do we support them? Thank you.
But I'm also wondering if I could bring in Ashley, because she talks a lot about counselling and support service. And indeed, Ashley, you've had to reach out to counselling and support yourself, and really appreciate your personal experiences. But how hard, what's missing in terms of counselling and support as you see it for young people on the front line of climate crisis?
In many communities, mental health support doesn't even exist. In my hometown, we don't have any mental health nurses. We have a few social workers, but the turnover rate is very high. My mother was a social worker for many years and had to leave the job because of how stressful it is, especially in a small community where everyone knows everyone. And so there are so many different ways it's exacerbated because mental health care simply doesn't exist in rural and northern regions of Canada at the very least. You know, I'm lucky that I live in a bigger city, so I have access to a number of different healthcare, but you know, that's just me. That's not the thousands of other Indigenous youth that are suffering on, whether it's on reserve or in their isolated communities. There's just a lack of access entirely, and we need to change that. We've been needing to change that for decades. You know, my hometown, since 1999, the creation of Nunavut, has only had 1 year where no suicides happened in the community. That really shows how exhausting the existence can be without access to healthcare, whether this is through, you know, counseling services, addiction services, or simply having access to the land by being able to be supported, whether it's to buy gas to, you know, take your skidoo out on the land, or pay for to borrow someone's boat for a couple hours. whatever it may be, that helps a lot. And unfortunately, with our nutrition programs, Nutrition North Canada, it subsidizes certain foods that are essentially rotting because the produce freezes on its way north, whether it's being flown in or shipped in, and then it's essentially no good. So that's being subsidized, but it doesn't even take into account the traditional diets of Inuit. And so we eat entirely meat diets pretty much, especially in the winter. And so that adds that extra layer of stress where we're not eating what our body is, ancestrally streamlined to eat. And so that exacerbates the mental health crisis even more. There's so many layers, it's hard to know where to start, but at the very least, we can start supporting the people. And that needs at the very least.
Thank you, Ashley, for that. And yeah, we need to start supporting the people. I mean, you said it. You said it right here. Particularly women and girls, physically and mentally. Thank you, Ashley. We have another question down here at the front.
Thanks very much for your stories. It's really. Thanks very much for your stories. It's touched me, I think you've touched on the kind of services that would be helpful for women and girls, but I wonder what services would be helpful to work with men so that they can address their behaviour to prevent problems where that would be possible.
Thank you for that. And Jacinta, I wonder whether you could give us some perspectives on that.
Yeah. I think the solution here is to work closely with men, because many times they are the perpetrators. Among the pastoralist communities, we are a patriarchal society. The men are the decision makers. And as much as we want to empower women as much as possible, if we do not loop the men into these conversations, then there's nothing really much we are doing. So for me, it's also bringing men on board. Let them understand. Let's listen to them and work together. And then this probably GBV will reduce at least. Yeah.
Thank you. I'll come to Runa in a second. Steve, I wonder if I could loop you into the conversation here. If you'd heard the question right, how do we deal with men's behaviours? And I know you're not a mental health expert, but just from what you're seeing across the migration and displacement lens, could you have any perspectives on that?
Really, I don't have any critical insights other than to say, we do see the abuse taking place. I think while men can be victims too, they can suffer from the impacts of global heating and mental health. We see a lot of suicides. I think that was mentioned before, and we see a lot of bad behaviour. I think one of the critical things that I would highlight about this is that where you have the impact of climate change manifesting, it tends to interact with and magnify other stresses. And those can be social, economic, environmental stresses, obviously. And that's what can be the critical factor that pushes somebody over the edge. So I think, I hate to say this being so reductionist, but coming back to our governments and saying more, better, faster. And as I mentioned before, I want to see finance going into this. We have the economic muscle available to us, certainly across the G7 and G20, and there should be more money put to this. And then the last point that I would say, which references this question and another question, is I think we have to address the mental health dimension with a coordinated, intelligent, culturally focused set of communications campaigns. We need the big picture at a global stage like COP26, and it's brilliant what you've done here, convening this panel and bringing these voices. But we also need campaigns at national, local, and micro levels to bring awareness and sensitize people about this issue. Without that, I think we will continue to see the problems and troubles that have been so eloquently described by my other speakers.
Thank you, Steve, for that. And it is certainly our intention to do whatever we can to mobilise work, research, social change to get the support that's needed off the ground. And whether it's and it's through campaigning, we need we need to work in those partnerships. It's a multi stakeholder, it's a multidisciplinary issue, and there's no one organisation that can do this together, but we will do what we can to push this conversation. So Runa, we have a question. I will direct that to you, I think, probably. Do we have...
Thank you. Sofia, I'm from Chile. I'm sorry if my English is not the better. My question is, I work in an NGO about climate litigation, and my question is if any of the panelists has some approximation of the mental health in issues in climate litigation, because we work with communities, we work with a lot of women in climate litigation that suffer a lot of injustice, because you have like 5 or 10 years of litigation that it's really tiring and it's really devastating for the mental health, because you not always, and the most of the times, you don't have the results you want, and it's very depressing for us as advocates, and two, for the communities that sees that in this period of time of the litigation, sees their environment being destroyed, and then they see that the justice in their countries, most of the countries in the global food don't have the results that should have. So do you have some approximation on that?
Thank you for that question, Runa. I wonder if you
Very
can take
briefly.
that. And I know you wanted to comment on the previous one as well.
Go
ahead.
little thing previous.
Please.
We have seen over 15% cases of sexual abuse with men happening in the Rohingya camps especially. So we have the gender-based violence and the GBV also geared for the men, not only for the women. But of course, women cases, as I said, was over 68%. So we need to deal with that. And regarding the litigations, climate migrants have litigation in many things. I mean, they need intervention, legal interventions in many things. As I say always, you cannot you need to understand the climate injustice before we go into climate justice. And this injustice is on them for health, for land issues, for domestic violence. They don't know where to go. So we start from the root. At the field level, we put in paralegal aids and link the paralegal aids to the mainstream government issues with our own system of having lawyers and who can carry it right up to the courts. But you are totally correct. It's extremely difficult, and many times the migrants are moving, so it doesn't continue, and the people who have who are at fault escape. And this is a very big issue. Thank you for bringing it up.
Thank you. And I'm just noting the time here. I mean, we're almost out of time, and indeed, an hour is not justice in itself to talk about this subject matter. But all that remains for me to do really is to say, to give my sincere thanks to Ashley, to Peter, to Steve, to Jacinta, and to Runa. And I'm getting quite emotional about this myself, because it's a very, very hard thing to convene and to hear those personal insights. But I think it's upon us as women to speak out and to speak as loudly as we can, to mobilise this conversation, and let's hope that we will get the support that we need for the women on the ground who are suffering enormously because of the impacts of climate change, and they have done nothing to contribute to that. So with that, I just want to thank you for listening, for attending. I know it's been a long COP, and this is probably, it's a late evening, but please do, keep in touch and let us know how we can work together. So my sincere thanks to everyone, and a very good evening.